We are now on Senate File 4699. Senator Wiklund.
Thank you, Mr. President. I am excited to be presenting the HHS Omnibus Supplemental Budget and Policy Bill. And I'm very happy to be presenting a few of the highlights of what I think is a wonderful bill and highlight some of the provisions that we've included to target several priorities that are very important to supporting health and well-being of all Minnesotans. First, I'd like to highlight our ongoing laser focus on building a more comprehensive and accessible mental health system. We invested approximately $180 million last session in mental health, and this bill follows that work with over $30 million to do several things. One is to provide another boost to mental health reimbursement rates paid to providers and hospitals across the state. Another is to expand access to school-linked mental health, respite services, and other services in the community. And we also have included funding so that new benefit pathways can be developed by the Department of Human Services in our medical assistance program to allow for providers to bill for services that they are already providing but don't have a mechanism within our medical assistance program to do that. We also know that there is more work to do. The Department of Human Services rate study that was released earlier this year recommends some strategic overhauls to simplify how we structure all of our reimbursement rates across our public programs, and urges us to move us to Medicare reimbursement levels as a floor to pay providers. I have carried a bill this session that reflects those recommendations, and I'm proud to have found ways to implement some first steps as we work on raising these rates, and those are included in this bill. I also plan to bring the bill back next year, and will ask for your support in continuing to move the needle on this critical need. The bill also has a focus on equity in our healthcare and child welfare systems as we work to ensure every child and all Minnesotans can thrive, no matter their race, gender, or ability. Included are critical updates to the Minnesota Indian Family Preservation Act to facilitate compliance with ICWA and MIFPA that began work last year, and tribal participation in hearings. I'm also thrilled to have included in this bill the new Minnesota African American Family Preservation and Child Welfare Disproportionality Act that was authored by Senator Champion. And that will begin to address disparities families face in the child protection system, and it aims to maintain family connections. This legislation is long overdue, and I couldn't be more pleased to be able to carry this forward in this HHS Omnibus. Also in this bill are provisions that will increase and remove barriers for Minnesotans seeking medications for prevention and treatment of HIV. There are also insurance coverage expansions that guarantee Minnesotans with limb loss and limb difference have fair access to prosthetics and orthotics. We also have provided a new way to improve access for patients in public programs to receive game-changing gene and cell therapy treatments as they become available, including recent treatment that has become available for sickle cell disease. The bill also contains several grants supporting maternal and infant health, including grants supporting American Indian and African American birth centers, and also support for breastfeeding. We are also combating the issue of food insecurity. This bill provides provision that a new summer EBT program that will help us draw down federal funds to support to provide new support to families during the summer months. This provision, the state component that we contribute to set this up will allow us to draw down approximately $50 million per year, and this will go towards about $120 per month per child benefit and grocery benefits. We believe that this will serve 400,000 families, or 400,000 children whose families struggle to provide food during the summer months when their children are off school. We also have critical funding for food banks and food shelves, including funding to support the Tribal Food Security Program. This money will help to enhance the work that these entities do as we struggle to meet the incredibly high need for food. We know this funding is not enough, but we must do what we can this year to address rising rates of hunger for Minnesota families. This bill also tackles food insecurity for college students by expanding eligibility for the Supplemental Nutrition Assistance Program, because as we in this chamber know, it's hard to focus on learning without access to adequate and nutritious food. This bill also includes a continuation of some of the less glamorous work we did last year, modernizing the critical IT infrastructure upon which so many of our human services programs depend. This chamber may remember last session when we invested tens of millions of dollars to upgrade aging human service systems for healthcare, childcare, and other economic supports that state and county workers and Minnesota families use every day to facilitate and access vital programs and benefits. IT is no longer a nice-to-have complement to the work that we do in human services. It is the foundation upon which our state agencies and local government partners carry out their missions. And modern systems are what Minnesotans expect and deserve to see when they access services. We started exploring last session how to modernize another critical system, the SSIS child welfare system used by county workers in every county in Minnesota. This bill now includes a significant down payment to the department to overhaul the SSIS system and start drawing down matching federal funds. We can finally begin to free up valuable time and save unnecessary headaches for our hardworking and dedicated county child welfare staff and provide a better experience for families and children in the system. I acknowledge we are unable to provide separate funding this session for counties to address IT needs, which are critical and necessary to being able to successfully support county workers and in turn families. We heard compelling testimony in a bill that Senator Kupek brought forward, and I pledge to bring forward these discussions next session. I remain committed to this work because it helps us make government work better for Minnesotans and lays the foundation for the policy reforms of the future. This bill also sets in motion critical health care reforms that help Minnesotans get the care they need and creates a more fair and transparent healthcare system. We know hair loss for many patients battling cancer can have a significant impact on their well-being. This bill includes an expansion of coverage for wigs for Minnesotans going through cancer treatment. Because cancer can take so much, and this small change will mean an enormous amount to the people this bill touches, as we heard in testimony from one of our members, Senator Dziedzic, who carried the bill. We are also taking steps to further rein in prior authorization processes that can sometimes stand in the way of patients receiving the help they need and creates frustration and time pressures on too many healthcare providers. Also included are exciting new protections and reforms for consumers facing medical debt, a return to a Minnesota that supports patients over corporate profits through restoring the requirement that HMOs be nonprofits, and additional oversight over HMO financial transactions to bring greater accountability and transparency to a healthcare system that is getting even more ever more expensive and complex. We are also supporting and expanding our world-class healthcare workforce and provider infrastructure. Minnesota has long been a leader in the nation, and this bill continues pushing us to aim higher. Included in this bill is a new innovative way for the state's teaching hospitals to draw down millions in new federal funding for medical education programs. We are also bringing forward several provisions that relate to the U of M Academic Health Task Force recommendations. One recommendation is to create have the Department of Health create a report on how we could implement healthcare workforce advisory council in Minnesota that would help us with healthcare workforce planning and bring together the data that we are now collecting but not analyzing and bringing forward recommendations on. We are also include a request for information proposal that will help us evaluate state healthcare needs and capacity and projections of future healthcare needs. This is a way to utilize all of the different healthcare resources we have in this state, along with the University of Minnesota, and collaborate on really expanding and developing a world-class healthcare system in Minnesota. Also included in the bill are steps to support struggling community pharmacies that are vital to the fabric of our cities and towns across Minnesota. We do this by increasing dispensing fees, by allowing pharmacists to continue with their vaccination authority that has been in place for the last few years, and by developing new procedures to allow pharmacists to prescribe HIV drugs. Members, you may be surprised to know that I could go on for many more minutes about the great things in this bill, but I will stop here, and I'll sum up by saying that I am really grateful to have worked alongside many of you to create this bipartisan bill. There are bipartisan authors for provisions in this bill, and I really appreciate the work that we did in committee to hear and understand and bring this bill forward. So I appreciate the respectful debate and discussion that we had in the Health and Human Services Committee on these items, and we were able to include many of your great ideas in this bill. Despite a shorter session and less budget flexibility than we had hoped, I absolutely believe this bill represents what is achievable when we work together to meet challenges and imagine what's possible. I look forward to hearing your questions and your discussion. First, I would like to author a technical amendment I have, which is the A70.
Senator Wickland offers the A70 amendment, and the Secretary will report the A70 amendment.
Senator Wickland moves to amend Senate File Number 4699 as follows. Page 152, line 19, after the period, insert. This is the A70 amendment.
Senator Wickland to your A70 amendment.
Members, Mr. President, members, this amendment is a technical amendment. It includes technical assistance provided by the Department of Health and the Department of Human Services. It also has some technical corrections to language and figures in the bill, and then it also corrects an issue that an error that came up when when an amendment was put on in the Finance Committee. So I would ask for your support for the A70.
Any discussion on the A70 amendment? Senator Utke.
Thank you, Mr. President. And for members of our Republican caucus, this was the issue that Gary Dames brought to us, Senator Dames, a day ago, that this is a good amendment. I'd ask everybody to support it. It corrects the aggressiveness that was made happened in finance, where they took out a little bit more than they were supposed to. So, thank you. This is a good amendment.
All in favor of the A70 say aye. All those opposed say no. The motion prevails and the A70 is adopted. Senator Wickland, anything else, or should I go to Senator Abler?
Well, thank you, members and Senator Wickland. It's a lot of work putting a bill together. Some of us know how hard it is, and I appreciate the efforts you put in. There are a lot of good things about this bill, which will make it better. I think probably, Mr. President, probably the thing I'm the happiest about is the thing you're the happiest about, which is the African American Family Preservation Act, which I think, if anything in this bill is going to make a difference for anybody, it's going to be that. There's been a pilot that's worked. This has been going on since Senator Hayden was here, and you worked with him on that, and finally it's moving over the finish line, and I'm of anything in the bill that I'm pleased that we spend some money on. I think this is something that's really going to show some fruit in keeping families together and keeping those young people on the right track. So I'm really happy to celebrate that. And Senator Wickland, there's a ton of nice things in here that I heard you talk about, and I think you can be happy with some of those. But I just want to comment about the temptation that seems to happen here, Mr. President. It's not Temptation Island, but it's Temptation Government. It's really fun to add new things and to, wow, look at this shiny program, not the African American Preservation Act. That's a critical program and a long time coming. But last year's bill had countless numbers of new programs, and we don't even know if they work or not. We spent a lot of money on them. This bill spends about $100 million over the 3 years with repurposing money that was sitting there and so on by my calculation. But there's some legacy things we have to do, Mr. President, that actually the governor seems to have a hard time noticing. One is keeping hospitals secure and the problem with boarding people in hospitals, which is crushing the industry. The second is emergency services and transportation, especially in greater Minnesota, that we'll probably talk about later. And then, nursing homes, which is not part of this bill. But those are legacy. They're boring, but they're fundamentally important. And it seems like the governor and his leadership and then whatever else, how it trickles down into the legislative branch, and I don't know how much influence the legislative branch even has these days for what the governor has proposed. But he's been kind of nil on that, and it seems like that track still picks up here. So, and we'll talk about a lot of elements of the bill as the evening goes on. But would Senator Wickland yield for our question, please?
Senator Wickland, will you yield? She will yield. Senator Abler.
Well, thank you, Senator Wickland. Mr. President, Senator Wickland. Last year, the governor proposed $41 million to do some nursing home, or to do hospital, getting people to move out of hospitals and rebasing, I think was in the Senate. Senator Wickland, can you comment about what is in here to help stabilize hospitals in terms of helping them get rid of their extra patients, like Hennepin County has 60 or so, and many are jammed up in the ERs. Can you comment about what this bill might do for that?
Senator Wickland to the question.
Thank you, Mr. President. Senator Abler, this bill has some funding that is part of the mental health funding that is designated to go towards hospitals. I think that will have a small impact compared to what their need is, but it is in the bill. I'd say also another item that will help hospitals is the provision that has to do with teaching hospitals being able to draw down additional federal funding for medical education programs. And we hear that teaching hospitals, they want to continue being partners in developing our medical professionals, but they aren't compensated at the right level for that. And so this year, this is a big step that we can take to try and additionally help them with that. I think we aren't able to do as much as we could have last year. As you mentioned, last year we had rebasing provisions in the bill, and those were not retained in the end. And if we had done that, then that would have been an additional ongoing assistance to hospitals. So I didn't have enough funding to really significantly devote money to the specific issue of hospital, having boarding patients, but with that, unfortunately, we didn't have the funds to do that.
Senator Abler.
Well, thank you, and I'm trying not to chide you, Senator Wickland. I just get really frustrated, not by you. Your heart is really good, and I know a lot of what you're trying to do, but it doesn't change the needs. And so as we look around Minnesota, various hospitals are in great distress. Transportation is in great distress. And I don't know who to point at except for the chief administrator of the state, and I wish he'd return my calls once in a while because we could talk about this more. But there are a lot of things really in trouble. And especially when he runs around and like everything is amazing and so many things just aren't amazing. As we sit here in our seats trying to make it better with the budgets that we have and the crises that are continuing, it just makes me kind of sad. So maybe I'm just kind of tired, Mr. President, but I have some things to talk about later, but I want to thank Senator Wickland for her efforts in making the bill as good as it can be with what she had to work with. Thank you.
Senator Urke.
Thank you, Mr. President. And members, we've already heard a little bit about what some of our conversations will probably be about tonight with this bill. We fully understand it's not a budget year, but we all realize that we've got some major challenges across our state. We know that 2/3 of all of our hospitals operated in the red last year. Our nursing homes are still struggling, and it's not looking any brighter moving forward. And our EMS's services are in a world of hurt. And we really didn't focus on that. There's other small things in the bill, and I realize there's not a lot of money, but somehow we've got to all sit down and get serious about this, because when the need arises and we go to, whether it's to walk into the provider or we need to call an ambulance, we want them to show up, and we hopefully expect them to show up, but we're getting into a time when that's not always going to be possible. So it's going to take a lot of us to sit down and figure out how to make this work, and I think it needs to start sooner rather than later, and I would encourage us all to keep that on our agenda as we move forward. Another thing there's a lot of in this bill that creates a lot of heartburn, and that is the mandates on our health plans and our providers. Every time we create these mandates, and they're always a benefit to somebody, but it drives up the cost of care to a point where then all we hear about, it's unaffordable. Well, it's a balancing act, and we have to be careful with that, and I think this bill, following off the shirt tails of last year, a lot of mandates have been added. It's going to drive up the cost of care. And again, that's something that's going to have to be looked at seriously as we move forward. But with that, I would like to dive into a few of the questions, Mr. President. And if Senator Wickland would yield for some questions to help explain a section to us.
Senator Wickland, will you yield? She will yield. Senator Urke.
Thank you, Mr. President, and thank you, Senator Wickland. The section I am at in the bill starts on page 45, and it's section 12. It's the insulin manufacturer's registration fee, and it goes through the process of what that fee is for. But I would like to find out a little bit more about that. Looking at the language that's in this current bill, I don't remember there being a hearing or really even any talk about this in committee. Can you confirm that and kind of give me a little bit more information of where this came from?
Senator Wickland.
Thank you, Mr. President. Senator Urke, we had a hearing on one of my bills that had to do with repealing the sunset on the continuing need program. We added this language in the HHS, the markup. It was language added at my discretion, and it has to do with developing this method of covering some of the costs that the Board of Pharmacy are incurring, and a way to cover the costs of registration by registering the manufacturers of insulin, cover some of the costs for the insulin for the emergency insulin program.
Senator Aki.
Thank you, Mr. President. And a follow-up to that, if Senator Wickland would continue to yield.
She will yield.
Thank you. I did go back and look at that original bill where it removed some language, and it's not this. And so, and I did see where this was inserted in the markup bill. It was just part of the bill. So it arrived basically kind of in the dark of night as far as I could detect, because I put a fair amount of time into trying to track it. Can I ask, who brought this to you?
Senator Wickland to the question.
Mr. President, Senator Utke, I worked on this language. It wasn't. It was language that I worked on with Representative Howard from the House, and it related to, somewhat to the governor's proposal. The Board of Pharmacy had a request for funds to cover costs that were related to the insulin program.
Senator Aki.
Thank you, Mr. President. And I'm sorry, I might have missed a little bit of that at the end as Senator Wickland tailed off. But if I could, if she'd yield again, I'll have a follow-up.
Senator Wickland, will you yield? She will yield. Senator Aki.
Thank you. And to just take it a step further, I guess looking at what's in there, and it's dealing with the insulin and helping cover some of these costs, I guess I'm still trying to figure out what is it supposed to accomplish and what problem are we trying to address with this?
Senator Wickland.
Mr. President, Senator Utke, I think I just mentioned that it covers some costs for the Board of Pharmacy, and it also covers some costs of the insulin assistance program.
Senator Aki.
Thank you, Mr. President. That's all I have for right now.
Senator Kroon.
Thank you, Mr. President. To pick up on Section 12, I'm looking at this, and an insulin manufacturer will be required to pay an annual registration fee of $100,000, and that's going to go into something called the Insulin Safety Net Program account. And from what I can tell, the Insulin Safety Net Program account would go to the MNsure Board and the Board of Pharmacy to carry out its administrative duties on the Insulin Safety Net Program. And then it looked, starting on page 46, it looks like there's a separate account established, the Insulin Repayment Account. And I'm wondering if Senator Wickland would yield for a question.
Senator Wickland, will you yield? She will yield. Senator Kroon. Senator Kroon.
Thank you, Mr. President, Senator Wickland. If I misstated any of that, please correct me, but I'm wondering what the purpose of the Insulin Repayment Account is.
Senator Wickland to the question.
Mr. President, Senator Kroon, I think the language is pretty clear. It says that the money will be taken in and dispensed under the Insulin Safety Net Program. It will be for reimbursement to manufacturers and costs incurred by the Commissioner of Administration in providing the reimbursement payments.
Senator Kroon.
Thank you, Mr. President. Thank you, Senator Wickland. Mr. President, would Senator Wickland continue to yield?
Will you continue to yield? She will continue to yield. Senator Kroon.
Thank you, Mr. President. Thank you, Senator Wickland. If the registration fee goes into the Insulin Safety Net Program account, which goes to the MNsure Board and the Board of Pharmacy, how is the Insulin Repayment Account funded?
Senator Wickland.
I'm sorry, I didn't hear the question.
Senator Kroon.
Thank you, Mr. President. Thank you, Senator Wickland. based on the language here in section 12, the annual registration fee of $100,000 that the insulin manufacturers would be required to pay under this go into the Insulin Safety Net Program account, and those funds go to the MNsure Board and the Board of Pharmacy to administer that program. So my question is, on the insulin repayment account, which is on page 46, which would go to the reimbursement to the insulin manufacturers, how is the insulin repayment account funded?
Senator Wickland.
I will identify it on the spreadsheet for you in just a moment. Mr. President,
Senator Wickland.
Mr. President, Senator Kroon, it is on the spreadsheet. You'll find it online, starting on line 600, Department of Management and Budget. This insulin safety net program, that is money that is coming from the Healthcare Access Fund.
Senator Kroon.
Thank you, Mr. President. Thank you, Senator Wickland. Appreciate that. And so it looks like, if I'm looking at this correctly, if Senator Wickland would continue to yield, Mr. President.
Senator Wickland, will you yield? She will yield. Senator Kroon.
Thank you, Mr. President. Thank you, Senator Wickland. The amount of the funding in line 600, do you think that is going to be sufficient to reimburse the insulin manufacturers for the insulin that's dispensed under the Insulin Safety Net Program?
Senator Wickland.
Mr. President, Senator Kroon, yes, and that's based on the reporting that is done by the Board of Pharmacy on the usage of the insulin safety net program.
Senator Kroon.
Thank you, Mr. President. Thank you, Senator Wickland. My concern, and I appreciate those responses, that helps clarify things a little bit. My concern here is that there is a pending lawsuit in federal court in the District of Minnesota challenging the constitutionality of the Insulin Safety Net Program. The argument in that pending lawsuit is that it violates the Takings Clause of the United States Constitution. And so, Mr. President, if Senator Wickland would yield for one more question.
Senator Wickland, will you yield for one more question? She will yield for another question. Senator Kroon.
Thank you, Mr. President. Thank you, Senator Wickland. Does this language in Section 12, does this seek to address the Takings Clause argument in the pending litigation?
Senator Wickland.
Mr. President, Senator Kroon, I guess my understanding of what we're trying to accomplish is to cover the costs of the program for the state and for reimbursement of the insulin.
Senator Kroon.
Thank you, Mr. President. Thank you, Senator Wickland. And I appreciate that. I do still have some concerns here because if the amount in line 600 is sufficient to cover the reimbursement, it seems like to me that by charging the insulin manufacturers an annual registration fee of $100,000, and my understanding is that there are 3 of them, that's approximately $300,000, which essentially, as I'm putting all of this together, it looks like to me that you're setting up a program, or sorry, the state of Minnesota would be setting up a program that would have the reimbursement of the insulin manufacturers essentially paid for by the insulin manufacturers themselves. So I'm not sure how that solves the problem presented in the pending litigation. And another concern I have here is that with pending litigation, and I know this language didn't come through Judiciary Committee, but if it had, the concern or the comments that likely would have been presented would be we as the legislature
No, I don't know if that's the same kind of.
shouldn't be putting our fingers on the scales on pending litigation, particularly pending litigation where the constitutionality of the statute is being challenged. I suppose you could argue that if the bill itself was going to be rectifying the constitutionality problem that's being addressed in the pending litigation, that would be one thing. But what's happening here is not that. This seems like a sleight of hand to me. It's to address the constitutional challenges in the pending litigation, but still having the same party, the insulin manufacturers, pay for that. And so this is concerning to me because this is going to muddy the waters in that pending litigation, and I don't think we should be doing that here in the legislature unless we actually seek to solve the problem. And I don't think, from what I can tell, piecing this all together, and this is a rather convoluted way of doing it, but putting the pieces together as best as I can understand, we're not addressing the constitutionality concerns, instead setting up a complicated fee structure to have the insulin manufacturers pay for their own reimbursement, which really has a net effect of nothing. So, Mr. President, I would offer the A72.
Senator Kroon offers the A72 amendment. The Secretary will report the A72 amendment.
Senator Kroon moves to amend Senate File Number 4699 as follows. Page 45, delete Section 12. This is the A72 amendment.
Senator Kroon, to your amendment.
Thank you, Mr. President. All the A72 does is delete Section 12. It's a pretty simple amendment. I just don't think that we should be doing this, particularly at the 11th hour, without a thorough vetting and committee. I just think that this isn't ready. This should be discussed more, particularly with the pending litigation. This is a simple amendment. I don't think it would change the rest of the bill. And so I would request a roll call, Mr. President,
Roll call requested, roll call granted.
and encourage members to vote yes. Thank you.
Senator Wickland to the A72.
Thank you, Mr. President. Members, I would ask you to oppose and vote no on this amendment. We are establishing this in the bill for the reasons that I stated, to cover the costs of the program and the costs for the state. I would urge you to vote no. We established the program just a few years ago because of Alex Smith. The program is named after Alex Smith because Alex Smith's family came to the legislature to help us understand that her son died because he couldn't afford his insulin, and we believe that no one in Minnesota should die because they can't afford their insulin supply. The program is set up so that people can go to a pharmacy and obtain an emergency supply of 30 days of insulin at no cost or at low cost. At a manageable, I think, $35. And then there's also a way for them to get access to a patient assistance program that is for continuing need. So I would ask members to oppose and vote no on this amendment. Thank you.
Senator Abler.
Well, thank you. I appreciate that. Would Senator Wickland yield for a question?
Senator Wickland, will you yield? She will yield. Senator Abler.
Actually, it might be a couple, just in fair disclosure. Senator Wickland, it's actually hard to hear in here if you're trying to get content. So I just, your comments in the beginning where you had a whole bunch of them.
Members, it is sometimes pretty difficult to hear, so when you're talking, will you be so kind as to move the mic up a little closer,
Yeah.
and that way it would be helpful. Senator Abler, sorry to interrupt.
So Senator Wickland, I didn't even hear your answer from before. So did we do this in committee, or did this come up between our committee and the floor?
Senator Wickland to the question.
Mr. President, Senator Abler, as I indicated to Senator Kroon and Senator Utke, this language, we had the one bill that repealed the sunset that we heard during committee time during session, or excuse me, earlier in session, And then this other language was introduced in the Health and Human Services Committee markup session. I don't remember the exact date.
Okay. No,
Senator
sorry.
Abler.
Yeah, so after a while, you don't remember everything either, Senator Wickland, so I appreciate that. And so the insulin thing has been a big deal. I've been part of all that. If she'll yield again just to help me understand what this program does?
She will yield.
Senator Abler, I'm sorry.
Will
What'd
she
you say?
yield for another question? Senator Wickland, yield, please.
Senator Wickland, will you yield? She will yield. Senator Abler.
Oh, thanks. So Senator Wickland, this is covering some administrative costs. It sounds like it's $100,000 per manufacturer maybe or something, and then this covers the admin, so the people can get free insulin supplied by these companies. Is that how it works? I just don't remember. I apologize. So, because it was controversial, but frankly I don't always agree with my good friend Senator Kroon. But can you just help me understand operationally like what it does? Like what this covers overhead. I was kind of reading the bill where it said that.
Mr. President, Senator Abler, I kind of went through
Senator
that.
Wickland.
The Section 12 language, I think, lays it out. There is an assessment of a registration fee. There's an Insulet Safety Net Program account, and that money goes to help MNsure board cover their assigned duties, because they are the ones that are tasked with keeping up information on the MNsure website. And then the Board of Pharmacy is also indicated as receiving an amount sufficient to cover their costs. And then the insulin repayment account is set up in the Healthcare Access Fund, and that is a special revenue fund which can provide reimbursement to manufacturers and costs incurred by the Commissioner of Administration.
Senator Abler.
Yeah, well, I'm sorry. I don't want to belabor this, but this helps people get free insulin. Senator Wickland, does this help people get insulin provided by the provider, by the companies? The $300,000 is admin money, but the other products come from the pharmaceutical companies at no charge to the people, right? If she'll yield.
Mr. President.
Senator Wickland.
Senator Abel, are you asking about how does the insulin assistance program work?
Senator Abler.
I don't know. We have such short meetings to mark up stuff, and we don't go into a lot of detail in the committee sometimes. And I'm not trying to cause a problem, but so I'll just let it go with that, and people can try to figure out what it does. So I don't know. Do you want to help me understand it better, Senator Wickland? So people can get insulin for free or cheap. We used to have like a $35 thing. Did that go away? And is it free now? And this $300,000 is admin just to kind of coordinate all that with whoever has to touch it?
Mr.
Senator
President,
Wickland.
Senator Abler, the insulin safety program does not change. This language does not change that program.
Senator Abler.
Thank you, Mr. President. I thank you for your indulgence.
Members, we are on the A72. Senator Upke.
Thank you, Mr. President. And there's a couple of reasons why I've got a concern about this, but I'd like to take and maybe add a little bit more about Senator Abler was talking about the Insulin Safety Net program. And that program is still in effect. It isn't directly affected with this, but that is where people either get the free insulin or at the reduced price, but the manufacturer was given, basically reimbursed a higher value from the state. And that's what has kind of piqued my interest in this amendment, is when I researched it both in our body and the other body, went through all the bills to see where this came from, it wasn't in anything offered other than it showed up in the markup bills. And that's why I had the line of questions to start with. There is there was no history to this specific language until we saw the bills that came through in markup and have started through and progressed to this point. And when you look at it at the high level, you see we're charging these manufacturers a $100,000 fee. And there's 3 of them, so that's the $300,000. And then we're reimbursing them for the underpay when they're having to sell the insulin at a low price, or in the case of insulin that's delivered free. And it sure looks like we're just spending money. We're just taking it in and giving them back their money. There's no other program that operates like that, and that's why this whole thing is concerning. Senator Cruen already talked about how this is being challenged in the legal system. I think we need to take a pause on this and see how it plays out. So members, I would sure appreciate and encourage a green vote so that we take this up and handle it the right way. Thank you.
Members, we are on the A72 amendment. Seeing no further discussion, I'm going to the author of the amendment as the last person that you'll hear before we do a roll call vote. Senator Cruen.
Thank you, Mr. President. Maybe I can clear some things up for Senator Abler. My amendment doesn't affect the insulin safety net program. That program was passed some years ago, and nothing in this amendment will change that program. The problem is that program was set up in such a way, and obviously providing affordable or free insulin to people who need it is a noble goal, and it's a state goal, and it's something that we should do, but the state needs to pay for it. The way that the program was set up, it was essentially forcing the manufacturers to provide that product for free, and that is a constitutional problem. If this is a matter of public benefit, then the public should pay for it. This is basic constitutional principles, and that's why there's a pending lawsuit in federal court alleging that this violates the Takings Clause of the United States Constitution. My concern here is that we're doing a sleight of hand here to seem like there's some reimbursement coming that would maybe help with the Takings Clause argument, but it's illusory because it's coming from a fee that the manufacturers have to pay. And I don't even know really how this amount could possibly pay for that program, and I'm not going to get into the numbers. I don't know enough about that. But the principle of it is that you're telling the manufacturers to pay this fee, and then we're going to turn around and use that fee to reimburse them as if that's going to solve some of the constitutional problems, which it won't. But the bottom line is that nothing in my amendment is going to take away the insulin safety net program or deprive anybody of any insulin that they depend on under that program. So with that, this is a matter of a constitutional jurisprudence as far as I'm concerned, and this bill isn't ready as far as I'm concerned. If we're going to address this, we should address this in a way that will actually solve the constitutional problems while protecting the insulin safety net program and having the public pay for it as they ought to if we as a body determine that this is a worthy program, which it is. So with that, members, I would encourage a yes vote. Thank you.
The Secretary will take the roll on the A72 Cruen amendment. Members, please vote. Senator Morrison, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Bolden votes no.
Senator Bolden votes no.
Senator Dietzig votes no.
Senator Dezek votes no.
Senator Fateh votes no.
Senator Fateh votes no.
Senator Kunish votes no.
Senator Kunich votes no.
Senator Mann votes no.
Senator Mann votes no.
Senator Marty votes no.
Senator Marty votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Umu Verbatim votes no.
Senator Umu Verbatim votes no.
Senator Pa votes no.
Senator Powell votes no.
Senator Port votes no.
Senator Port votes no.
And Mr. President, Senator Zhang votes no.
And Senator Jean votes no. Senator Duckworth, those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Anderson votes aye.
Senator Anderson votes aye.
Senator Barr votes aye.
Senator Barr votes aye.
Senator Dames votes aye.
Senator Dames votes aye.
Senator Draheim votes aye.
Senator Draheim votes aye.
Senator Housley votes aye.
Senator Housley votes aye.
Senator Miller votes aye.
Senator Miller votes aye.
Senator Weber votes aye.
Senator Weber votes aye.
Senator Wiesenberg votes aye.
Senator Wiesenberg votes aye.
And Senator Howe votes aye.
And Senator Howell votes aye. All senators having voted who desires to vote, the secretary will close the roll. There being 31 ayes and 34 noes, the A2 amendment is not adopted. The A72 amendment is not adopted. Senator Lang.
Thank you, Mr. President. I'd like to move the A65 amendment.
Senator Lang offers the A65 amendment. The secretary will report the A65 amendment.
Senator Lang moves to amend Senate File Number 4699 as follows. Page 171, line 11, delete one member. This is the A65 amendment.
Senator Lang, to your amendment.
Thank you, Mr. President. The A65 represents just a change to the membership from the House and the Senate's bumping up the number of members that will serve on the EMS board from 2 members to 4 members, one of each caucus of the 2 houses. And I would say that I'd be remiss if I didn't talk about the good bipartisan nature that the EMS Task Force has been working over the last almost a year now, I believe it's been, since we first started meeting and first started discussing this. So a lot of thanks and credit to those individuals as we've have moved forward. I believe this should be a friendly amendment, Mr. President, and I would appreciate some support on this. Thank you.
Senator Wickland to the A65 amendment.
Thank you, Mr. President, Senator Lang, for this amendment. I would see this as a friendly amendment, but I will. I know that Senator Seeberger has worked. This is her bill language, and I'll let her speak to it.
Senator Seeberger.
Thank you, Mr. President. And yes, this is a friendly amendment. Thank you, Senator Lang, for offering this amendment. I know Senator Miller offered it earlier. And having had some time to discuss it, I think it makes sense. So friendly amendment, and I will be voting yes. Thank you.
All in favor of the A65, say aye. Aye. All those opposed say no. The A65 amendment is adopted. Senator McQuaid.
Thank you, Mr. President. I impose a call of the Senate.
The Senate is under call. For the balance of the bill or just for an amendment? Are you offering an amendment?
Thank you, Mr. President. I will be offering amendments. It's for the remaining balance of this amendment.
All right. The Senate is now under call. Senator McQuaid.
Thank you, Mr. President. I ask that the further proceedings under the call be dispensed with and the sergeant be instructed to bring in the absent members.
On that motion, all in favor say aye. All those opposed say no. The motion prevails. Senator McQuaid.
Thank you, Mr. President. Mr. President, I offer the A60 amendment.
Senator McQuaid offers the A60 amendment. The Secretary will report the A60 amendment.
Senator McQuaid moves to amend Senate File Number 4699 as follows. Page 141 after line 29, insert. This is the A60 amendment.
Senator McQuaid to your A60 amendment.
Thank you, Mr. President, and I ask for a roll call on this amendment.
Roll call requested, roll call granted.
Thank you, Mr. President. Mr. President, over the last little less than 2 years, we have watched as our country has devolved into a place where pregnant people are turned away from emergency rooms, bleed out in parking lots, go into sepsis, almost die, lose their fertility, have kidney failure. It is a dire situation across this country because of the abortion bans that we have seen. But what's more is that that was not the end. It was the beginning of a much more devastating landscape. In today's world and in the United States, there are 14 states where rapists choose the mothers of their children. There are states where you can't get divorced if you are pregnant, even though a quarter of people who experience domestic violence do so for the first time during pregnancy. And murder is the leading cause of death for pregnant people. One of the things that I did not see coming, Mr. President, was that we would be having to have a conversation about patients being able to make decisions about their embryos. But after Alabama, the state of Alabama, effectively banned IVF in the state, we find ourselves having to, after passing protections for every Minnesotan to be able to decide for themselves what happens to their bodies when they get pregnant, when they stay pregnant instead of the government, I guess we left out IVF, which I didn't think we needed to include, but here we are. So the A60, Mr. President, is simple. It just says a patient has exclusive discretion over all decisions relating to embryo transfer, treatment, storage, and disposition. That is my amendment, Mr. President. I ask for a green vote.
Members, we are on the A60 amendment. Senator Wickland.
Thank you, Mr. President. This amendment I would consider a friendly amendment. This was language when we heard the bill, Senate File 1704, when we amended it in the committee. This language was present, and I would support it.
Any other discussion on the A60? A roll call has been requested. Senator Rasmussen.
Thank you, Mr. President. Would Senator Wickland yield for a question?
Senator Wickland, will you yield? Senator Rasmussen.
Thank you, Mr. President. Thank you, Senator Wickland. Senator Wickland, is there any other language in your bill that relates to embryo transfer, treatment, storage, or disposition?
Senator Wickland. I do not believe there, Mr. President, Senator Rasmussen, no. I don't believe there is, but I will do a check with my staff.
Thank you, Mr. President. Point of order, Mr. President.
For what purpose do you rise?
Thank you, Mr. President. I would, under Rule 35.2, the amendment before the body is not germane. We just heard from Senator Wickland that there is nothing in her bill that relates to embryo transfer, treatment, storage, or disposition. I also, Mr. President, took a look. This amendment amends Chapter 145, and in this very lengthy bill, which I believe is about 600 pages, I was not able to find any changes made to that chapter of law. So, Mr. President, this amendment does relate to a substantially different subject than the bill, and would ask that you find the point of order well taken.
Advice.
Advice. Senator McQuaid.
Thank you, Mr. President. I ask that you find the point of order not well taken. This particular amendment is germane to this bill and actually talks about pregnancy and pregnancy decisions, which you will find provisions about in this bill throughout. And so I ask you to find that point of order not well taken. Thank you.
Senator Wickland, advice.
Mr. President, the bill does contain references to maternity care. It's got a birth center, African American birth center support. There is language also relating to abortion services. I think that my advice would be that this is germane to the bill. It also has to do with reproductive health.
Senator Lucero, advice.
Thank you, Mr. President. So we just heard some rationale to attempt to make this germane. We heard birth center, abortion, and a few other things. But I would remind you, Mr. President, you probably know this, but an embryo can exist inside and outside of a woman. An embryo can be the product of fertilization and yet not be implanted. And as I read this language, it refers to an embryo. It has nothing to do with birth, pregnancy, or any of those other rationales that we just heard. And as we also heard, I would just emphasize, if there is no chapter in the bill, and this is attempting to amend into a chapter that's not referenced, custom and usage clearly dictates that it should not be permitted. So therefore, Mr. President, I encourage you to find the point of order well taken. Thank you.
Senator McQuaid, last piece. Senator Dibble.
Thank you, Mr. President. I rise to give advice.
Advice, Senator Dibble.
Thank you, Mr. President. I'm just building on the arguments that have been made by Senator McQuaid and Senator Wickland. I would draw your attention to page 120, section 56, stillbirth prevention through tracking fetal movement program. And it's an entire program that has to do with initiating a program to tracking fetal movements, preventing stillbirths, et cetera. Very, very closely related to reproductive care, there's a reproductive health care nexus that is clearly points to the fact that Senator McQuaid's amendment is germane. Thank you, Mr. President.
Senator McQuaid, advice.
Thank you, Mr. President, and more advice as I urge you to find this point of order not well taken. All of the references in this bill to pregnancy are related to people who are pregnant or giving birth. That is what this amendment is about. A patient, the first two words, that is referring to a person who has been, could be pregnant. These people who might be giving birth in birth centers or having maternity care were pregnant. This is very germane to the bill, and I urge you to find this point of order not well taken.
Senator Rasmussen.
Thank you, Mr. President. Advice. I just wanted to ground us again in Rule 35.2. Mr. President, I asked the bill author if there was anything in her bill that related to embryo transfer, treatment, storage, and deposition, and she answered no. She answered no. We also have a 3-page title for this bill that references all sorts of chapters and sections in Minnesota law. I mean, this is a big, big bill. Not one reference to Chapter 145, which is what this amendment would be going into. And so, Mr. President, I would ask and advise you that you find this point of order well taken. If we look at how Rule 35.2 has been used with our custom and usage, whether it being in a chapter that's referenced in the bill or being on a different subject that's not included in the bill, I think this is very clearly non-germane to the bill before the body.
Mr. President.
Senator McQuaid.
Thank you, Mr.
advice.
President.
Mr. President. Point of order.
For what purpose do you rise?
Under Rule 36.5, no member may speak to a motion more than twice without the permission of the Senate.
That is only applicable if it's not on special orders. This bill is on special orders, so that doesn't apply.
Mr. President, I'd like to withdraw the A60, and I'll bring this language back in a place that members feel more comfortable. Thank you.
The A60 amendment has been withdrawn. Senator Uckey.
Thank you, Mr. President. I would like to offer the A66 amendment.
Senator Uckey offers the A66 amendment. The Secretary will report the A66 amendment.
Senator Uckey moves to amend Senate File Number 4699 as follows. Page 54, delete Section 5, This is the A66 amendment.
Senator Uckey, to your amendment.
Thank you, Mr. President. Members, this amendment addresses the prohibition on the for-profit HMOs that's contained within this bill. There's been a ton of misinformation throughout this session talking about basically bad stuff. I guess I'll just call it misinformation about the for-profit versus the nonprofit. And I just would like to go through a few things. There's no evidence of a different outcome when comparing the satisfaction, cost, or access of for-profit and nonprofit HMOs. In February of 2024, the Minnesota Department of Health released a study on HMO conversions. The executive summary states clearly that minimal data is available to shed light on whether the difference exists between nonprofit and for-profit HMOs. With regard to day-to-day operations, enrollee satisfaction, and quality of care, there is no regulatory difference between the for-profit and nonprofit HMOs. All HMOs are subject to regulation from the Minnesota Department of Health and the Minnesota Department of Commerce. All are subject to medical loss ratio requirements at both the federal and state levels. No HMO can keep excess funds, whether they are called profit or a nonprofit surplus. The status of Minnesota the state of Minnesota requires HMOs to return funds that exceed the medical loss ratios. That again is the same whether they're a for-profit or a not-for-profit entity. And all are subject to the same network adequacy requirements. All HMOs must meet the need of their customers, or their customers will choose other coverage. All must build strong provider networks to serve their customers. All must offer competitive rates to give value to customers. Many nonprofit HMOs have contracts and organizational affiliations with for-profit entities. The Department of Human Services chose a for-profit HMO to meet the needs of more than 30,000 PMAP enrollees. Some of the unanswered questions of what's happening in this bill. How will the approximately 31,000 PMAP enrollees be transferred to other coverage? In the recent past, the work of re-enrollment has been a burdensome process for the counties and enrollees. How much will the enrollment transaction cost? We've asked that question, or I've asked that question a number of times. Because it basically fits the agenda of what's in the bill, they say nothing. But nothing happens for free, so there's got to be some cost in this. Is termination of a duly authorized license without cause a taking under Minnesota law? Elimination of a current license via legislation could be considered an uncompensated regulatory which may expose the state to more constitutional litigation. Both the United States Constitution and the Minnesota Constitution protect owners against the taking of their property rights without just compensation. When the legislature amended the HMO statute in 2017 to allow for-profit companies to operate HMOs, it created a legally enforceable right for for-profit corporations that is protected against a government taking. This completely takes away any ability for for-profit corporations to operate HMOs in Minnesota with no compensation for their losses. This is just not right. It again looks like it could lead to a legal challenge It's an irresponsible move, and members, I would ask for your support to reinstate the for-profit option for our HMOs. They've been doing a good job for us since 2017, and I think we should welcome them back to serving Minnesotans. Thank you, Mr. President.
Senator Wickland to the A66 Utke Amendment.
Thank you, Mr. President. I would ask members to vote no on this amendment. It is not, this is something that we should put back to the way it was before 2017. I will just say that if an entity is a for-profit entity, there needs to be some mechanism to make a profit, and that needs to come about somehow. Yes, they are performing in Minnesota now, but I believe that the change was made in 2017 without discussion and without changes to account for the presence of for-profit HMOs and regulations. This provision would just take us back to where we were before 2017. I will also comment on this statements that were made about this having a cost. We have specifically gotten feedback from the Department of Human Services that they do not anticipate any costs with this provision. They would proceed as they would with any contract non-renewal or termination, and there are set forth steps that they would follow to go through that at the end of their at the end of this contract time, and it would not require a new health plan procurement. So there would be a transition, and there would be no cost associated with it.
Just so that I'm clear, Senator Utke, you did not request a roll call, did you?
Thank you, Mr. President. I did not, but I will now. Thank you. I'll request a roll call.
Roll call requested, roll call granted. And I had Senator Abler.
Well, thank you, Mr. President, and to the body. I was actually in the meetings when we decided to go with this, and actually it was Governor Dayton at the time, and his opinion was, frankly, the nonprofit HMOs are working like they're for-profit anyway, so what's the difference? And that would be where I'm going to start with my comments. But Mr. President, we need people who are willing to serve Minnesotans under the terms we're willing to have them work. And frankly, I think all the carriers need a bit more scrutiny to stay within parameters that actually will help our constituents. And so I don't know what benefit's going to come if we take this away. I guess there's some 31,000 people into some of these programs. Some of these for-profits, United Health, if that's one of them, has incredible capacity to do data and coordination, investigating like population health. And there's some health plans I would credit UCare with that really has a mission-minded way of doing its business. I would credit Health Partners, which at least has to take care of patients in their own world. But and Blue Cross people are sitting home waiting for me to criticize them, so here we go. Blue Cross is a bank, Mr. President. It's a nonprofit. They have all kinds of for-profit subsidiaries, so tell me what's the difference. When we were doing bidding, I think DHS could have done a much better job. They believed that Blue Cross could equal the capacity and service level of UCare, and so they took it away from UCare and gave it even to Medica, who then quit doing business with us as a nonprofit. So I want to caution people about just doing this because you just don't like some for-profit carrier. They need to behave. We have a strong system in Minnesota. We have a commerce commissioner. We've got an attorney general. We have a department of health and human services, both, that are supposed to oversee these places. And the fact that a company is for-profit or not does not assure that it's going to be great or that it's going to be awful. And I want to really urge my colleague, Senator Wickland, and those who are thinking this is something that's going to make a difference. It's not. And I think you might find we're actually going to have less choices if this goes forward. So if I thought it made sense at the time. If it needs to be tweaked, put the pressure on, make them behave, but I believe they have to follow every rule that nonprofits have to at the same price. So, Mr. President, I urge people to vote red, and I urge, furthermore, going forward, Senator Wickland and others, please don't do this. Thank you.
Senator Lucero.
Thank you, Mr. President. Would Senator Wickland yield for a question?
Senator Wickland will yield. Senator Lucero.
Thank you, Mr. President. So this, you oppose the amendment, is my understanding, Mr. President and Senator Wickland. Can you please explain with a little bit more detail? I heard your rationale in your reasoning for opposing, and among those you said it passed without discussion in 2017. Well, I was here in 2017, not in this body, in the other body, and I'm not certain how this could not have had discussion. So can you please elaborate when you say this passed without discussion?
Senator Wickland.
Mr. President, Senator Lucero, I was here in 2017, but I'm not basing it. I'm basing it on what I'm hearing from the member who carried the bill, that he felt at the time that there wasn't sufficient discussion about the change. Minnesota had been consistently including only nonprofit HMOs since their inception, which was back in the 90s, I believe, and he believes that this change in 2017 was not necessary or helpful to improving the environment for Minnesotans to access high-quality, affordable health care.
Senator Lucero.
Thank you, Mr. President, and thank you, Senator Wickland. Would Senator Wickland yield for another question?
She will yield for another question. Senator Lucero.
Thank you, Mr. President, and thank you, Senator Wickland, for that. So I heard you reference a he, some individual. Well, who is that would be the question, but along those lines, that is one person's opinion. So they don't believe that it's better. So what? Who is it? Would be my question.
Mr. President, Senator Lucero.
Senator Wickland.
The author of the provision was Senator Marty. Not
Senator
trying to make
Lucero.
big assertions about a person. It was Senator Marty's provision. He presented it in the committee, in our committee, and we included it in the bill.
Senator Lucero.
Thank you, Mr. President. Okay, and I won't go back on this, but I think my question was, and maybe that is the answer. The person being referenced that they don't in 2017 that carried the bill that said that this was not a good idea or something to that effect, that's who I was referencing, that he. And maybe that was Senator Marty. But there are many opinions. And in 2017, when this was passed into law, I can guarantee 100%, Mr. President and Senator Wickland, there was a discussion. Conversation happened, and it was determined that state law should change. And it passed both bodies, sent to the governor, and signed into law. And to assert that happened without discussion or conversation or something to that effect is just not true. The other question, or the next question I would have, if Senator Wickland would yield for another question.
Senator Wickland, will you yield? She will yield. Senator Lucero.
Thank you, Mr. President, and thank you, Senator Wickland. Can you please help me? I'm not on HHS. I've never been involved in any of these, so I genuinely do not know how many entities are going to be impacted by this change. So how many entities right now that are for-profit that are going to be impacted by this if this were to become law?
Senator Wickland.
Mr. President, Senator Lucero, I don't know how many entities are have plans on the individual market that would fall in this category, but within the public programs, right now there are, I believe, there's one entity that has that successfully bid for a contract with our public programs. and they would be, through the transition process, they would end their contract and would not be able to bid on the next contract.
Senator Lucero.
Thank you, Mr. President. And would Senator Wickland yield for another question?
She will yield for another question. Senator Lucero.
Thank you, Mr. President. Thank you, Senator Wickland. Okay, so it'd be one entity is what I heard there for, that are in the public. Programs. My next question is, what is the chief objective? What is the desired outcome that is being sought by removing for-profit entities from being able to offer here in Minnesota?
Senator Wickland.
Mr. President, Senator Lucero, the motive is that we believe that for Minnesotans, we value that the entities providing health care are not motivated by, not an additional motivation to be creating profit through their provision of health care. We believe that Minnesotans have the right to access health care and to know that the main goal is to be as a nonprofit and to be investing their resources in providing the best care possible and not be looking for ways to profit off of the health care of Minnesotans.
Senator Lucero.
Thank you, Mr. President. And I will just ask one last follow-up pertaining to that last answer, if Senator Wickland would yield for another question.
She will yield.
Thank you, Mr. President. Thank you, Senator Wickland. In the answer there, among what you said was the objective or the goal to create or it is your belief that nonprofits can achieve the best care possible. Do you have any data or anything that might suggest anything to that conclusion that there's a reduced care in for-profit versus nonprofit?
Senator Wickland.
Mr. President, Senator Lucero, I believe that the incentive for the nonprofits is not to create a profit, and so my assumption is that they will be devoting their resources and trying to produce the best product or have the best provision of health care. And a for-profit entity could do that equally, but then they also need to be generating a profit for their corporation or shareholders.
Senator Lucero.
Thank you, Mr. President. Well, here's the truth regarding nonprofits. Nonprofits also need to make a profit. If they are not covering their costs and then using money to continue to innovate, to explore options for additional efficiencies. And when I say make a profit, I mean the cost that goes into an offering. Everything that's associated with a cost. And that will have X dollars. The revenue from that offering needs to exceed the cost. And that's what I mean by profit. Now, that profit is going to be used for several things. In the end, when they do their books at the end of a quarter or a fiscal year, even nonprofits are allowed to make a small profit. But in the end of a fiscal year or a quarter, they have to show something close to a net zero, but that doesn't mean they didn't make a profit in their offering. Because there are many salaries, overhead, there's technology changes, there's upgrades, and I submit, Mr. President, and I didn't hear anything in the answer there that suggested any kind of hard fact. It was all just subjective opinion and belief. It is a very, very clear and true universal statement that a profit motive drives efficiency, drives innovation, drives higher quality. And that's what Minnesotans want. They want better quality care. They want more options. They want prices to go down. And I will say, just because an entity is for profit in any industry, just because there is a profit motive, doesn't mean prices fail to come down. Prices do come down because profit motive is among the contributors that drive competition, that drive efficiency. And so for that reason, Mr. President, we absolutely just need to stick with the hard facts, need to stick with the lessons of history, and not go back to the 90s as just some abstract idea, excuse me, but we need to have information and facts, and the information and facts clearly demonstrate that there is not a difference, as Senator Abler said. Nonprofits operate as a for-profit, so vote green on the A66 amendment. Thank you.
Senator Gruenhagen. And we're on the A66 amendment. If you please keep your comments to the A66.
Oh, thank you, Mr. President. Yeah, Mr. President, if Senator Wickland would yield for a question.
Senator Wickland, will you yield for a question? She will yield for a question. Senator Gruenhagen.
Okay, thank you, Senator Wickland. Yeah, the question is, aren't the contracts that the nonprofits or the profits bid on, they bid on them. So it's a competitive situation. So if a well, let's put it this way. First, answer that question. Aren't the contracts bid on by both nonprofits currently and profit companies?
Senator Wickland.
Mr. President, Senator Gruenhagen, I think if I understand your question correctly, you're asking about the public programs contract bidding. Yep. And yes, if they were able to secure a contract, it would mean that they met the criteria and were selected because of their bid.
Senator Gruenhagen.
Oh, thank you, Senator Wickland. Yeah, Mr. President and members, did you hear what she just said? She said it's a bidding process, and if they meet the criteria, then they are selected. Think about that. Does it really matter whether they're for-profit or nonprofit if they meet the criteria and come out with the best bid? That's what we're looking for. Therefore, the more competition we have, whether nonprofit or profit, the better results we'll get. You know, I guess I have to agree with Governor Dayton when he said it doesn't really matter whether you're for-profit or nonprofit, because it's a bidding process to get the contract. And whether it's a for-profit company or nonprofit, so-called, and Senator Lucero brought out a lot of the characteristics of nonprofits, which I happen to agree with, it's a bidding process. So why not allow all the players that are available, profit and nonprofit, to bid on the contracts and give Minnesotans the best possible service? So please vote green on this amendment. We're talking about what doesn't matter versus profit versus nonprofit. Please vote green. Thank you.
Senator Pratt.
Thank you, Mr. President. Would Senator Wickland yield for a question?
Senator Wickland, will you yield? She will yield. Senator Pratt.
Thank you, Mr. President. Senator Wickland, is there any difference in the regulation between for-profit and nonprofit HMOs?
Senator Wickland, to the question.
Mr. President, Senator Pratt, why, yes, there is actually a difference in regulation between them, and the Attorney General has authority over nonprofits and does not have that authority over for-profit entities. So I would suggest that that is another reason that it would be better to have nonprofit HMOs, because the Attorney General would have more oversight over them.
Senator Pratt.
Thank you, Mr. President. And I guess I'm not really sure about that question because, Mr. President, it's my understanding that no HMO can keep excess funds, whether they're called profit or whether they're called nonprofit surplus. The state of Minnesota requires HMOs to return funds that exceed the medical loss ratio. And, Mr. President, the Minnesota Department of Health and the Minnesota Department of Commerce both have regulatory oversight over profit and nonprofit HMOs. In fact, Mr. President, the Department of Health just released a study this February that stated minimal data are available to shed light on whether differences exist between nonprofit and for-profit HMOs with regard to day-to-day operations, enrollee satisfaction, and quality of care. Now, Mr. President, I don't really care if an insurance provider is for-profit or nonprofit. What I care about is that they meet the needs that I need in a plan. I care that they allow me to see a medical provider in my network. I care that they cover the drugs or prescriptions that I need for whatever ails me or for whatever I need them for. We have 31,000 Minnesotans enrolled in this program that Senator Wiklund talked about. 31 Minnesotans who are part of a group that said, this is the best plan for us. And we're going to take that away from them. We don't know, Mr. President, if that will be replaced with a plan that will let them keep their doctor, let them keep their dentist, let them keep their formulary. We don't know. Because we've decided that how an insurance provider is set up, for profit or nonprofit, is more important than the services that they provide. More important than the value that they provide to their customer. Mr. President, there are inherent efficiency, there's a bias towards efficiency when you have a for-profit company that may or may not exist when you have a nonprofit. And even tonight, when asked by Senator Lucero and Senator Gruenhagen about the benefits of going to a nonprofit versus a for-profit, we didn't hear the facts state. What we heard is, I believe. I believe it'll be better. I think it'll be better. I hope it'll be better. As the Department of Health says, there is minimal data to determine whether or not there is a difference in satisfaction and value. But what we do know, Mr. President, is that there is someone who went out there and took multiple bids and decided that this for-profit plan was the best plan for me. And Mr. President, we know from basic economics, more choice and more options keep prices lower, and fewer options increase costs of goods and services. So, Mr. President, if we're really interested in keeping healthcare costs low, shouldn't we allow for the most options? Shouldn't we allow for the most choices? Shouldn't we allow those who are going to be most impacted by the decision to make that decision, not based on corporate structure, but based on the value, the services, the network that that company brings? And Mr. President, I think that's most important for us in this chamber to remember. Because like I say, I don't care if it's nonprofit or for-profit. Doesn't matter to me. All I care about is choice. All I care about is value. All I care about is that Minnesotans are getting access to the care that they need, and we should not be arbitrarily cutting off those choices. Thank you, Mr. President.
The last voice we'll hear from is the author of the amendment, Senator Utke.
Thank you, Mr. President, and thank you, members. As you were discussing this, it brought back some memories of what led to this back in 2017 when it's been brought up that the for-profits came in 2017. Those of us that were in this chamber at that time remember what we dealt with. Right out of the chute, we were dealing with a health care crisis. There weren't plans available in a lot of our counties. We had counties that did not have a statewide plan. We only had an HMO. We came down here and had to hustle. That led to the reinsurance plan. It led to a lot of things related to getting carriers back into our market. And part of that discussion, so the fact was there a little discussion? Was there no discussion? There was a lot of discussion on how we can get more carriers, more plans to serve our counties across the state. And that's when we did bring the for-profit carriers into our mix. It's been a good working relationship. It's proved it. They bid this contract. They got it because they're the most effective. And it's just, and now we're taking it away just because it's just not right. There's a few other things. You know, we hear about the profit. What do we do with it? I think we've all heard over and over and over again that 2/3 of our hospitals, our providers, are operating in the red. I think they'd love to talk about profit, but it's not on their radar right now. They're just trying to keep their doors open and provide health care for us when we walk in. And the last thing is, I brought up the fact of cost in the committee hearing. And yes, we were told there's no cost. But members, our agencies don't do anything for nothing. We've gone over the last year through the redetermination, which is resetting the benefits for our Medicaid population. We have paid millions of dollars out to help cover the costs. Our counties get charged with most of that work, but we've had to pay a lot of those bills and help them cover that. It's cost us millions of dollars. Now we've got 31,000 individuals who, according to this bill, will have to change their health plan, and now they tell us it's free of charge. I don't care what takes place, there is going to be some cost. I just ask them to be factual and upfront with that. But members, at this point, all we can do is address the amendment that's before us. Please vote green. Thank you.
The Secretary will take the roll on the A66 Uckey Amendment. Senator Morrison.
Thank you,
For
Mr.
those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Bolden votes no.
Senator Bolden votes no.
Senator Dietzig votes no.
Senator Dietzig votes no.
Senator Fateh votes no.
Senator Fateh votes no.
Senator Kunish votes no.
Senator Kunis votes no.
Senator Mann votes no.
Senator Mann votes no.
Senator Marty votes no.
Senator Marty votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Umu Verbatim votes no.
Senator Umu Verbatim votes no.
Senator Pa votes no.
Senator Pa votes no.
Senator Port votes no.
Senator Port votes no.
Mr. President, Senator Zhang votes no.
Senator Zhang votes no. Senator Duckworth, those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Anderson votes aye.
Senator Anderson votes aye.
Senator Barr votes aye.
Senator Barr votes aye.
Senator Dames votes aye.
Senator Dame votes aye.
Senator Draheim votes aye.
Senator Draheim votes aye.
Senator Housley votes aye.
Senator Housley votes aye.
Senator Miller votes aye.
Senator Miller votes aye.
Senator Weber votes aye.
Senator Weber votes aye.
Senator Wiesenberg votes aye.
Senator Wiesenberg votes aye.
And Senator Howe votes aye.
And Senator Howe votes aye. Members, please vote. Senator Johnson, are you voting? All senators having voted who desire to vote, the secretary will close the roll. There being 31 ayes and 34 noes, the A66 Uckey Amendment is not adopted. Senator Uckey.
Thank you, Mr. President. I would offer the A77 amendment.
Senator Uckey offers the A77 amendment. The secretary will report the A77 amendment.
Senator Etke moves to amend Senate File number 4699 as follows. Page 58, after line 21, insert. This is the A77 amendment.
Senator Uckey, to your A77 amendment.
Thank you, Mr. President. Members, you've heard me mention mandates a few times already this evening. This amendment addresses the mandates that would affect our health care plans. With this amendment, we expand the current defrayal process to all new mandates passed by the legislature after January 1, 2025. So that is not bills that we pass this season. That will start, this proposal starts next year. State defrayal of new mandates only occurs if the Department of Commerce deems that a new mandate goes beyond federal essential health benefits. All mandates add costs to premiums and out-of-pocket costs to enrollees. And if the state passes a mandate without a defrayal, insurance costs increase. If the legislature decides a new mandate is important, it should play a role in covering those costs, not pass those on to those who buy their own insurance on MNsure. In fact, Senator Frentz, I think you should really like this, because the good news is this language pretty much mirrors the concept that you had in a bill this year, Senate File 1037. With that, members, this amendment just says that we need to find out what these things cost, and when there is additional cost, the state should play a part in covering that cost and not just dump it all on our payers. So with that, Mr. President, I would ask for a roll call and encourage a green vote.
Roll call requested, roll call granted. Senator Wiklund.
Mr. President, I would rise in opposition to this amendment. This amendment is basically a bill that Senator Frentz had brought forward. It was heard in the Commerce Committee, and at that time I told the committee chair that this should really be heard in the Health and Human Services Committee, and he agreed, and the bill did not get referred to HHS, and we did not hear it this session. It would be a bill that we would need to hear in HHS to be able to allow our members in the committee to discuss the implications of it. I'm opposed to the bill because while we do today, we are, as a state, committed to putting forward defrayal costs for mandates that affect the individual market. This would expand that to the other markets, the small group and large group markets. There is not, there's a statement in here that the commissioner must make payments to health plans to defray this cost, but I'm really wondering how the costs will be calculated and how the state is supposed to be planning for the dollar amounts that would be necessary in order to make payment within 60 days that a statement is received from the health plan company. This could be a huge additional cost, and I think that the rationale for this is not that we should be taking on that cost as a state. It should be asking, why doesn't insurance cover some of these requirements that we're saying are valuable, such as wigs, as I mentioned, wigs for cancer patients. Why do health plans not cover sufficiently orthotics and prosthetics? The testimony we heard in committee about that particular mandate requirement It was incredibly frustrating to hear testimony from people who needed access to better prosthetics and how their insurance plans only covered the very bare minimum, and they were not able to access what they needed to live their fullest lives. So I would say, members, this is not a path that we should go down as a state to move forward with this defrail provision, and I would ask members to vote no on the amendment.
Senator Grudenhagen, we're on the A77 amendment.
Oh, thank you, Mr. President. Yeah, you know, I know Senator Wickland is well-meaning, and I don't mean to contest her on her rationale, but I do have to rise in support of this amendment. You know, in private companies, they have what's known as actuaries. Actuaries figure cost versus risk and reward. And it's a science. And unfortunately, in government, that seems to get muddied. You know, I mean, we got all kinds of examples of government saying one thing and the cost going the other way. And piling, you know, like I said before, government's good at piling on mandates and requirements. And that's what we're doing in this, this bill, and this amendment would address some of the cost of that so that we have good data on whether to make a decision or not. And I can give a couple examples. No examples? You can't give examples? Okay, thank you. I know it's getting late, so I'll keep the example short, okay? But, you know, special ed, we just pile on one requirement after the next, and yet the OLA came out in 2013 with a report that said, you know, we've got, I think, almost 50 to 70 more requirements in special ed than what the feds require, and they've never been evaluated for cost or effectiveness. That's government. Look at Obamacare. All kinds of promises about your premiums going down. And yet, what did your premiums do? And deductibles, they skyrocketed. The other thing about Obamacare, similar to this, is it had essential benefits. And that's what the health insurance companies had to offer. And you know what they did? They excluded benefits that were currently covered under MCHA, the Minnesota Health Insurance Plan. And we had people in HHS, which this is, come and testify when I was in the other body. They were spending thousands of dollars on their neurological problems for their children, and there was no coverage. And they used to have coverage before Obamacare. So members, this is a rational amendment so that we have accurate data to evaluate the mandates and how they're going to be cost. I know government doesn't like that because government gets this feel-good idea, well, let's just pass this mandate. But we actually need to learn something from the private sector. There is a risk and cost and analysis, and you have to look at that. And I don't know. You know, this is why socialism and Marxism don't work, right? It's just we based it on feelings and good intentions rather than on data. So members, we definitely need this type of data to evaluate the mandates, both on what we have, unfortunately this won't do that, and what we will mandate in the future. So please, members, vote green, and not just with feelings and, well, I think it's a good idea. I know that's popular in government, but it doesn't work in the long run. And that's why we got skyrocketing premiums with people can't afford health insurance. Please vote green. Thank you, Mr. President.
Members, we are on the A77. All comments going forward should be on the A77, not in general. Let's please focus on the A77. Senator Friends.
Thank you, Mr. President, and thank you, Senator Utke. Yes, I am the proud author of the bill that is the foundation for the A77. I'll be voting no on the A77, and here's why. I appreciate the talk regarding the costs, and that's why I brought the bill. I do think we have to ask the tough questions about what mandated benefits are important. However, I have an equal amount of respect for the committee process, and I have an even greater amount of respect for the bill author. And after consulting, I think the provision has merit but needs work, and not for my yes vote today. Thank you, Mr. President, and thank you, Senator Utke.
Senator Lucero.
Thank you, Mr. President. I want to address something I heard Senator Wiklund say in response, and the reason to her encouragement anyway to vote against the A77 amendment. In her remarks, she said something to the effect of, I'm not sure how the agency would pay for that. I'm not sure how they would come up with that money. I'm not sure how they would determine what that would be. And the reason that greatly frustrates me to hear that as an answer is it demonstrates the greater interest in protecting government than it does in protecting the welfare, the best interests of those who are going to inevitably end up paying the costs as a result of higher premiums that come from new mandates. It is mind-blowing to me that it's a disconnect between a new mandate resulting in an increased cost that eventually gets passed on to us. That should be what we're concerned about. That should be what we want to make sure does not increase the hardship on Minnesotans. Instead, what we heard is the answer, well, how is the agency going to pay for that? There's going to be new costs. Government can't be responsible for that. We're just going to shove that off. That's the problem, Mr. President. That's the problem. As I read this, if an evaluation of a mandated health benefit proposal concludes that the proposal is projected to result in a net increase per member per month, an increase, that means more money out of pocket and less money that is able to go to housing, childcare, and any other expenses that the hardworking taxpayer and family might be incurring. If there is that increased, net increase per month per member, that within 60 days, et cetera, members, please stand on the side of Minnesotans. Please stand on the side of common sense. Please stand and have a greater interest in the backs that are breaking across Minnesota, the empty wallets that are occurring in part because of the increased costs that are happening from mandates by the legislature. With a roll call having been called, members, I encourage a green vote on the A77.
The last voice you will hear before we vote on the A77 will be that of the author of the amendment, Senator Utke.
Thank you, Mr. President, and thank you.
Hold on, Senator Utke. It looks like somebody was waving back there, and I saw a group of people standing, but no waving. Senator Wiklund, before we go to Senator Utke, my apologies, Senator Utke. Senator Wiklund.
Thank you, Mr. President. I'm sorry I wasn't waving enough to catch your attention. Members, we do have a way to calculate the impact of mandates, and we use the process today of the 62J evaluations to help us understand what information the Commerce Department can glean from looking at other states, how they've implemented mandates. They gather information from stakeholders, and they do, if they can, an actuarial analysis. And we do have that information. I believe that we should keep in control of making the choice by using the tools that we have today, which are the 62J evaluations. We take that information in, the fiscal notes we receive, and then we have committee hearings and we discuss which mandates might be valuable and appropriate, and which ones we would consider not to be that as important or the cost that we can bear. What I don't like about this amendment is that it takes away that if we pass a mandate, it's just out of our hands then. The amount, it will be calculated and we will be sent a bill, and the taxpayers will have to pay that cost. So this isn't just like magically we will have the money appear somewhere. It will be taxpayer money that will have to be set aside to accommodate the small group and large group market defrayals. So I believe we should continue to use the tools we have. The effect of this bill this provision would make it even more difficult for us to hold insurance companies accountable by providing comprehensive coverage that doesn't leave people behind and doesn't leave out important coverages. So members, please vote red.
Senator Ecke, last voice we're here before we go to a roll call vote.
Thank you, Mr. President. And members, as Senator Wickland said, she talked about some things we have in place. Another thing we have in place is the mandate review. We've all heard that numerous times also. When one of these proposed mandates comes forward, the review is supposed to go to, that request should go to Commerce so that they would have the better part of the year to investigate, calculate, and report back to the legislature so that when something is passed, we know what that cost will be. This is just a different format where if it goes through and they find out that it's got cost, that there's a way to help cover it, because that cost just doesn't go away. Either the state's going to contribute to it through all of the taxpayers, or the insured, the policyholders are going to pay for it. We as citizens pay one way or the other. There's no way around it. Insurance is no different whether it's health care or what you're seeing in your current auto and home rates. Everybody is seeing your rates increase as costs go up. And it's kind of like you squeezed a balloon. If you try to shortchange it on one end, the other end gets bigger, and another group is paying a lot more than they should. The cost just doesn't go away. We just have to figure out a way to distribute it as fairly and as evenly as possible. This is just one additional tool that would help that. So, members, I would ask your support and ask for a green vote for the A77.
The Secretary will take the roll on the A77 Ecke Amendment. Members, please vote. Senator Duckworth, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Anderson votes aye.
Senator Anderson votes aye.
Senator Barr votes aye.
Senator Barr votes aye.
Senator Dames votes aye.
Senator Dames votes aye.
Senator Draheim votes aye.
Senator Draheim votes aye.
Senator Housley votes aye.
Senator Housley votes aye.
Senator Miller votes aye.
Senator Miller votes aye.
Senator Weber votes aye.
Senator Weber votes aye.
Senator Wiesenberg votes aye.
Senator Wiesenberg votes aye.
And Senator Howell votes aye.
And Senator Howell votes aye. Senator Morrison, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Bolden votes no.
Senator Bolden votes no.
Senator Dietzick votes no.
Senator Dietzick votes no.
Senator Fateh votes no.
Senator Fateh votes no.
Senator Kunish votes no.
Senator Kunish votes no.
Senator Mann votes no.
Senator Mann votes no.
Senator Marty votes no.
Senator Marty votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Umu Verbatim votes no.
Senator Umu Verbatim votes no.
Senator Pa votes no.
Senator Pa votes no.
Senator Port votes no.
Senator Port votes no.
And Senator Zhang votes no.
And Senator Young votes no. Senator Herb, are you planning to vote? Senator Herb, thank you. All senators having voted who desires to vote, the secretary will close the roll. There being 30 ayes and 35 noes, the A77 Uckey Amendment is not adopted. Members, I'm going to Senator Abler.
Is that okay with you, Mr. President? Thanks. Anyway, so I'll just get to it. I'd like to move the A80 amendment, and then I'll describe it.
Senator Abler moves the A80 amendment. The secretary will report the A80 amendment.
Senator Abler moves to amend Senate File Number 4699 as follows. Page 90 after line 16, insert. This is the A80 amendment.
Senator Abler to your A80 amendment.
Well, thank you, Mr. President. This is not my most eloquent speaking time, but the amendment is well worth the wait. There's a real problem across the state. We talked about health care. There is hardly a free market anymore in health care, so the wishes for people who wish we could go back to something like that, I would just urge you to keep wishing. We have developed a system in Minnesota where approximately 60 to maybe 70% of hospitals are facing payment rates paid for by the state and the feds. If they reach cost, you're lucky. Sometimes it's even below cost. We used to cost shift from the private market, which is not very big anymore. And so many hospitals and hospital systems find themselves in harm's way. You don't have to look very far in your own locale to see such a hospital. And they are, as hospitals are deeply dedicated to the services, to the people who need their service. What has happened, however, has more and more consolidation has happened, and more large groups are running hospitals. And despite the commitment of the locals, it seems many decisions are made that are more in the interest of the math as opposed to service. And you have to pay the bills, Mr. President, as every hospital knows. There was a time in the recent past, 10 years ago, and even more recently, where hospitals actually had a profit margin. That is more difficult now between COVID and everything else. And so in my particular area, the hospitals, we're going to close some services, and it was the opinion of many people, including the doctors and nurses who were connected to that, that was actually not a good idea. And so this provoked a whole discussion about how then should we decide if it's okay to close a hospital. In Mahnomen, the hospital closed the emergency room, or closed the hospital part, because they couldn't, they had very few guests, and it was decided to keep the ER open so you could have emergency services out there. And onlookers would say, like, that probably doesn't make sense. It's too bad there's no services there, but there's no people really going. In other areas, they closed Foston, which was a big stir. Some years ago, the Mayo Clinic closed their obstetric services in Albert Lea, still to the chagrin of the Albert Leeites, where they had to go to Austin to get their maternity care. And so how do you balance the math with the mission? I believe, like, an example of another hospital that's challenged these days is North Memorial, which I believe has a high, strong commitment to mission. And they're in trouble, but they're doing everything they can possibly do to serve the people who need their care. In other cases, it seems like it's more driven by motives that are not so connected to service, but to more of a math problem. And this happened out our way in the Mercy and Unity situation. And so the question arises, who then should be the accountable party to help decide, is it a good idea to truncate services at all? And should you leave it up to the corporations? And I'm not here to bash corporations necessarily, but corporations have a duty to their own, to the people who are running them, even as a nonprofit. And so I'm not even going to go into the corporate questions so much about who's to blame about that, but who should decide? Should the corporation be allowed to decide what they're going to do? As we get more and more consolidation, I'm going to suggest, Mr. President, that someday we're going to have a company called BizHealth, which is going to run most of the hospitals in the state and 80% of the doctors and nurses, and they're going to decide who gets what for health care. That's some down the road, and there's no company called BizHealth, but I'm just predicting the future 10, 20 years from now as things consolidate more and more. And who should decide, Mr. President, that your citizens don't need care in a reasonable distance from their homes and adequate at that? And so it occurred to me, working with nurses and doctors and locals and Representative Cagle, excuse me, it is late, and others, to find a way that would truly be reasonable to do. And the only entity in this state that I could think of, and I would happy if somebody else think me of a better one, is the Department of Health. Mr. President, I have not been a Department of Health aficionado every day of my legislative career. They do some things well. We've had all kinds of discussions. But in this niche, I believe they are the best suited to adjudicate the question, is this in the public interest? Now, when we cite a hospital, there's a public interest review, which takes a long time, and they've not always been successful in deciding. But I think in terms of their stature, and they are generally trusted and with expertise in this, that they should be the ones to decide, is this a reasonable move that will serve the community interest and provide adequate care? And so, just in case in point in the particular local thing at Mercy and Unity, the decision was to close the overnight pediatrics unit. Okay, well, what does that matter? Well, there are cases you need a unit in a reasonable place that's close enough to home. And so you go, well, just send them to Children's. But Mr. President, what if Children's doesn't have space? And this decision was made without any agreement with any other auxiliary places for people to go. To me, that seems like that's not in the community interest, and I believe it should not go forward. And so what the amendment asks for is that if this particular company, and I'm refraining from using their name in the interest of just being a good sport, they would bring their idea forward that they want to close an operating room and an intensive care unit at one building and close the overnight pediatric service at the other building, and indeed, can they consolidate and have enough room? And will there be enough service capacity to meet the capacity that they've met before? And why is that important to even ask somebody that question? By consolidating and assuming the service controller for a region, in my view, they've taken a responsibility and a mission to serve that area. And so, Mr. President, what the amendment calls for is actually an expedited review. This company would then submit, or any hospital, before it truncates services in a notable way, would submit a plan to the Department of Health on their plan and what the alternatives are and so on privately. This would not be a public process. And then they would get feedback and be told, well, maybe you can close, maybe you don't need the ICU, but you need an OR, and you should keep the pediatric beds, but at least you better keep 5 of them. And then that would become the plan that would go forward, serving the public interest. And so this is coming to us, if it hasn't come to your neighborhood, Mr. President, whether you're in Minneapolis or if you're out in Biwabik or Worthington, it's going to come soon, where these decisions come. And I believe that we need to be sure that people get the care that they are expecting to get. And so with that, Mr. President, I'd request a roll call, and I would request a green vote.
Roll call requested, roll call granted. Senator Wickland.
Thank you, Mr. President. Senator Abler, I appreciate your bringing this idea forward again. We did have a discussion about an amendment you brought forward to our the night that we passed the bill out of committee, and I felt at that time that amendment needed more work and more definition. And I appreciate that what you've come back with has more definition. I think we heard testimony that day from personnel who work at Mercy and Unity, I believe, and they had very powerful testimony about their concerns about the process that was used to determine closing units and making changes at their locations. And so I do think this is a really important issue that we need to address and try and understand if there is a better way for us as a state to understand when something like this is proposed, what is the impact going to be on the communities. We did include language that was a modified version of the bill that Senator Kupek brought forward that had to do with the hospital closure process, and that is more of a notification and public hearing process. It's not a process where a decision is rendered by another entity like your proposal has. I think my concerns about your proposal are that the clause that says that this would impose a prohibition on the entities taking action if they didn't meet the public interest. And I'm not sure, I think it would need to have more vetting in terms of whether this is legally possible for us to implement in this manner. I have some concerns because we didn't hear this as a bill in committee and have a chance for the entities that would be affected by it to come forward and tell us, specifically what would they have concerns about in terms of being able to develop these action plans that they would submit and the timeline for it, and getting responses from the Department of Health. So I have some concerns about that. And then in terms of the Department of Health, we don't have their feedback in terms of a fiscal note to implement it, although I know you do have a mechanism in the amendment to draw funds from Department of Health. So I'm not saying that it's out of balance. I'm just saying that we do need to understand what it would cost to implement. So I'm interested in continuing to have discussions about it. I have some alternative language that the Department of Health had provided that is a enhancement on the hospital closure process. It doesn't have a decision-making point for the department, but it has some more data collection, and I guess I'd like to discuss that with you as well. Members, I guess my inclination is that if you think that this would be, a process that you'd like to see examined more, I think it's fine to support Senator Abler, and we will continue to discuss it. I would like to have more discussion about the language and its implications before I say that we would for sure be able to include this finally this year. But I think that the issue is a really important one, and I think members can choose to vote as you feel fit.
Senator Hoffman.
Thank you, Mr. President, and to the good senator from Anoka, thank you for bringing this language. What it really does is it sets the systems to align with future consolidations, and I think it really takes a look at lessons learned from the past, and it's so good to hear Senator Wickland talk about, this is worth having a discussion. So it sounds like that, and I just would support people to support the senator from Anoka and looking at what we can do. Both the MNA and the doctors' unions have said this is the right direction to go, so please vote green.
Senator Nelson.
Oh, thank you, Mr. President. Members, I appreciate Senator Abler bringing this amendment forward and this concern forward. I think we all share the goal and the actual desire that we can ensure that all of our communities have access to the hospital care when they need it, the excellent hospital care that is needed. But I have some additional concerns. I listened to the senator from Bloomington, the chair, list off some of her concerns, like there's not a real fiscal note here. We don't know exactly we don't have any idea really what the cost would be. And is also the concern about this late date. where we were trying to wrap up session. But I think the broader concern of mine is the fact I don't know how this amendment would actually be helpful. I don't know that it would be helpful at all in forcing a business, in this case, a life-saving business many times, to stay open, and when there is not the patient census or the ability to pay for the care that's needed when it's needed. And also, there is a concern too regarding the safety if in fact the hospital is not being used as much as it would need to, or it's not able to provide the type of care that the patients need. And when we think of hospital care, we think of those often emergency cares that need to be taken care of right away. And so I am just concerned that it's a well-intended amendment. I think it could have harmful effects, maybe just the opposite effects of what was intended. And then to the chair's point, you know, this bill, this amendment, it was never introduced as a standalone bill even. It didn't have, I don't believe it had a hearing. And I think it is so important that Minnesotans have access to hospitals that are able and capable to take care of the needs that are presented, and that hospitals that are able to stay afloat, so they are going to be there in the future as well. So I have a few questions for the senator from Bloomington, if she might yield.
Senator Wickland, will you yield? She will yield. Senator Nelson.
Oh, thank you, Mr. President. Well, I think you might have mentioned this, Senator Wickland. I'm just curious, has the Department of Health weighed in on this proposal, and what did they say? What's their feedback been?
Senator Wickland to the question.
Mr. President, Senator Nelson, we became aware of the amendment in this form only this morning, or, well, yesterday morning. And so we asked for some feedback. I think, you know, we got some concerns about not knowing exactly how frequently they would be needed to respond to these action plans and reviews. And so that would make it challenging to figure out exactly what the cost would be. And then just, I guess, some general thoughts about how many people that it would take to implement. I would have to look back at my notes, though, for other statements that they made.
Senator Nelson.
Thank you, Senator Wickland, Mr. President. So it's a relatively new, it's a large proposal with significant outcomes. I would suggest that this is something that is just not ripe and ready for this time. But again, the need is great, and we have to figure out how we can have the health care that's needed, where it's needed, when it's needed, and in a way that is affordable. I am concerned that currently, I don't know that the Department of Health has the time nor resources to actually achieve the goal here. I think the language has been, it sounds like it's been poorly vetted. And as I said, it wasn't introduced as a standalone bill. So my hope is that we will continue looking at how can we make it so our hospitals can continue to operate and can continue to serve patients. But sometimes it's a difficult environment. In fact, I don't know of hospitals that close because they want to close. Certainly it's because there's a lack of patient census. There's just not enough patients. And how are we going to handle that? I think it's a real concern. I just don't think, number one, this is ready for prime time yet. And I think the question should continue to be looked at, but I would encourage a no vote on this amendment tonight.
Members, we're on the A80 amendment. Senator Gruenhagen. Please reframe your comments to the A80, please, sir. Senator Grudenhagen.
Thank you, Mr. President. Yeah, I see some of the concerns that Senator Nelson said, but I do think Senator Abler is trying to help in a very difficult situation. And when I look at this amendment, it's a Band-Aid from my standpoint. You know, Senator Abler did reference the information sent out by the lead lobbyist of the Minnesota Hospital Association, and I was invited to a Zoom meeting with about 6 CEOs from major hospitals of the state of Minnesota, 2 from the metro and 4 from the rural. And, you know, the lead lobbyist said, we have 67% of the hospitals in the state of Minnesota losing money. Okay? Let that sink in. 2/3 of the hospitals of the state of Minnesota are losing money. And Senator Abler, with this amendment, is trying to put a handle on it. Unfortunately, this will be a Band-Aid. It's managed decline is what it amounts to, okay? And actually less access. So I'll just share with you what the 6 CEOs told me and other people on the Zoom meeting. They said that for every $2 of expenses, they get reimbursed about $1 from Medicaid and Minnesota Care. So $2 of expenses, they collect on average $1. From Medicare, they collect $1.50 for every $2 of expenses. So they still lose money, not as much as under Medicaid. On private insurance, they get $2.50 average reimbursement, according to these CEOs, for every $2 of expenses. So they actually make money to cover their expenses. The problem is, members, we have the baby boomers are retiring. You're having a greater and greater percentage of government reimbursement and less private insurance, which unfortunately the federal government and some of the state has seen as the enemy, when in fact it is the friend of the healthcare system. So members, this amendment, again, it's a Band-Aid that basically does manage decline. If you want to solve the problem, the CEO of Rochester Mayo several years ago, talking to the President of the United States, it was the Star Tribune, and I cut the article out, is on the front page. He said that the Mayo was considering not accepting government health care patients. Okay? Now, he was heavily criticized, and he retracted that statement a few months later. But think of the CEO of the Mayo system in the state of Minnesota, one of the best in the world, stating that they were considering not accepting patients on government reimbursement. We have to reinvigorate the private sector if we hope to maintain a healthcare system that's given us the services and medical miracles that we've seen. Going with more government-run healthcare is only going to create this amendment, which is going to manage the decline of our healthcare system. And we're ultimately going to wind up with a 2-tier healthcare system, one for the rich and the privileged and a second-rate one for the rest of us. That's the direction we're going when we rely on government to solve our problems. Please come to your senses. We want to keep access for yourselves, your children, and your grandchildren. But more government is not the way to go. We have to reinvigorate the private market. Vote your conscience on this amendment. It'll probably slow the decline, but we're still going the wrong direction. Thank you, Mr. President.
Senator Lucero, we're on the A80 amendment. Senator Lucero.
Thank you, Mr. President. I sincerely appreciate these conversations, and I know that these are tough, and I appreciate Senator Abler bringing this and having this conversation. And I am intently listening. I'm listening to Senator Wickland. I'm listening to Senator Gruenhagen and others. I was in the car here on a drive about a month ago or so on a Saturday, and I listened to a radio program, and I heard a term I'd never heard before. And it was, and Mr. President, maybe you've heard this, the term, I quickly looked it up here just to refresh me, Peak 65. And if you haven't heard of Peak 65, just very briefly here, this is one article. In 2024 is a record-breaking year for retirement in the U.S., and what Peak 65 is referring to is an average of 11,000 Americans per day are expected to hit their 65th birthday starting, I think it was April of this year through the end of this year. 11,000 per day. And then it goes on to say that's approximately 4.1 million Americans are turning 65 every year beginning this year through 2027. So Peak 65. So what does that mean? Think of all the healthcare issues that are going to come up with, obviously, the natural aging process. And we're hitting that Peak 65. And so I think about that. And then I think about a conversation I had maybe 6 weeks ago. A constituent group came in. I think it was MNA. Day on the Hill, if I remember correctly. So the nurses came in. I'm guessing there was approximately 8 of them came into my office. And among their top priorities in their legislative list was hospital closures. And so in the group of 8 or so, 8, 10, I think 3 might have been my constituents. Others were from other parts of the state. And those MNA nurses that were in other parts of the state were describing hospital closures. And they were going on and explaining the negative impacts that have on the community, the hardship that causes. And I don't have the background in health or hospitals or any of this content, which is deeply complex, which is why I very much appreciate and rely on the skill and the experience and knowledge of others, and why I'm listening to Senator Wickland, Senator Abler. So I guess I want to ask Senator Abler a question if he's willing to yield.
Senator Abler, will you yield? He will yield. Senator Lucero.
Thank you, Mr. President, and thank you, Senator Abler. So, because again, there's a lot of moving parts and a lot of things that I don't have experience with in this, is my recollection of the MNA nurses and speaking about hospital closures and the drivers for the hospital closures, as I heard one of the drivers, Senator Gruenhagen just referenced, was obviously losing money. That's going to be exacerbated by the Peak 65 and the additional health that's going to bring. If they're losing money with each patient, that's a concern. Is your amendment dealing with, and obviously I have no idea if you met with MNA nurses on MNA Day on the Hill, but I'm wondering, is the hospital closure, if indeed you did meet with them, is this amendment dealing with that issue that they were concerned with?
Senator Abler, to the question.
Well, thank you. And this is all about closures of hospitals. Hardly ever close all the way. They may close. I have to look at the president. Sorry. Actually, I'd rather do this. That's a House thing. So the hospitals hardly ever close the whole hospital, but they may close a service. They may close. They may downsize a department. So it's practically much smaller and insufficient. I think Senator Gruenhagen had talked about managing decline. The question is, do you want to manage the decline or do you want to not manage it? And who should manage it? And do you want it random or do you want somebody to look over it? And so if a hospital has to close, well, then it probably does, but it should close for reasons that make sense. And then you have to figure out a way how you're going to serve the people that are left. And that's the intention of this, if that helps answer your question.
Senator Lucero, we're on the A80 amendment.
Thank you, Mr. President, and thank you, Senator Abler, and thank you, Senator Grunhagen. I honestly have no idea how I'm going to vote on this. I don't want to just manage the decline. I want to have a solution so that we don't have hospitals closing and then having to figure out whether it's a whole hospital or whether it be, as Senator Abler just said, a closing of a service, a particular offering of service that might force residents in rural Minnesota to have to drive 50, 60, 100 miles to obtain a similar service. I hate that we're even in this position. I hate that we even have to have this conversation. It was a tough conversation with the M&A nurses. It was tough because I don't have a solution for this, but it certainly is one that we don't want for Minnesota, and it's something that Minnesotans should not have to contend with. We shouldn't have to deal with driving 60, 100 miles to a service. We shouldn't have to deal with what are we going to do to close hospitals, put controls in place to slow down the decline or closing of services or ceasing of services. Instead, the conversation should be, what can we do to expand? How can we improve? What can we do to make sure that Minnesotans have accessibility to the greatest degree possible? And so I hate that we have to have this conversation, but I value and appreciate those that have greater experience as I'm listening so I can and hopefully make the best choice on this amendment. Thank you.
Members, the last voice we're going to hear will be that of Senator Abler, who is, Senator Liskey.
Thank you, Mr. President. Mr. President, I had no intention of speaking to the amendment, but it's definitely been a good conversation so far tonight, and I think that's something that's important to me, and I wanted to kind of address maybe a bunch of different ways of looking at this amendment as it is. From the problems that Senator Abler is trying to address, I wholeheartedly feel the same issues. I have experienced this in my own district. Portions of the Mayo Clinic system in New Prague have shut down different departments, different parts, without much notice, normally about a month at the most, maybe a couple weeks. We had a clinic system close in our small town of Lonsdale with about a 2-week notice, and it was posted on Facebook. It wasn't sent out to patients. It wasn't something that was brought up. So when we're talking about rural access, I wholeheartedly feel the need for something like this. My concern is that this specific amendment may not actually approach fixing that issue. A lot of times, just having to report it to somebody else and them telling you, no, you can't close even though you physically can't stay open, I don't think that solves this problem. And I think that's part of the issue that I have with this amendment, because it's more of a mandate telling them they can't close than it is a help find out why they're closing. And so with that, I'm hopeful that we can work together, Senator Abler, on finding the actual solution to the problem. Unfortunately, I will be a no vote on this. Thank you.
Senator Johnson.
Thank you, Mr. President. Appreciate the amendment coming forward here, Senator Abler, and what you're trying to do here. I, too, had a hospital and actually am going through a similar situation in my district, little town of Foston. But as we continue to increase the mandates on our hospitals, as we continue to make healthcare costs more and more expensive, the economics of these areas is getting more and more difficult to sustain these healthcare operations in those areas. And I agree that we need some improvement on when significant changes to our healthcare within our local communities is being affected by decisions of healthcare systems. There needs to be a process. Currently, the process is broken. I will admit that, and it seems like our communities are being affected by that, and people are being, their health care is being interrupted by that. But I think the answer isn't simply giving the authority of regulating how businesses, how these healthcare systems are making these decisions, giving that authority over to MDH into some sort of subjective review. I think what we really need to do is pare this back and figure out what sort of regulatory framework that we can put into statute would help give a real guide path for making these decisions. You know, I know there is some notice, but I don't know how much teeth is involved with that notice. and how much these healthcare systems actually have to comply with what little is there in the regulatory framework presently. And so instead of taking this easy route and just saying, MDH, you figure this out, if you determine that it's within the public interest, has an operational impact, if there's adequate time, that sort of thing, why don't we put that into a statutory framework to do that and actually do our job instead of burdening the executive branch with more work. And so for me, I'm with you, Senator Abler, on the need to do something. However, I think we can do that in-house with the input of our healthcare providers, along with the stakeholders involved with that, to bring a bill forward that would do what we need to do to give clarity to the systems as they make these major business decisions in healthcare across the state.
Senator Utke and then Senator Abler.
Thank you, Mr. President. And Senator Abler, I know your heart's in the right place when it comes to this. You, like all the rest of us, care about our local providers, and we'll do everything possible to make sure that they succeed and keep them around. But on this particular amendment, I have to oppose it. There's a lot to this process. I started out this bill hearing a number of hours ago and said, we need to address this whole big problem. We've got a lot of challenges in our healthcare industry. We need to have some serious conversations with all parties and come up with something that's more workable, because we kind of keep nicking things around the corner and we're not going in the right direction. Our providers go to work every day to help us. They show up to help us and cure us and treat us. The last thing they want to do is shut down a service they offer or a wing of their facility. It's a business decision. They just get to the point where they just can't operate anymore. And this is putting government in the middle of private business, and I just don't like that. So I would encourage everybody to bring an amendment back like this in the bill form next year. We got a chance to see the other offering come to our markup night for our bill, so it's a quick amendment. We look at it and see that there's a lot more that needs to be talked about. It's kind of that same thing here. I would encourage some further discussion, but at this point, I would like to see it stay out of the bill. It needs more discussion. First of all, it was never in a bill. We all know that already, and we don't have a fiscal note. I'm hearing that there's a sizable cost to MDH, and I think we need to know those things before we just move something forward. So, and then it boils down to, and we just heard about the Peak 65, and that kind of falls right in play with how our providers receive most of their pay nowadays. It's Medicaid and Medicare. Both are subpar payers. They don't reach up and pay the cost of the procedures, the cost of doing business. That whole equation has got to be brought back in, and we got to figure out how to make this work. But I don't see this as a helpful move. We don't need to tie the hands of our providers. We need to encourage them. We need to help them succeed and do all we can to keep their doors open. So thank you, members. And I would encourage a red vote.
Senator Abler, you are the last speaker before we vote.
Well, thank you, Mr. President. I actually wish there were more people on the floor to discuss this. I wish this was not 1 o'clock in the morning on this particular topic. So let me explain to you what happens when one of these organizations is going to close a part of your hospital. They decide they're going to do it. They inform the staff, and they have a meeting, and they take comments, and then they do it. At the meeting we had for Mercy, in particular, closing the pediatrics overnight unit, there was a parent who popped in. Most of the testifiers were actually professionals working at the doctors and nurses who actually I thought were really concerned about what was going to happen. But the man talked about his child, I don't remember if it was a daughter or a son, under age 1 who had some emergency and came to Mercy ER, and they had a bed to put him in, or her. And they could have gone to Children's, which would have taken another hour, and they went into Mercy, and they made the trip down to Children's, the baby would have died. All the doctors agreed that it's lucky they had a bed to put him in, or her. And so when that story came up, the corporate officers were like, oh, well, thank you for sharing that story. And how many stories like that do you think that we ought to have? And do you think that God bless corporations, but we've moved more and more into corporate-run healthcare and less on the mission side? And do you think it's reasonable that a company can decide they're going to close because of whatever reason they don't need this service anymore, and then not have any available anywhere in the metro? Or take him to Children's. But this particular company did not even have an agreement with Children's to have 2 beds, 4 beds, or 5 beds, or get some kind of priority care. Is that responsible? Yeah, the amendment it's kind of new. The topic is not new. The solution, we've been trying to work on this between the Representative Cagle and myself, given our situation. But in June, there's not going to be a pediatric bed in the area between Children's and St. Francis, and I don't know where the next one is going north. Is that something that we think should just be allowed to happen? And if it can happen in the metro at Mercy, and what's going to happen in Worthington or Winona or elsewhere? And so, yeah, is it a perfect solution? I don't think so. But I think it's a pretty good idea to have somebody besides a corporate entity who is worried about their math to decide we're not going to have a pediatric bed between Children's and St. Cloud unless we're fine with that. Like, oh, well, and so we talked about it, and it's kind of new, and I'm nervous about it, and well, how will it work? Or instead, we can decide, let's put this bill this amendment into the bill and keep working on it. I've been here long enough to know if there's something in a bill, it gets worked on. If there's something outside of the bill, you talk about something else. And that's my concern. My concern in my situation is that when you talk to the OR nurses at Unity, they say, well, it's not even working. And there's not room at Mercy. They miscalculated the capacity. So who gets to decide that? A company who's worried about the math, and the math matters, Mr. President. And so how do we, but there's got to be mission, there's got to be capacity. And as these places close, they're not going to come back. And sure, they're private nonprofits, they benefit by all kinds of laws we give them. And so, but if we need to have a way that we can agree on that makes some kind of sense besides doing nothing. When this session comes and goes, by the time June has come, there's going to be no OR in Unity, and there's going to be no ICU at Unity, there's going to be no pediatric beds between Children's Hospital and St. Cloud. And that bothers me. But it's a broader thing than just my little local. It's going to go somewhere else, and people are going to find themselves with a card that doesn't even have a hospital where you're nearby for the urgency you need. And so is it time to wait for the process to come up with some magic answer we have meetings about? This is not any assault on the hospital association or on hospitals. This is a way to preserve the integrity of the healthcare system, and then we can find a way to support the hospitals in the meantime by rebasing them, by helping them get their beds unloaded. But if the beds are closed, they're not going to come back. So members, I've not talked to all of you. I've only talked to a few of you about this. The discussion maybe has been in the hallway with various people. Please give this amendment a chance. You heard from Senator Wicklund herself. She's open, and I will predict it will not come back harmful with somebody as responsible as her. But if it goes in, it has a chance to get done. If it doesn't, then sorry to the people who want a pediatric. Hope you don't need a bed for your child anywhere in the North Metro. Please, members, vote green. Thank you.
The secretary will take the roll on the A80 amendment. Members, please vote. Senator Morrison? She needs a minute. That's understandable. Members, please vote. Senator Morrison, those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Bolden votes aye.
Senator Bolden votes aye.
Senator Fateh votes aye.
Senator Fateh votes aye.
Senator Kunish votes aye.
Senator Kunish votes aye.
Senator Mann votes aye.
Senator Mann votes aye.
Senator Marty votes aye.
Senator Marty votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
Senator Umover Baden votes aye.
Senator Umover Braden votes aye.
Senator Pa votes aye.
Senator Pa votes aye.
Senator Port votes aye.
Senator Port votes aye.
Senator Zhang votes aye.
And Senator Zhang votes aye.
And Mr. President, Senator Dietzig votes aye.
And Senator Dietzig votes aye. Senator Duckworth, those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Anderson votes no.
Senator Anderson votes no.
Senator Barr votes no.
Senator Barr votes no.
Senator Dames votes no.
Senator Dames votes no.
Senator Draheim votes no.
Senator Draheim votes no.
Senator Housley votes no.
Senator Housley votes no.
Senator Miller votes no.
Senator Miller votes no.
Senator Weber votes no.
Senator Weber votes no.
Senator Wiesenberg votes no.
Senator Wiesenberg votes no.
And Senator Howe votes no.
And Senator Howe votes no. And Senator Duckworth, you can vote. All senators having voted who desires to vote, the secretary will close the roll. There being 34 ayes and 31 noes, the A80 amendment is adopted. Senator Abler, do you have another amendment? If not, I have another person to go to.
Thank you, Mr. President. I think after that I should quit while I'm ahead. I want to thank people for their confidence in that last amendment. I really respect the discussion. And Senator Wickland, thank you for that. Thank you. There's an amendment I'm just going to, I wasn't even going to take a vote on it, but I would like to talk about it, please, if I may. So, Mr. President, I'll move, I can't even see, the A100.
Senator Abler moves the A100. The secretary will report the A100.
Senator Abler moves to amend Senate File Number 4699 as follows. Page 262, after line 14, insert. This is the A100 amendment.
And Senator Abler, if you're just going to talk about it, can I persuade you to be substantive but brief? Because I do have some,
yes,
I got
Mr.
a long
President.
list of other people who.
No, I know.
want to do
It's an
amendments.
important issue, and I just wanted to raise it. Yeah, fair enough. We took some time on the last one. There's an And it's actually not even in balance, Mr. President. So before they challenge it, I'll challenge it. This is out of balance. So the issue has to do with crisis mental health services. As a function of the budget last year, there was a reduction made in these. And ironically, in the bill, we're adding some services. And Senator Wickland, I talked to her in the committee about this. And I still hope as the process unfolds that there's a way to restore these critical mental services even before we add some new ones. So I'm sure Senator Wickland's well aware of that, and I just wanted to, I was thinking, should I offer the amendment and then appeal it and all that? And like, it's, I don't work that way anyway, Mr. President. But I do want to make a comment that when we work together in this place, really good things happen. And so I'm excited about that last vote, what might come of that. And I'm hoping something can happen for these really important providers. So the people that get these services are the people who have so little in their lives. They're economically challenged and everything else. So, Mr. President, with that, I'll withdraw the A100 with thanks to the body.
Senator Abler withdraws the A100. Senator Liskey.
Thank you, Mr. President. Mr. President, in a similar fashion to what Jim just did with the last, Senator Abler just did with the last amendment, I would like to offer the A78 amendment.
The A78 amendment, Senator Liskey offers the A78, and the Secretary will report the A78.
Senator Liskey moves to amend Senate File Number 4699 as follows. Page 516, delete Section 7 and insert. This is the A78 amendment.
Senator Liskey.
Thank you, Mr. President. Mr. President, the A78 amendment is an approach after many hours of conversation with many parties involved in medical record keeping and medical record recollecting. Basically, there's a lot of services in which you have to request medical records, and it costs money to request medical records, and a lot of people don't understand that it's not as simple as the click of a button. As somebody who owns my own clinic and operates pretty much on my own other than with my wife as the office manager, we experience requests for medical records on a regular basis. The problem with that is it doesn't just collect on its own. You don't just hit a button and they all show up right where you want them. You have to go search out the times that you're being asked for. You have to spend time getting them collected. Even if they're electronic records, you still have to download them onto a disk or onto a flash drive, whatever you want to call it, whatever your source of storage is going to be, and then send it off to the person who's requesting it. After many hours working with a former commissioner on language for how to make a little more peace in the valley, this is an approach to try and improve that medical record collection fees, basically. I know previously the concerns were that it was a cash cow, is what it had been called during committee, and with this amendment, there won't be a cash cow. It'll just cover the costs of what it would take to pay the employees to do that. And so after many conversations with Senator Wickland about this, this is more of a respectful offering of what I believe is a good compromise on the language. And so I'm hoping to get Senator Wickland's opinion on this if she'll yield.
Senator Wickland, will you yield? She will yield. Senator Liskey.
Thank you, Senator Wickland, for yielding. My simple question is, would you be willing to at least take this into consideration when you meet in conference committee with the other body?
Senator Wickland, to the question.
Thank you, Mr. President. Senator Liskey, yes, I would definitely be willing to take a look at it and to consider it as we go into conference committee. I would prefer to keep the language in the bill as it is right now. This was a provision that Senator Seeberger brought forward, and it was very compelling to me that it seems we have not updated this area of statute for a long time, and it really needed to be addressed because there are entities that were charging what seemed to be quite well above what they needed to cover their costs. So yes, I'd give you my word that I would be willing to keep discussing this as we move forward.
Senator Liskey.
Thank you, Mr. President. Thank you, Senator Wickland. Just to kind of give you a rundown quick on what this looks like, it keeps some of the federal language in for like the price per page, things of that nature, but it caps out at $250. So it's not runaway for the first 3 years of records. So it's not a runaway train. Many times those are the only years that you really need, especially in a court case that you're talking about personal injury and stuff like that. It's not normally more than 3 years old. But if for happenstance that you do, there is a cap for all of the records at $2,000. So it's just something to bring up. And then the other thing that I know was a sticking point at one point was the no records fee that comes back. Of course, I personally don't even charge the people if they call and ask, hey, do you have these records? I generally don't charge anything. You have the right currently under state law to do a $20 fee, and I just don't think that's fair. So I did drop that down to $0 in my amendment. So with that, I will withdraw the A78.
The A78 is withdrawn. Senator Liskey, I think you have another amendment.
I
Senator
do.
Liskey.
Thank you, Mr. President. Mr. President, I'd like to offer the A63 amendment.
Senator Liskey offers the A63 amendment. The Secretary will report the A63 amendment.
Senator Liskey moves to amend Senate File Number 4699 as follows. Page 394, delete Section 5. This is the A63 amendment.
Senator Liskey, to your motion.
Thank you, Mr. President. Mr. President, this is a whole different subject. This is relating to vaccines and child care centers and how they can handle them and how they would treat them based on accepting young children into their service. This is an extremely important provision to me. I am very concerned that we are making strides in an optional, as it declares in the bill, it's an optional thing where the child care centers or child care facilities have the right to basically get rid of conscientious objection. And let me tell you a little story about why that's so important to myself and to my family and maybe to a lot of other families out there. When I was 5 years old, I received the MMR vaccine. With that being said, it was old school. You used to do shots in the leg instead of shots in your arm like you do today. The problem was that I had an allergic reaction to the MMR vaccine. With that, I couldn't walk for a month after having gotten the vaccine. And it wasn't necessarily anything that the vaccine was a problem. It's not that I'm an anti-vaxxer, it's that I physically could not accept that vaccine. And the issue was that no medical doctor, even at that time, was willing to write a medical exemption for me, which meant that if I needed to stay on track with my vaccinations, I couldn't, because I couldn't have them with fear of possibly having a similar reaction or more severe reaction to that same thing. So I would have never qualified. Now, as an adult, I am fully vaccinated to the extent of all of my MMR vaccines. Over the course of the 34 years of life that I'm at, I did finally get them all. I'm up to date on pretty much everything you can think of. The problem is that it took me a lot longer than it would take a normal patient to do so. And so even with my children, we were concerned, and I had a lot of long conversations with our pediatrician, and she believed that spreading out those vaccines was important, because with the history of what I had gone through and my daughter's first reaction to one of the lesser aggressive vaccines, it was a good idea to just spread them out. It took a little longer. It meant that they wouldn't qualify to go to daycare if this was the case. And so, but the doctor wasn't going to write a conscientious objection because, of course, we were still going to do the vaccines. So it wasn't something that she could just say, well, we're not doing it right now, and then we'll take it away later. So she didn't have any reason to change that. And so with this amendment, it basically puts back in the conscientious objection. Basically, it allows the parents to make the proper choice for the proper health care for their children, and it keeps away the ability for child care centers to basically pick and choose who qualify to go to there.
Senator Wickland, to the A63 amendment.
Thank you, Mr. President. I rise in opposition to this amendment. We had a very good discussion in committee about this bill. Senator Bolden brought this bill forward. I would like to say that my characterization of this bill would be that it is simply a way for businesses, either child care centers or family child care providers. It allows them to make individual choices for their business on how they want to manage the risk in the best interests of their business and their customers, which are very young children and their families. Currently, there are different exemptions available. There's several exemptions to vaccine requirements. They're allowed. There's a medical exemption. There's an exemption for demonstrated immunity, and then there's the personal beliefs exemption or conscientious objection exemption. And this would simply, the change this would make is that it allows a group of independent businesses, these licensed child care providers, they could make a choice about having a policy around immunization only involving the last exemption, the personal beliefs exemption. And they could set a policy that said that they would not choose to accept children in their care, that parents bringing the personal beliefs exemption. They could not deny a child because of a medical exemption, but it would give them an option. The reason that this is so important is that there are infants and young children that are too young to get certain vaccines, and they're not protected. And if there is a child from a family that has decided their personal belief is that they do not want to get the vaccinations sequences, that can put all of the children at risk and the provider at risk for having to close their business if there is a case, for example, of measles that is a measles exposure. It would cause a center or a family child care provider to have to basically close for about 2 or 3 weeks because of the period of time, that exclusion period that people have to watch for any chance of their child developing the disease. And diseases like measles are very serious and can cause very, very serious impacts on children. So I don't believe that it isn't removing the ability to have a personal beliefs exemption. It is giving a business the ability to make a choice about their own policy. And so I feel strongly that we should retain this provision in the bill, and I would ask members to vote no on this amendment.
Any other discussions? Senator Liskey, any last minute words? Senator Uckey. Oh, okay.
Thank you, Mr. President. And Mr. President, would Senator Wickland yield for a question?
Will you yield, Senator Wickland? She will yield. Senator Uckey.
Thank you, Mr. President. Thank you, Senator Wickland. I asked this question because I don't know the answer to it, but would not a daycare facility have that option today without this language if they really had concerns about vaccinations and possibly somebody coming to their daycare that would be carrying an infectious disease? Thinking that, we're all behind giving the small business choice, being in control of their business, but can't they do that already?
Senator Wickland to the question.
Mr. President, Senator Utke, this particular health standard, this statute, it is health standards, immunizations, school children, but it's subdivision 1 is school and child care facility immunization requirements. So it does not give them the ability in the statute to have their own policy for the personal beliefs exemption. They're in the same statute with schools. So no.
Senator Uckey.
Thank you, Mr. President, and thank you, Senator Wickland. Even though that's the case, I would still request and hopefully see red votes come up. This is one of the many issues that drives a lot of communication traffic from our districts, and I would say I don't know of anybody that's asked for this, but about the time you say it's 100%, somebody might have slipped one in, but overwhelming majority do not want to see this come in and be even though it's not a mandated item, it gives the operator the choice. Parents of young children are still very concerned, and so I think this just takes it a step too far, and would hope that we see this red vote come forward. So thank you, Mr. President.
Members, just so that we're clear, no one has requested a roll call vote, because I hear people saying red vote, green vote. I just want you to know that. Senator Coleman.
Thank you, Mr. President. I'd like to request a roll call, please.
Roll call requested, roll call granted.
Thank you, Mr. President. Members, I'd urge a red vote on this on two fronts. First and foremost, I don't know who here has tried to find childcare lately, but it's not an easy task to do. I remember when the twins were born, I could not find a child care center within an hour of my home that could take both of them. What we're doing here is we're potentially putting parents in an issue where they would have to choose between their personal beliefs and driving an outrageous amount of time, interrupting their work and their lives and their budgets to find a daycare provider that would take them and their children who may not have all of the vaccinations out there, whether that be because their family has a history of bad reactions, like we heard from Senator Liskey, or any other number of personal reasons. Now, the claim is that they're not taking away the personal belief choice, but it absolutely could if all daycare providers or a majority of daycare providers within an area choose to implement this practice. Members, wherever there is risk, there must always be choice. And what we're having here is the potential of this choice being taken away from families who want to have their parental rights, who want to have their personal beliefs intact. And so I would ask for a green vote, I apologize, a green vote on the Liskey amendment here, and appreciate your consideration.
Senator Matthews.
Thank you very much, Mr. President. I too rise in favor of the Liskey amendment, and this is an important section. It is highlighting a very egregious section in this bill. And I don't doubt that some of my colleagues on the other side may want to have this power, to have this control. But just because you may want it doesn't mean that it's right to have it. And to hear the arguments being made that, oh, we're not taking away your rights, we'll just let a business take away your rights, does not meet the smell test in this discussion at all. The issue before us is whether or not we will protect the conscientious rights, and included in that is the First Amendment religious freedom rights of families and of parents to raise their children the way that they see fit. And while I wish that we had religious exemptions delineated as a separate category under Minnesota statutes, it is still encapsulated within the conscientious objections. And those are important. And to come out clearly, as this bill says, and say, oh, a business can just make a policy and do away with your rights, is absolutely the wrong decision to make. Again, you may want to do it. You may think that you should have that control over other families, but you don't have that right to decide what is best for other parents and for other children. So I urge members to support the Liskey amendment. Let's continue to stand for families, to stand for their personal freedoms and beliefs, and reject this portion of the bill. Thank you.
Senator Uckey said he wanted something to say that he forgot. Senator Uckey.
Thank you, Mr. President. It must be getting late, and I just have to correct myself. I asked people to vote red, and I need to correct that. I support this amendment wholeheartedly. Please vote green.
Senator Mitchell.
Thank you, Mr. President. I would say, as someone who has had to work with childcare for many years and cobbling together all hours and all schedules, the ability for these home daycares to not be able to set some frameworks as to what goes on in their homes adds to our childcare crisis. My mother used to provide childcare. She's immunocompromised. If she was still doing it today, she would need children in her home that were vaccinated. People have kids in their homes sometimes when they provide daycare that might have a health reason that they would need children in their homes that were vaccinated. They would not be able to provide childcare otherwise. So by not allowing them to set this framework, you actually limit the number of places that can provide childcare. I will also say, as someone who has been on, find a babysitter, find a nanny, find whatever else, this sorts itself out because some people clearly advertise as, no vaccines needed or none of this needed, or the other direction. So there will always be options because there will be people that will decide to either follow this or not follow this. But if we do not give people the ability to set some rules as to what is allowed in their own home, there are places that simply cannot provide the care, which means we just make the child care situation even worse. Thank you.
Senator Gruenhagen.
Well, thank you, Mr. President. Yeah, I rise in support of the amendment. I do have several daycare providers as customers of mine, my insurance agency, and one lady in particular has done it for about 25, 30 years in her home. She shared with me that if there's a sickness or a problem, she just simply tells the parent that we can't take your child if they've got that condition, and she hasn't had any problem. Now, she has been pushed out of business, though, okay? And you know who pushed it out of business? The government, right? A few years ago when I was or a couple years ago when I was in the other body, we showed the regulation book on daycare providers like 10 years ago is relatively small. And then we showed the current one, which had basically tripled in size. And in talking to the daycare providers, especially the single moms or the moms that take care of children in their homes, they are so hassled by the government and inspections. And in fact, I don't know if you remember Senator Drazkowski, but you shared on the House floor a few years ago that the same infractions or worse by the large providers was basically left unpenalized, and yet they had a whole list of small providers that were heavily penalized. So the government has contributed to this shortage. They've driven people out of business. In fact, I got churches now that are in such a crisis in these small towns that they're opening daycares themselves. So, daycare providers can work with their customers. This is simply the camel's nose under the tent. Today it's, they can decide, the next day it's going to be mandated. That's the way government works, all right? It's optional today, it's mandated tomorrow. So, when I served a lot of time when I was in the House in HHS. And, one of the things to remember why there's some reservations and why we need to leave parents decide on this, and daycare providers can decide. If a child has a disease or infection, they can simply say they can't come that day. We don't need government. But when we were over in HHS, we had quite a discussion about this a number of times, and it's a very sensitive topic. I'm not really an anti-vax or pro-vax. I'm for parental decisions and control. But we had the interesting thing, in one HHS meeting with Tina Liebling was chair, we had 3 Somali moms testify, and their children had gotten vaccines at a young age, and all their 3 children had autism. And the interesting thing about the 3 Somali moms, They were now anti-vax, and they shared, and I remember specifically, that in Somalia, they do not even have a name for autism, okay? They don't have a word in their vocabulary for autism. Think about that. So, you know, I've sat with the Minnesota Department of Health in meetings. I've sat with experts on the other side. You know, I've tried to listen to both sides, and I've really come down, we need to allow parental authority and choice in this area. Daycare providers have plenty of authority to decide if a child shouldn't come in with the rest of the children. And the other thing we need to lower the regulations and quit driving small providers out of business. And then we have situations like Senator Coleman, she can't find providers. And that's government instigated. So, members, please support this amendment. Please allow parents and local providers to make that decision, which they've always made for decades. And again, to not support this is to put the camel's nose, the government, under the tent. Today it's optional, tomorrow will be mandated. Please, members, we read the Declaration of Independence and our Constitution, and that's what has made our country great, not more government mandates. Please vote yes on this amendment. Thank you.
Senator Lucero.
Thank you, Mr. President. I rise in favor of the A63 amendment. So in the last several years, the issue of medical freedom, informed consent, parental choice has been one of the top issues that I've received incredible numbers of communications, in-person meetings, phone calls, emails, rallies, and the events of COVID really brought this to a high visibility. Now, medical freedom and informed consent is something that I have been on the leading edge of fighting for well before COVID. But COVID brought the visibility there even stronger to many who may not have had to deal with this question before. The question is that we all have to answer: who is in the best position to decide the best interest for one's old children? And it is the parent or guardian. Clearly the parent or guardian. And what the A63 amendment does is seek to ensure that the parent or guardian is empowered with making that decision for their own children. I have a high concern that just as we have had the conversation on the Abler Amendment in regards to the closing of hospitals, I'm very concerned that the reduction or the potential reduction in child care options that may happen to a parent who makes a particular choice is going to increase that hardship. And what does it do? It's a de facto discrimination. It's discriminating against parents and guardians who are making the best choice for their family, for their children. We do not want to permit discrimination. We want to empower parents. Now, I understand that there are those who believe that businesses may do the right thing, and they should be empowered according to the beliefs of some. But as we witnessed in the era of COVID, it is a reality that pressure leads to decisions that are not necessarily based on the best interest. Pressure from political forces, from threats of fines or criminalization or shutting down or revoking of licenses can push businesses to make decisions that they wouldn't naturally do, that free market forces would not necessarily have those choices. And because we've witnessed that in just the last few years, I do not want to give this authority in statute to permit businesses to discriminate. Because if another event happens, government can utilize such a statute and coerce those businesses to make the decision to discriminate. We don't want to have that leverage in statute, which is the reason why we have the A63 before us. We don't want to have branches, executive agencies trying to use this and pressure the child care facilities to exercise that discrimination. We need to trust our parents. We need to trust guardians because they are in the best position. Members, Mr. President, members, vote green on the A63 amendment. Thank you.
Senator Liskey, this is your amendment. You're the last person before we vote. Senator Liskey.
Thank you, Mr. President. Mr. President, I heard a myriad of reasons why we need to vote red on my amendment. And I'd like to ground us back to why we should vote green. And the reason is, I heard about risk. I heard the word risk from Senator Wickland, and I agree, there's always risk. Unfortunately, in the healthcare industry, there's a lot of risk. But the problem is with the risk is that we also risk losing care and access to care for children that can't get the vaccines and that can't get medical exemptions for the vaccines. The reason we lose that or we gain risk of that is because there's this thing called liability that we all like to hear about. In fact, I don't like hearing about it. Liability is a scary thing. You take the risk, you are now responsible for that risk. With liability, we have this thing called insurance. We've talked a lot about insurance already tonight. This bill addresses a pretty significant amount of insurance. Liability insurance can get very expensive when we start to talk about an option to take on more risk. We're giving healthcare providers an option to either not take on risk or an option to take on risk, which means that those wonderful liability insurances are going to write different plans now because they no longer have to follow a state statute. They no longer have to calculate that into their liability insurance, and so they're going to offer the plan they currently have, and they're going to offer a plan that's twice or three times as expensive because now the healthcare or the daycare provider, the child care center, has to make a decision on whether they're going to accept that risk. And so it's actually cost prohibitive, and you're going to run into an option turning into a mandate without even having to change the state statute to a mandate, because cost prohibitive measures come into play. And so with that, I urge members to please vote green on this amendment, because if we give the option, it turns into a mandate. Thank you.
The secretary take the roll on the A63 Liskey amendment. Members, please vote. Senator Morrison, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Bolden votes no.
Senator Bolden votes no.
Senator Dietzig votes no.
Senator Dietzig votes no.
Senator Fateh votes no.
Senator Fateh votes no.
Senator Kunish votes no.
Senator Kunish votes no.
Senator Mann votes no.
Senator Mann votes no.
Senator Marty votes no.
Senator Marty votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Umu Verbatim votes no.
Senator Umu Verbatim votes no.
Senator Pa votes no.
Senator who?
Senator Pa votes no.
Senator Pa votes no.
Senator Port votes no.
Senator Port votes no.
And Senator Zhang votes no.
And Senator Young votes no. Senator Duckworth, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Anderson votes aye.
Senator Anderson votes aye.
Senator Dames votes aye.
Senator Dames votes aye.
Senator Draheim votes aye.
Senator Draheim votes aye.
Senator Housley votes aye.
Senator Housley votes aye.
Senator Miller votes aye.
Senator Miller votes aye.
Senator Weber votes aye.
Senator Weber votes aye.
Senator Wiesenberg votes aye.
Senator Wiesenberg votes aye.
And Senator Howe votes aye.
And Senator Howe votes aye. Any other votes? All senators having voted who desires a vote, the secretary will close the roll. There being 30 ayes and 33 noes, the A63 Liskey Amendment is not adopted. Senator Jaskowski.
Thank you, Mr. President. I have the A101 amendment.
Senator Jaskowski offers the A101 amendment. The secretary will report the A101 amendment.
Senator Drazkowski moves to amend Senate File Number 4699 as follows. Page 290 after line 28, insert. This is the A101 amendment.
Senator Jaskowski to your A101 amendment.
Thank you, Mr. President. Mr. President, I've been receiving calls over the last couple of weeks now, from family child care providers about some planning that is happening within the Minnesota Department of Human Services that's going to affect them. So I did some looking into what is happening and what is our government doing, Mr. President. And as a matter of fact, in 2021, the legislature passed a bill. It was written and signed into law to direct the Department of Human Services to come forward with a process that would develop new licensing proposals around child care for family daycare providers. And our family child care providers are up in arms over what they're seeing at this point, Mr. President. As a matter of fact, this session law that was passed in 2001 was intended to come forward with their initial reports this spring and then come forward even with additional proposals to the legislature next year. And I'm afraid what might happen here, Mr. President, is we may see yet again one or more bills where the executive branch is going to bring those and attempt to plop them down onto the desks of senators here in the Minnesota Senate saying, here this is, implement this into law. And I certainly hope that this body exercises, if it gets to that point, more scrutiny than some of the scrutiny that I have seen here over the last couple of years. But the regulations that they are bringing forward for family daycare providers are amazing. There's 97 pages that are being proposed here, Mr. President, and there's 97 pages of new law that they are seeing here. It's seemingly as if this department, Mr. President, is bringing the ideas, a cookie-cutter approach to bring these very regimented processes that would come from the government and corporate daycares, the large daycares, and apply them to our home daycares. And Mr. President, members, what our home daycares are telling me is we cannot handle this, we cannot afford it, this is going to put us out of business, and it goes back to and is in addition to the burdens that Senator Gruenhagen was talking about earlier, Mr. President. Members, over time what we have seen here in Minnesota is this government has placed more and more and more regulation on our family daycares. And in the meantime, what's happened is the government has come and given more and more and more money to our corporate and government daycares, and we are snuffing out our home daycares here in the state of Minnesota. Mr. President, this effort this may be the final blow if it continues on the trajectory that we are seeing. Again, it's 90-some pages. I am just reading, and I heard about, they're even trying to regulate
the type of surface that needs to exist underneath the playground equipment outside of the homes of these home daycares. But in addition to that and many other things, Mr. President, these initial proposals are putting forward the requirements for policies to exist. Our home daycares are going to be required under these proposals to write all kinds of like 28 or 30 different policies that they are intended to maintain the ages and numbers of the children in the family care program, the hours and days of operation, including plans for holiday closings, personal time, and policies for inclement weather closings, fees including payment schedule, overtime charges, and registration fees as applicable. Each of these are different policies, Mr. President. Allergy prevention and response policies, required enrollment information, meals and snacks to be served, a policy for that, and it's got to be in writing for the moms and dads to be able to have meals and snacks to be served. Policies regarding formula, breast milk, and providing supplemental foods, labeling requirements for food brought from the child's home, sleeping and resting arrangements, non-discrimination practices to comply with Section XYZ, policies for the care of children, isolation precautions, symptoms for discharge and return immunizations, and medical permission policies, Mr. President, disease notification procedures, policies for the administration and storage of medication and topical products, including sunscreen, including whether school-aged children are permitted to carry their own medication and topical products, emergency fire and storm plans and the monthly fire drill log, Mr. President, transportation policy for field trips, walking trips, if applicable, emergencies, transportation consent, permission requirements, behavior guidance and discipline. That's number 16, Mr. President. Situations that may require disenrollment of a child, if applicable, including termination and expulsion notice procedures, plans for use of a helper and plans for use of a substitute for emergencies, personal leave or holidays, the presence of pets in the program, including a 14-day notification prior to the introduction of a new pet to the program, a written policy about notifying a parent of a child whose skin is broken by an animal bite or scratch on the day the injury occurs. Mr. President, there's another 8 or 10 more, a couple more just for people's interest, a policy of the use of video surveillance systems in the program, including the location of the cameras and who has access to the video feed or recordings as applicable. And there's more. And then lastly, a policy about the presence of firearms at the residence in accordance with Section XYZ. These are just the policies, Mr. President, that these home daycare providers that are struggling to survive in this state that has brought so many oppressive regulations to them that they are struggling to survive. And we have this agency coming forward with this, again, 97 pages. I could read you more and more excerpts, Mr. President, but it's clear, members, Mr. President, it is abundantly clear that we have an agency that is taking these corporate and government daycare rigid regiments of proposals and policies in foisting them onto our home daycares to finally smother them out in our state. And that seems to be the direction that this government is going. It's the direction this legislature went in the past. And I am asking you, the members of this body, to vote for this amendment. This amendment will postpone until July 1st of 2027 action on these actions by the executive branch so that our home daycares in our state and our legislature and our executive branch can finally take a better look at the direction they're going and start to bring some practicability to the approach that is happening in this area of family daycares. And I'd encourage your support, members, and I'd ask for a roll call vote. Thank you, Mr.
Roll call
President.
requested, roll call granted. Senator Wickland to the A101 amendment.
Thank you, Mr. President. Members, I rise in opposition to Senator Drazkowski's amendment. I am glad that people are talking about and interested in the child care regulation modernization project. I was a member of the Family Child Care Task Force that was in place from 2019 through early 2021, I believe. And one of the key recommendations that came out of that task force was to put in place a project to modernize our family child care regulation. And to actually go back and review and modernize the standards that hadn't been updated since the 1980s. It is very much supported, this project is very much supported by family child care providers. It was expanded to also be a project that would perform a child care center regulation modernization as well. And the current status of the project is that they issued this draft set of standards a week ago or a week and a half ago. And it is just that. It is a draft that is out for review by providers, and they are actively seeking input. There will be an online form mechanism for submitting feedback, and they will be also soliciting it in other ways. The process is meant to be one where now the providers are providing input and reacting to the draft that was put forward. If there are aspects to it that are not workable and not practical, then that will come forward in the feedback, and they will work to incorporate that feedback into the next draft. I would object to putting an arbitrary date of a couple years out to implement this, because we, the legislature, are in control of passing the final standards that would go into law, and we need to take our responsibility for reviewing those and taking note of how the department is performing that project, as well as whether they are considering the feedback and input from family child care providers. I do not believe that that anybody in the agency is interested in seeing all family child care providers go out of business. That is not my experience at all, and I'm not supportive of that. We need a diverse, all different child care types in Minnesota, and we need to be attracting more people into child care, whether it's a family child care provider who wants to set up her own business, or if it's a child care center. We need more of all different types of child care. So I would oppose the amendment. I do not believe that this is necessary, because there is accountability for the department to work on implementing these new standards in a way that the legislature has oversight and ability to provide input. And I believe we do have a strong set of legislators who are very interested, both in both parties, who are very interested in seeing that these new standards are supported by child care providers.
Senator Curran.
Thank you, Mr. President. Would Senator Wickland rise for a question?
Senator Wickland will yield. She will yield for a question. Senator Curran.
Thank you, Mr. President. Senator Wickland, so what problems are the new regulations solving?
Senator Wickland.
Mr. President, Senator Curran, I believe that the child care providers felt that over time, the standards that were set 40 years ago are just not, they have situations that are not applicable to today. They don't take into account the different situations that providers find themselves in, and they need to be updated.
Senator Curran.
Mr. President, Senator Wickland, so I had the pleasure, my wife opened a daycare about 2 years ago. And what I could tell is that the regulations are fairly intense. She appeared to thrive in it fairly well because she'd already come from the healthcare industry, in which was highly regulated already, and to be able to sit down and do the paperwork and go through it on a daily basis, the requirements are pretty intense and pushes many people away. I have to say, it was one saving grace. We had an amazing county administrator or licenser, which was desperate to find any daycare provider willing to step into this industry. And I don't see what, and I get to go through it. I had to be fingerprinted and licensed, as my 13-year-old granddaughter did. And I get to see, starting last Thursday, I think, like many of our members did, many calls. The first were from my county licensors. They're extraordinarily upset because they don't think they're going to be able to attract anybody into it. They're struggling to keep those that they have today. So I'm trying to figure out, how does this, or who is this going to work for? Because that's what good bureaucrats do. When they're done making rules, they make more rules. Now remember way back when in 2017, after they were forced to take a vote, prior, that's 2014, but I remember coming in 2017 with over-enforcement of the existing policies that they had because they rejected the governor's unionization vote. So the over-enforcement led to, I think I remember sitting next to Senator Abler when they were attacking those homes, those in-home daycare centers for which most of our families want. They want close personal care and relationships. But I remember that we had thousands of daycare providers leave because of that over-enforcement of what those existing rules were. We haven't heard of many people dying, getting sick, children severely injured. I haven't heard any of those things. I haven't heard any of those things in my 8 years here. What this looks like is another round of over-enforcement, further impeding the ability for family daycares, which I think is the greatest demand that we have out there. You look at the complexities they've added and the costs that they've added to have an in-home daycare. None of it's going to make it more affordable. None of it's going to make it more accessible. None of it's going to create a more diverse pool of businesses. I did say, I think they at least the preliminary rules looked like it was 5 different types of in-home daycares. You've already moved so many other students, or what I've recognized is in the body or in a daycare, is that the cream of the crop, the 4- and 5-year-olds have already been being stripped off, which require a little bit less care and provide a little bit of the profit that makes it worthwhile to engage in this business. What this looks like is another punitive action towards in-home daycares after it was unsuccessful to get rid of all of them, after the last over-enforcement activity that was imposed on them. And this just looks like another round of it. It's so burdensome that it's going to be very difficult. If you read some of it, all play surfaces, but most of us in-home daycare providers have grass in our yard, watered, fertilized, soft, but not soft enough for the injuries that we haven't heard are occurring. So now somebody has to have a buffered surface. So you have to have wood chips, pea gravel, rubber, crushed rubber, 9 inches of it in case somebody falls. It's thousands and thousands and thousands of dollars added onto the cost of these businesses. And it will drive them out of business and will further hurt our employment status or our workforce, our employers, because they can't find daycare today. I think in my area, just between two cities, Stacy and North Branches, they've said there's a need for some 300 slots. None of this is going to benefit that problem. It just appears this is another one to really push it towards the goal of expanding early daycare or early child care in schools. We want more of the students there. If any more are peeled off of the in-home providers, they will not be able to survive. It's difficult today, and they do it out of love. I mean, my wife did it because she has a compassion gene like many in-home providers have or former healthcare providers have. I don't see one thing here except for an attack on those businesses, and not one thing that's going to suddenly make it easier for businesses. This is what government does. It will create more work, more regulatory burden. It'll make them feel better. It won't increase safety. It won't lower the cost. It won't provide greater accessibility. And so, members, I would encourage a yes vote on the Liskey Amendment, or I'm sorry, the Draz Amendment. Thank you.
Members, if I can just remind you not to keep going off. We're on a certain amendment that is before the body. If you could just remember that, that would be great. We have a couple of speakers still left for this amendment before we vote, which includes the author of the amendment. And then we have several amendments after this. So with that being said, I'm going to Senator Gruenhagen. And we're on the A101, Senator Gruenhagen.
Yeah, and I rise in support of the A101. You know, I just did a little bit of research, members, and Senator Drazkowski did a better job of talking about the regulations than I did, and they gave you more specifics. But it impressed even more when I did a little research myself on the internet. According to NPR, the latest article on May 2nd, 2024, just recently, there's an article that says 20 years ago in the state of Minnesota, we had 14,000 licensed family child care programs. So 20 years ago, we had 14,000 licensed family child care programs in the state of Minnesota. Today, members, we have, with all the government regulations and all the care, we're down to 8,852 family child care. So congratulations, government. You drove down over 5,000 daycare providers out of business, just like we've been saying. Now listen to the rest of this. It says, combined, these 8,852, they provide 222,348 licensed child care slots. But listen to this, members. Only 81,150 of those slots are currently participating. That leaves working families across Minnesota to face a deficit of 82,503 unmet quality child care slots. Congratulations, government. You did it again. You know, it reminds me of a saying from Nobel Prize winner Milton Friedman. If you put the federal government in charge of the Sahara Desert, in 5 years you'll have a shortage of sand. You want less. They're trying to social engineer these children into the public school to make up for the declining enrollment.
Senator Gruenhagen?
Yeah.
I thought I was very gentle with you and just reminded you that you should probably stay on message, because now we're into socially engineering children, and I don't believe that's what the Drazkowski Amendment is about. So let's try this again.
You have to allow me to tie it together, Mr. President.
No, I want you to wrap it up now, because I don't know if you can tie those two things together.
The point is this, members. Please vote yes on the Drazkowski Amendment. It is government over-regulation that is driving these daycare providers out, driving the cost up, creating shortages for families at the basic desperate time they need for this daycare. Please care about those families in your district rather than the government bureaucracy. Please vote green. Thank you, members.
Senator Nelson.
Thank you, Mr. President. I will be brief. I stand in support of the Drazkowski amendment. I just want to give you a couple reasons why. And these are things that are filling up my inbox from constituents. They're already looking at these proposed modernized rules, and they do seem to be very overly prescriptive. Providers cannot use aerosol sprays or air fresheners or essential oils or plug-in air fresheners. That's part of those modernization pieces. Right now, they have to document and check with the U.S. Customer Product Safety Commissions monthly for warning and recalls of play equipment, toys, jewelry used for play, imported vinyl mini blinds, bibs, lunch boxes, and other food products, container products. I can see why my daycare providers are concerned about this. And I'll just sum it up with this. The word must appears 603 times in this 97-page document, and the word require occurs 207 times. So these are real concerns that need to be addressed, and so I think the Drazkowski Amendment, which is just saying that they cannot be implemented before a certain date, is better than having it no earlier time allowed. And then the other piece I would be remiss if I did not mention is that there seems to be a concern that seems to be a conflict of interest concern. I'll just bring it up. The DHS, one of the DHS licensing director is a board member for NARA, which is the entity contracted with DHS to do this updating and modernization. Now, I do not know if that's a conflict of interest because I don't know enough about that, but I want you to know that my constituents are concerned about that, which means I think it's important to at least put that out there. So I do encourage a yes vote on the Drazkowski amendment.
Senator Barr.
Thank you, Mr. President. I want to encourage a green vote on the Drazkowski amendment. I too have received numerous emails. One of them I got, she has a 2-acre property. In these new proposed rules, she would have to put a fence around the entire 2 acres of property. It says $15,000. I can't recoup that on the 9 kids I've got here. And then she has actually talked to all of her parents. They would stop working. One of the 2 parents would stay home. So now how much tax revenue has the state lost because you have a lower income in your household? So what the actual problem here is, we as the legislature has offloaded our authority to the executive branch to write these rules. All these proposed rules should always come back through the legislature so that the people's representatives can actually weigh in and say, this is a good rule, this is a bad rule, this one needs to be changed, this is overburdensome, this is too expensive. That's our responsibility as legislators that we have offloaded to the executive branch. So that's the first problem with this. The other one is, now after we offloaded to the executive branch, they have decided how everybody in the state that uses daycare, or in this particular case it's daycare, should have their daycares run. One size fits all, government knows best. So for those 2 reasons right there, I urge people to vote for the Drazkowski Amendment so we can at least try and get a handle on the rules, proposed rules, dial them back into something that makes sense before we run all of our home daycares out of business. Thank you, Mr. President.
Senator Lucero, we're on the A101.
Thank you, Mr. President. Mr. President, crack. Crack, Mr. President, something you told me. Conclusion, argument, or reason, argument, conclusion, I believe is what it was.
It's crack. Conclusion, reason, analysis, conclusion.
Thank you, Mr. President, for the correction. Conclusion. I support the A101 amendment. Reason. To assist me, well, the reason is because of the burdensome regulations that continue to be placed on our home child care providers, which is what the A101 amendment is seeking to address. The analysis. To assist me with analysis, I need Senator Gruenhagen to yield if he's willing to yield.
You're going down a dangerous road, Senator Lucero. He will yield. Senator Lucero.
Thank you, Mr. President. Senator Gruenhagen, I heard you reference an NPR article. And I believe that you referenced 5,000 closures over 20 years. So to help me with my analysis, I'm just seeking to confirm that I heard that correctly.
Did you hear that correctly, Senator Gruenhagen? You want to get in the mic? There you go. Okay, Senator Lucero.
Thank you, Mr. President. I'm sorry, he did not hear me. So the question, Mr. President and Senator Gruenhagen, is, when you were speaking, I think I heard you say in a May 2nd NPR article that 5,000 providers have closed over the previous 20 years. I just want to confirm that that data is accurate.
Yes, Senator Lucero, that is correct on the research I just did here. So,
Senator Lucero.
Thank you, Mr. President. So what I did is, and again, I'm under the A of crack, I took 5,000 divided by 20, and that came to 250. So in my analysis, 250 child care providers on average closed each year over the last 20 years. That is substantially similar to something that I recall Representative Mary Franzen telling me this would have been probably 5-ish years ago when I was in the other body. I believe that Representative Franzen herself was once a child care provider. And we were in a committee hearing because this was even 5, 6, 7 years ago, I forget exactly which year it was a very serious issue. So in the midst of these 250 closures per year, Representative Franzen then told me that on average, one child care provider is closing per day. So if I take that 250 average per year and I divide that by 365, that's 0.68. So I suspect that over the last 20 years, there was probably not an exact constant, that's an average, that there was that moment in time when it was one per day. One per day has resulted now over the course of 20 years, 5,000 according to NPR. So that analysis clearly is strongly influenced by government with its regulations. And those regulations are seeking to be addressed by the Drazkowski A101 amendment. And so if child care providers are closing because of the burdens, and I just heard Senator Nelson recite some of the things, these are just people, moms and dads who have excess capacity and a deep care. They don't have the bandwidth, they don't have the capacity to live up to these burdensome government regulations, and the reason they're closing. This is the analysis. Because they're closing, it's creating that further hardship. And then, Mr. President, I heard Senator Cran say something, I think he connected a few dots, if I heard him correctly. And I believe he was suggesting that this might be part of an effort in retribution to the failed effort to unionize child care providers. And this is the next best thing in that effort to close child care providers down, to migrate them then, that parents have no other choice but to put them into schools, government schools, because of lack of choice. So the analysis then leads to the C, the final C in crack. The conclusion, which is what I opened with. We need to support the A101 amendment because a clear analysis demonstrates that child care providers are closing as a direct result of burdensome overregulation. The Drazkowski Amendment is seeking to curtail that. For that, Mr. President, vote green. Thank you.
The last voice you will hear will be that of Senator Drazkowski before we vote on the A101. Senator Drazkowski.
Thank you, Mr. President. Thank you, members. You know, this discussion harkens back to what I remember several years ago when I was in the Minnesota House, and home daycares were under assault by the regulations of government then. It was very pronounced. And I remember the one example that was held up above all others, and that was prickly grass, Mr. President. Prickly grass. The grass outside was too prickly, and the daycare provider was getting written up because they were afraid that Junior was going to run into problems with the prickly grass. Well, members, that is indicative of what we're seeing and hearing about government. Government believes they're going to come in and save everything. They believe they have the answers. As a matter of fact, Mr. President, Senator Wickland, and members, that process that this government went through, and they suggest that they involved daycare providers in this, I can't see that. I can't see that they were the predominant driving force in what resulted here. As a matter of fact, I am looking even further, Mr. President, in the 97-page document. Activities, Senator Nelson, one of the musts that you have in here, and you talked about how prescriptive it is extremely prescriptive. Activities, so they are prescribing activities in here for the home daycare. Activities must be scheduled indoors and outdoors, weather permitting daily. When determining if weather permits outdoor play, defer to weather advisory notifications. The government is telling the home daycare to check the weather before they let the kids outside. If this isn't prescriptive, Mr. President, I don't know what is. Including air quality emergencies provided by local weather experts or a local or state authority on air quality or public health. Does that sound to any member in here anything like your daycare provider would put into a document like this? I'm going to read it again. Provided by a local weather expert or a local or state authority on air quality or public health. There is not a home daycare provider in Minnesota that would write that. Not one. Outdoor activities must be scheduled as follows. For any infant over 12 months of age, toddler, preschool, or school-age child in attendance, indoor gross motor play such as climbing, jumping, running, riding, wheel toys, yoga, other physical fitness, or music and movement on days when outdoor play is not provided. Be appropriate to the right developmental stage. Include active and quiet activity, and include both license holder directed and child initiated activity. Mr. President, it is extremely prescriptive. As a matter of fact, for the infants, it talks about make sure you have blocks and dramatic play equipment, including but not limited to blocks of various sizes, soft dolls to grasp and squeeze, soft washable animals, play telephone, got to have the play telephone, non-breakable mirror located at eye level for crawling infants, various pots and pans. Of course, they're all going to cook someday, Mr. President. Play materials that represent a diversity of cultural and ethnic groups. Books and literacy materials, including but not limited to board, cloth, or plastic books. Simple storybooks with one picture per page. Play materials that represent a diversity of cultural, ethnic groups. Of course, there was one that said, Mr. President, I didn't get there yet, and I'm not going to read them all. But one said you could have books, but you couldn't have ones with torn pages or covers on. By gosh, don't include the books that have torn pages or covers on. Mr. President, members, it is time to wipe this slate clean. We need to send a firm message back to this prescriptive, big government that is coming in here and robbing our daycares of their future. That's what they're going to do with the direction they're on. Support the A101 amendment. Vote yes. Let's tell the government to go back to the drawing board, leave the Department of Human Services home, and let's bring forward Minnesota's home daycare providers to write their list of things that are practical, absolutely necessary, and I bet you it'll be much less, Mr. President, than 97 pages. We might get 4 or 5 pages and be done and actually have daycares that can go forward and function in the future. And then maybe, Senator Curran, maybe your county office will actually be seeing new home daycares start to arise again here in the state of Minnesota instead of evaporating at the rate of 250 daycares per year. Thank you, Mr. President.
The Secretary will take the roll on the A101 Drazkowski Amendment. Members, please vote. Senator Morrison, for those voting pursuant to Rule 40.7.
Whew, thank you, Mr. President. Senator Bolden votes no.
Say it one more time, I'm sorry.
Senator Bolden votes no.
Senator Bolden votes no.
Senator Dietzick votes no.
Senator Dietzick votes no.
Senator Fateh votes no.
Senator Fateh votes no.
Senator Kunish votes no.
Senator Kunish votes no.
Senator Mann votes no.
Senator Mann votes no.
Senator Marty votes no.
Senator Marty votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Umer Verbatim votes no.
Senator Umu Verbatim votes no.
Senator Pa votes no.
Senator Pa votes no.
Senator Port votes no.
Senator Port votes no.
And Senator Zhang votes no.
And Senator Zhang votes no. Senator Duckworth, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Anderson votes aye.
Senator Anderson votes aye.
Senator Dames votes aye.
Senator Dames votes aye.
Senator Draheim votes aye.
Senator Draheim votes aye.
Senator Housley votes aye.
Senator Housley votes aye.
Senator Miller votes aye.
Senator Miller votes aye.
Senator Weber votes aye.
Senator Weber votes aye.
Senator Wiesenberg votes aye.
Senator Wiesenberg votes aye.
And Senator Howe votes aye.
And Senator Howe votes aye. All members having voted who desires to vote, the Secretary will close the roll. There being 31 ayes and 34 noes, the A101 Drazkowski Amendment fails. Senator Nelson.
Thank you, Mr. President. I have the A76 amendment.
Senator Nelson offers the A76 amendment. The Secretary will report the A76 amendment.
Senator Nelson moves to amend Senate File Number 4699 as follows. Page 95, after line 7, insert. This is the A76 amendment.
Senator Nelson, to your A76 amendment.
Yes, thank you, Mr. President. The A76 amendment would require that abortion facilities be licensed and inspected by the state. It's probably more crucial now than ever before. The goal of this legislation is to protect Minnesota women by requiring appropriate licensing and inspection of abortion facilities in Minnesota. You might recall similar amendments or provisions in the past. This one is improved that I think will make it more of a bipartisan issue. This particular amendment requires that instead of asking those abortion facilities to be licensed like surgical centers are. This bill actually, or this provision, actually requests that abortion facilities are to be licensed in accredited or accepted by their own industry. So it would be the abortion industry regulating itself. This language, as I said, reflects the hard work of bipartisanship in the last year. Planned Parenthood has created its own set of clinical guidelines, and it requires that their affiliates follow them in order to be accredited affiliates. Similarly, there's the National Abortion Federation, NAF, has created its own clinical standards, and it accepts as providers members whose facilities abide by those guidelines. Both Planned Parenthood and NAF require on-site inspections prior to accreditation and membership. Such accreditation or membership would be required for abortion facilities to be licensed in Minnesota.
Senator Nelson, it looks like Senator Klein is standing. For what purpose do you rise?
Oh, Mr. President, I'm not an interrupting type of guy, but I will raise a point of order if this is the correct time.
State your point of order.
Under 35.2, Mr. President, the amendment in front of us deals with Chapter 145. Interestingly, we had an objection on our previous amendment, which was then withdrawn, dealing with this same chapter of law. 145 is not addressed in the bill in front of us, and this is outside the scope. This deals with the abortion law, not the HHS omnibus bill that's in front of us.
Advice on the point of order. Advice. Senator Liskey.
Mr. President, I advise that you find this point of order not well taken, as there is discussion about abortion coverage in this bill, and so there's definitely a discussion about abortion. May not directly reference this statute, but it definitely is referencing abortion, and so I believe that this motion is not well taken.
Senator Liskey, do you know where that section is?
Not off the top of my head. I just know it's.
Senator Rasmussen, advice.
Thank you, Mr. President. Advice. On this, I would actually agree with Senator Klein. While I'm supportive of the amendment, if you look at the chapter, Chapter 145 is not in the bill before the body, and so to be consistent with the earlier point of order I made, I just wanted to point that out.
Any other advice? Senator Nelson.
Well, thank you, Mr. President. I believe that the point of order is not well taken. Let me tell you where Chapter 145 is included in the bill before us. In fact, it's included 36 times. And that would be on pages, let's see if I can find the pages for you here. I can't find the page numbers. You can look in the bill, do a bill. I'll ask each member to do that. You can do a Control F. You can review the entire bill online, and you can search for 145. And specifically, the TANF, we've got the Minnesota Statute 145 is included in the bill. That is, let's see where it is here. Let me get it bigger. That is 145 federally qualified health centers. We also have 145 listed. How many times do you want me to tell you about how 145 is in this bill?
Senator Nelson, you don't have to do it anymore. I don't need any more advice. The point of order is well taken.
I appeal the rule of the chair.
All right. So the
and there will be a roll call, Mr. Chair.
I'm sorry, what'd you say?
And a roll call, please.
Roll call requested, roll call granted. The ruling of the president has been appealed. A green vote symbolizes that you want to uphold the decision of the president. A red vote goes against the decision of the president. The secretary will take the roll. Members, please vote. Senator French, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. I report Senator Bolden votes aye.
Bolden votes aye.
Senator Dietzick votes aye.
Dietzick votes aye.
Senator Fateh votes aye.
Senator Fateh votes aye.
Senator Kunish votes aye.
Senator Kunish votes aye.
Senator Mann votes aye.
Senator Mann votes aye.
Senator Marty votes aye.
Senator Marty votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
Senator Umu Verbatim votes aye.
Senator Umu Verbatim votes aye.
Senator Pa votes aye.
Senator Pa votes aye.
Senator Port votes aye.
Senator Port votes aye.
Senator Zhang votes aye.
Senator Zhang votes aye.
And Senator, no, that's it, Mr. President. Thank you.
Senator Duckworth, those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Anderson votes no.
Senator Anderson votes no.
Senator Dames votes no.
Senator Dames votes no.
Senator Draheim votes no.
Senator Draheim votes no.
Senator Housley votes no.
Senator Housley votes no.
Senator Miller votes no.
Senator Miller votes no.
Senator Weber votes no.
Senator Weber votes no.
Senator Wiesenberg votes no.
Senator Wiesenberg votes no.
And Senator Howe votes no.
And Senator Howe votes no. All those having voted who desires to vote, the secretary will close the roll. There being 34 ayes and 30 noes, the decision of the president is upheld. Senator Grudenhagen.
Oh, thank you, Mr. President. I'd like to introduce the A73 amendment.
The A73 amendment is offered by Senator Grudenhagen, and the secretary will report the A73.
Senator Grudenhagen moves to amend Senate File 4699 as follows. Page 54 deletes Section 6. Page 57. This is Amendment A73.
Senator Grudenhagen, to your A73 amendment.
Oh, thank you, Mr. President. Members, what this amendment does, it deletes the mandate of abortion-provided services and insurance in the bill. It completely deletes it. And I know it's been a contentious issue here at the Capitol and actually across our state and nation. But I'd like to share a little statistic with you. And this is just a recent survey that was taken of Minnesota citizens. The first one was by the Star Tribune, the NPR News, and KARE 11. The second poll was by KSTP, Survey USA poll. And they both found the same information, that when it came to enacting abortion up to birth, only 30% of Minnesotans support the current no limits policy, according to these two polls. So 30% of Minnesotans support abortion up till birth. That means 70% support some type of restrictions on abortion, especially in the second and third trimester. Secondly, members, when we look at these statistics and we look at the mandate in this bill, and by the way, Senator Wiklund, I do appreciate that you put in a religious exemption in there for religious institutions. I do appreciate that. However, there's a lot of religious people in the private sector or even in government that would have a concern about this. So members, what we're doing in this bill is we're mandating an extreme policy, one that China and North Korea agree with, and then we're mandating that citizens are going to have to pay higher premiums in order to implement something that they don't to support that they don't agree with. And members, I just think that's wrong. I have an amendment coming up later that makes it optional. If you want that benefit, you add it to your health insurance plan. But if you don't, you don't. That makes more sense. But to do that amendment, we first have to remove this mandate that's in the policy. And Mr. President, I'd like a roll call.
Roll call requested, roll call granted. Senator Wickland to the A73 amendment.
Thank you, Mr. President. I rise in opposition to Senator Gruenhagen's amendment. The abortion services coverage, I believe, is a necessary addition. This mandate is a necessary addition. We believe in reproductive freedom in Minnesota and access to quality, affordable health care. And people should be able to use the health insurance they're paying for, and having access to the full range of reproductive health options is important. It's not, the fact that it is not already covered is part of the problem for people in Minnesota. They don't have full access to all of the healthcare options, and I believe that it should be included in the bill, and I oppose the amendment.
Any other discussions on the A73? Senator Lucero.
Thank you, Mr. President. I'm looking, this is a page and line deletion, and I can't go, I have not had the opportunity yet. I was hoping some others would rise so I could go through this to see all of the different references that it's deleting from the bill. But I did have the opportunity here at least to get to the first one. So it's page 54, delete section 6. So look at section 6. I see beginning on line 54.27. The current language in statute reads, elective induced abortion, except as medically necessary to prevent the death of a mother, whether performed in a hospital, other abortion facility, or office of a physician, shall not be mandatory for any health maintenance organization. So that language there, that exception to not include elective abortions is in current statute. The bill is deleting that and therefore making it mandatory coverage. We need to support the Gruenhagen A73 amendment because current language says induced abortion except as medically necessary. Current language allows for medically necessary. Deleting this language just blows it wide open. That any person can get an abortion as a means, essentially, of birth control. And health insurance and my premiums that I pay and the premiums of Minnesotans across the state that they pay should not in any way go towards the murder of children. As an elective, optional choice that isn't medically necessary. The fact that we're even having this conversation shocks the conscience. Last year was terrible for those who have a conscience to support preborn precious lives in the womb. This body has a 34 to 33. It is not a mandate to have such an extreme measure thrust upon Minnesotans with their health insurance premiums. I have the privilege of representing a very Catholic community. Not just Catholics, Mr. President, many God-fearing believers of many different denominations and faiths. And when I have the conversations with people across my community, when I have conversations with people of other faiths that have a similar conscience of the precious life of preborn human beings in the womb, this is something that we cannot permit. It needs to be the policy of the state of Minnesota to not cavalierly disregard the lives of the most innocent, the lives of those without a voice. Optional elective abortions is not health care. It is not health care. It is the termination of the life of a human being. It was already passed into law, extreme measures. And if one chooses to terminate the life of a human being, they need to do so with some other funds, some other financing that is not part of contributions of health insurance premiums paid for by myself and those who strongly believe in protecting life. I wish I could go through here, and I just don't have the time, or I did not have the time. Perhaps some others can speak, or they could go and look at the other deletions here. But it's very clear, just in this very first one that I looked at, page 54. Current law should stand. And a person who requires a medically necessary abortion to prevent the death of a mother, that is already permitted. And I heard the greatest explanation in a conversation several years ago. I think it was, if I remember correctly, a Jewish commentator who was speaking from a Jewish perspective on life in the womb in regards to when and if there should be exceptions. And one of those exceptions is when the pregnancy, the life in the womb, poses a threat to the mother. That it's considered just like any other threat to the life of a woman. That's a reasonable answer, in my opinion. And it was persuasive to me. And that is currently allowed for in statute on line 54.27. We should maintain that. And Mr. President, I weep for the continued dark path that Minnesota is being thrust down. It is a dark day. The blood that's being spilled, the lives that are being terminated, the innocence that is discarded will be accounted for because we have a loving God who cares about precious life in the womb. And to cavalierly disregard life in the womb by calling it something else, by rationalizing, will not go on unanswered forever. Mr. President, vote in favor of the A73 amendment for all morality and all that is right.
Senator Friends.
Well, thank you, Mr. President, and thank you, members. Thank you, Senator Lucero. I've never been pregnant, but I can see this. The voters of Minnesota don't agree with you, nor is that the trend in this state or this nation. I'll be voting no on the Gruenhagen amendment. Thank you, Mr. President.
Any other discussions on the A73? Before we go to the author of the amendment, who would be the last person that we hear? Senator Gruenhagen.
Well, thank you, Mr. President. Yeah, just a couple additional comments. I'm sure Planned Parenthood likes the current bill without this amendment, okay? And again, if you vote against this amendment, you're supporting Planned Parenthood, the largest abortion provider in this state and across the United States. And we know, as in the past, they prey on the poor, and they were founded and continue to be a white supremacist and racist organization. So when you vote against this amendment, that if you do that, you're supporting that organization. Second thing, members, we are on a slippery slope to forcing doctors legally to perform abortion against their conscience and conviction. This is just the tip of the iceberg. The next thing is to mandate and have criminal penalties, or doctors will lose their license if they don't perform late-term abortions. The last thing I'll say, especially to the ladies in the room, pornography and abortion sends a message to a certain percentage of men to sexually exploit, objectify, degrade, and use women. So ladies, when you vote against this amendment, you're voting for your own exploitation. Please vote for this amendment. Green. Thank you, Mr. President and members.
The Secretary would take the roll on the A73 Gruenhagen amendment. Members, please vote. Senator French, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Bolden votes no.
Senator Bolden votes no.
Senator Dietzick votes no.
Senator Dietzick votes no.
Senator Fateh votes no.
Senator Fateh votes no.
Senator Kunish votes no.
Senator Kunish votes no.
Senator Mann votes no.
Senator Mann votes no.
Senator Marty votes no.
Senator Marty votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Umu Verbaeten votes no.
Senator Umu Verbaeten votes no.
Senator Pa votes no.
Senator Pa votes no.
Senator Port votes no.
Senator Port votes no.
And Senator Zhang votes no.
And Senator Zhang votes no. Senator Duckworth, those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Anderson votes aye.
Senator Anderson votes aye.
Senator Dames votes aye.
Senator Dames votes aye.
Senator Draheim votes aye.
Senator Draheim votes aye.
Senator Housley votes aye.
Senator Housley votes aye.
Senator Miller votes aye.
Senator Miller votes aye.
Senator Weber votes aye.
Senator Weber votes aye.
Senator Wiesenberg votes aye.
Senator Wiesenberg votes aye.
And Senator Howe votes aye.
And Senator Howe votes aye. All senators having voted who desires to vote, the Secretary will close the roll. There have been 30 ayes and 34 noes. The A73 Gruenhagen Amendment is not adopted. Senator Matthews.
Thank you, Mr. President. I have the A74 amendment.
Senator Matthews offers the A74 amendment, and the Secretary will report the A74 amendment.
Senator Matthews moves to amend Senate File 4699 as follows. Page 63, delete Section 22. This is Amendment A74.
Senator Matthews, to your amendment.
Thank you, Mr. President. This amendment will delete a couple sections from the bill that is very divisive and questionable. We'll remove the sections that mandates coverage disaffirming the gender that God created these precious individual at their birth. And as this is a very divisive issue in Minnesota and around the country right now with very ethically questionable treatment. In fact, other enlightened countries around the world are already starting to backtrack and realize the error of their ways in this regard. And in no circumstance should we be literally requiring this treatment as another mandate for all insurance plans and requiring all Minnesotans to end up paying for this with their insurance plans. Aside from the moral position on this, this is also just one more mandate that we are putting as burdens on all Minnesotans in order to pay and receive their care. And this goes the wrong way. This will be a very temporary measure in the state. Because it will only be a matter of time before we collectively see just how wrong this period of history has been. But I ask members to take that step now, join those that are realizing that we do not need to go this direction, that there are multiple other ways to help our people, our young people, our youth. And I ask you to support this amendment. And Mr. President, I request a roll call.
Roll call requested, roll call granted. Senator Wickland to the A74 amendment.
Thank you, Mr. President. I urge members to vote no on this amendment. I believe that this provision in the bill should stay in the bill. Everyone should have access to the care they need to get the access just so that they can access what they need when they need it. And it's fully appropriate that it's in the bill, and please vote no.
Senator Dibble.
Thank you, Mr. President. Mr. President, I would encourage a no vote on the Matthews amendment. Simply put, the bill, Senator Wickland's bill, actually simply aligns our statutes with what is current practice as required by our Human Rights Act, as required by the Affordable Care Act, and a number of other regulations and requirements. But more importantly, Mr. President, gender-affirming care and denying access to it can have dramatically negative consequences in people's lives. And it would lead to much, much higher rates of depression, suicide, substance abuse. Those who receive gender-affirming care are simply stepping into and affirming who and what they are. Mr. President, what was so disturbing about Senator Matthews' introduction of this amendment was he would simply deny human beings and who they are and who they are living as authentic human beings. And so, Mr. President, I want you to listen carefully to the argument for this amendment. It would seek to simply erase an entire community of people, citizens of Minnesota, which I think is disgraceful. It's disgraceful to try to enact as a public policy. So, Mr. President, I think Senator Matthews' amendment is not well advised, and Mr. President, I think we should vote no.
Senator Gruenhagen.
Oh, thank you, Mr. President. Yeah, I like Senator Dibble, but I'm just going to have to disagree with him on this issue, okay? I rise in support of Senator Matthews' amendment. You know, a couple things, members. There's been, according to my research, there's 23 states in our country that have banned puberty blockers, cross-sex hormones, and mutilating surgery on minors. Now, why would they do that? Because what they're finding out, and as Senator Matthews said, Europe is going completely away from this, doing these surgeries on minors with cross-sex hormones and puberty blockers and mutilating surgery, is that There are severe medical consequences, including sterilization to young people before they understand the consequences of what they're doing. We can tell that in a number of ways. Number one, both at the U.S. Congress and even here, there's known as detransitioners. These are people who during their puberty years had the gender-affirming care, the mutilating surgery, and they now realize that was a mistake. Some of them are filing lawsuits against the medical facilities that did this to them, to the minors. So, members, there's just a recent study too. It was published the study was done between November 14th, 2023 and March 21st, 2024. The results were just published on April 2nd, 2024. It was done by a number of leading medical institutions, most of them in Texas, but there were 56 United States healthcare organizations that participated in this study on gender-affirming care on minors. You know what they found, members? They said that individuals who underwent gender-affirming care as a minor had a 12.12 higher suicide attempt risk than those who did not. And the statistics show, and why we should vote for this amendment, the majority, if not all of these children, grow out of gender dysphoria. And instead, it's anti-biology and anti-medical science, according to this study, with severe consequences. The study concludes with gender-affirming surgery is significantly associated with elevated suicide attempt risk, underlying the necessity for comprehensive post-procedure psychiatric report. So, members, the world is moving towards medical science and biology and away from gender dysphoria and confusion. And it's time we tell the public the truth and vote for the Matthews Amendment, and also allow the minors who've had this mutilating surgery, cross-sex hormones and puberty blockers to sue the medical institutions that have done this to them. Please vote green. Thank you, members.
Senator McQuaid.
Thank you, Mr. President, and members, I'm going to ask you to vote no, and there's actually a really easy reason as to why. With the hysteria about the existence of trans people that has taken over this country, even though trans people have always existed, everybody has a gender identity, Mr. President. I have a gender identity. My neighbor next to me here has a gender identity. I could access gender-affirming care. I'm approaching 40. I imagine I will be going through perimenopause soon. Hormone replacement therapy to make me feel better and not have the effects of night sweats and brain fog. Totally appropriate and gender-affirming care. So we can all pretend like we don't all have trans friends and loved ones and neighbors, and that they're not worthy of health care, but they are. And so we should vote against this, but also because this is not just about transgender people. It's about all Minnesotans who have gender identities and might need to access care. That includes every single person in this chamber. Vote no.
Members, before I go to Senator Matthews, who's going to be last voice we hear, I see Senator Lucero. Is there anyone else so that I don't miss anyone? It would be Senator Lucero and then Senator Matthews, in that order. Senator Lucero.
Thank you, Mr. President. I rise to support the A74 amendment. I agree that there are people that are suffering with gender confusion. There are people that are questioning their gender identity. It is the absolute proper response to have grace, compassion, patience, but also truth. Truth in love. must be the response. And those that are suffering with confusion do not need and should not be subjected to treatments, chemicals, physical alterations that lead to harm, that in some cases might be irreversible, chemicals that interfere with natural bodily processes, developments, that have chemicals that result in detrimental consequences or could lead to other ailments. This is not the response, and certainly not something that we should include as medically necessary care. What is necessary, Mr. President, as I mentioned, truth in love. That is necessary. Compassion. But not allowing people, especially when those people might be young people. I recall from the conversations where reproductive health services or other related care is now allowed to have minors, young people, make decisions for themselves that they have no capacity to understand the consequences. And to further that with what's in the bill here is so beyond anything reasonable. It is not compassionate to subject a young person to this. To a young person, let's say 8 years old, 10 years old, who might be, again, very, very realistically suffering with confusion. But that young person doesn't understand by going to having medical chemicals put into their body that can be incredibly harmful. They do not have the capacity to understand 14-year-old, the consequences long-term of what they're doing. That's the reason why the A74 has been introduced and offered. I think of another passage here that comes to mind. It's from the psalmist, praising the Creator. Praising the Creator, I am fearfully and wonderfully made. Fearfully and wonderfully made. And when I look at the bill, physical services, that's what just makes me cringe. Physical alterations for somebody who might be in a temporary state of confusion, psychological confusion, to have permanent physical mutilations that might be irreversible. That's why we need to have this amendment to remove this. Mr. President, the language in the bill is what I'm addressing. And why this amendment to A74 is going to delete this language. And when I see the definition here of medically necessary care that the amendment seeks to delete, medically necessary is a term that can lead to personal disaster irreversible consequences. And for the arguments that I made before in terms of coverage, there are those with sincerely held beliefs that do not want their premiums paying for this, because the compassionate response is to help people that are suffering with this, to lead them to the truth. Lead them to the truth. Not mutilating. I've heard the stories of those that have gone through such treatments and regretted it. And that's why we need to delete this. We do not want to have that regret. We do not want to subject people to that regret. The A74 helps to move us in that direction to prevent regret, to prevent the irreversible damage. So, Mr. President, a roll call already having been called, I encourage a green vote on the A74 amendment. Thank you.
Matthews, you're the last voice we'll hear before we vote. Senator Matthews.
Thank you, Mr. President. Again, I encourage a yes vote on this amendment. And I need to respond to some of the things I've heard my colleagues say. Mr. President, it is unfortunate, and it even irks me, that the same tired arguments get trotted out anytime that we discuss this issue, where we get falsely accused of seeking to erase. Mr. President, absolutely nothing could be further from the truth. Mr. President and members, anytime you say that, it is simply a lie that is trying to conjure up anger and hatred towards those that have some sincere disagreements in this issue. Even if I may disagree with a person, there is no universe in which this accusation of erasure is even remotely true. Never has been true, is not true today, will never be true in the future. But yet that is the same argument that gets trotted out instead of discussing the merits of what is being known as this ethically questionable medical treatments. So members, I urge you to support this amendment and help us get on the path with the other countries around the world that are recognizing that we have better ways to help people in need. Thank you, Mr. President.
The Secretary will take the roll on the A74 Matthews Amendment. Senator Duckworth, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Anderson votes aye.
Senator Anderson votes aye.
Senator Dames votes aye.
Senator Dames votes aye.
Senator Draheim votes aye.
Senator Draheim votes aye.
Senator Housley votes aye.
Senator Housley votes aye.
Senator Miller votes aye.
Senator Miller votes aye.
Senator Weber votes aye.
Senator Weber votes aye.
Senator Wiesenberg votes aye.
Senator Wiesenberg votes aye.
Senator Howe votes aye.
Senator Howell votes aye. Senator French, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Bolden votes no.
Senator Bolden votes no.
Senator Dietzick votes no.
Senator Dietzick votes no.
Senator Fateh votes no.
Senator Fateh votes no.
Senator Kunish votes no.
Senator Kunish votes no.
Senator Mann votes no.
Senator Mann votes no.
Senator Marty votes no.
Senator Marty votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Umu Verbatim votes no.
Senator Umu Verbatim votes no.
Senator Pa votes no.
Senator Pa votes no.
Senator Port votes no.
Senator Port votes no.
And Senator Zhang votes no.
And Senator Zhang votes no. All senators having voted who desires to vote, the secretary will close the roll. There being 30 ayes and 33 noes, the A74 Matthews Amendment is not adopted. Senator Abler.
Thank you, Mr. President. And I have a novel approach to this that hopefully will be interesting. Even at 3 in the morning, I'd like to move the, I can't even read. I'd like to move the A83 amendment, please, Mr. President.
Senator Abler offers the A83. The secretary will report the A83.
Senator Abler moves to amend Senate File Number 4699 as follows. Page 62, line 13, after including insert. This is the A83 amendment.
Senator Abler to your A83 amendment.
Thank you, Mr. President and members. I've been here for a while. I've been a part of these same debates for a long time. And a lot of opinions don't seem to shift. But I think that it's time to look at these topics as best we can to try to find a way to find something of a, if not middle ground, something that serves people better. What this amendment does, it gives some provisos about serving some people who might be left out in both the transgender treatments as well as the abortion side. And Mr. President, just to get one discussion going, I'd like to divide the amendment between lines 1.8 and 1.9.
The secretary will report the division.
Senator Abler requests a division of the A83 amendment. Part 1 is composed of lines 1.2 to 1.8, and Part 2, lines 1.9 to 1.25.
Senator Abler, and which portion would you like to do first?
The second, if I may, Mr. President.
And that would be line 1.9 through line 1.25, is that correct?
Correct.
Any other discussions on the portion of the bill that we're going to take up first, Senator Abler, before I go to Senator Wickland?
Yeah, I can describe it. How would that be?
That'd be great.
It's been a long day. So here's the thing. This amendment does not do any damage to the bill in any way to deprive anybody of the benefits, how they may be, on the transgender coverage that's covered in the bill. In fact, it expands it to take care of a group that's actually left out. It also provides for some follow-up care. And Mr. President, there is a group of people who have gone through the procedures, and at the end of all that, it didn't work out quite the way they want, and they wanted to undo it. And so if insurance is going to cover for the one part of the procedure, it should certainly cover for the other to detransition individuals. In addition, as I've done some research, there's not a lot of follow-up on this. And so I suggest in this amendment that there would be follow-up prior to a year in the 5-year range, and then in the 10-year range. And this is about what insurance would cover. And so then this would provide the necessary dialogue and findings so people can actually not discuss their opinions, but actually have some true facts. So I have some thoughts beyond that, depending on where the discussion goes, but that's pretty much the heart of the amendment, Mr. President. Thank you.
Senator Klein.
Thank you, Mr. President. And members, I'm going to urge a no vote on the amendment, and I won't speak to the substance of what is being pursued, but only to the procedure about imposing a new mandate on our public health care, or I'm sorry, our private health plans in the state of Minnesota. We're very careful in the Commerce Committee to hear all mandates after they have received a 62J review, and we have a sense of what impact they will have on individual insurance rates throughout the state of Minnesota. We then pass every one of those mandates on to the Health and Human Services Committee, where they consider them on the medical merits of their endeavor. None of that has been done for the proposed new mandate in the Abler Amendment, and I ask members to vote no.
And members, because I was talking, was there a roll call requested on the second half of the amendment that you're taking first? Senator Klein.
I request a roll call.
Roll call requested. Roll call granted. All right. All right. Any other discussion? Senator Dibble.
Thank you, Mr. President. Thank you for the amendment, Senator Abler. This is similar to an amendment in the discussion that we had in committee. Members, first, it's important to know what gender-affirming care is. We heard a lot of hysteria earlier, a lot of talk about the kinds of care provided to minors that actually isn't provided, a lot of graphic descriptions. Gender-affirming healthcare service is perhaps surgical care, perhaps not. It's very much counseling, it's referral services. It's whatever an individual needs to receive to support that individual's gender identity, their gender expression, and all the care that is legal in the state of Minnesota. And Mr. President, it's important to understand that in Minnesota, we pride ourselves on providing world-class care. Gender-affirming care is supported strongly by all the medical and healthcare professional associations. There was discussion earlier about what's happening in Europe. Just like in this country, the subject of our community is being politicized and a lot of pressure is being applied. But the fact of the matter is that to Senator Abler's amendment, Mr. President, the kind of care, and sorry to disagree with Senator Klein slightly here, but the kind of care, as we discussed and made very clear in committee, is very, very few people, less than 1%, opt to reverse and so-called detransition. But that would be covered under this coverage because, of course, this is about affirming someone's gender identity and gender expression. But, Mr. President, I want to talk just for a second about what it means to ask for this kind of coverage and talk about detransitioning, which we heard in the earlier discussion as well. It's to give voice and to emphasize this false notion that people are making a mistake. And that's just simply not the case. And Senator Matthews, you can be as offended as you want. But when you're denying people the essential care they need to be who they are, you are denying those people and trying to, and we heard Senator Gruenhagen talk about science and biology and how this is a myth, and Senator Lucero say the same thing. That is denying the essential humanity and identity of who people are, and it's denying the science and the accepted care. So, to Senator Abler's amendment, two things. One is, it's covered already. Secondly, the follow-up and aftercare, I'm not even sure how that would be effectuated because gender-affirming care is not a point in time or a single event or an activity. It's not a surgery. It's about care, it's about counseling, it's about an ongoing relationship with healthcare providers. So I would encourage a no vote on the A83. Thank you, Mr. President.
Any other discussion? Senator May-Quade.
Thank you, Mr. President. And I rise in opposition to the A83, the second part of this amendment. And, you know, I didn't say it before because we were getting into the inanity of how we've created this extreme hysteria and that gender affirming care is only something that trans people access, and that's not true. And the inanity of this amendment would be, I'm not really sure if it's 2 years, 5 years, and then 10 years after I start birth control for PCOS that I have to go, or is it during, or is it the day I stop? Like, it doesn't make sense. Or is it 1 year, 2 years, 5 years, and 10 years after somebody has a hair transplant or hair plugs, they have to go back and see the person who did that? Or after somebody has lip fillers or Botox, because all of that is gender affirming care. But the thing that I really want to say, Mr. President, is that this increased focus on trans people's bodies and their health care is so divorced from their humanity and the deep understanding that they know who they are, and the attempt to erase their deep, profound sense of self and reduce them to their private discussions with their providers and their families, their doctors, is really, really wrong. And it absolutely should not happen on the floor of the Senate, whether it's children or teens or adults. Trans people are people. They are deserving of full civil and human rights, and the way that we have reduced them to their medical care and their bodies in this chamber is awful. So I urge members to vote no on this because the amendment itself does not make sense, but also we have to have better conversations. Trans Minnesotans exist. They listen to these floor debates, and what we are saying is harmful.
Members, we're on the A83 Abler Amendment. Senator Duckworth, and before Senator Duckworth, is there anyone else who wants to speak before I go to Senator Duckworth and then to Senator Abler, who's the last person that we'll hear from? Senator Duckworth and then Senator Abler, in that order. Senator Duckworth.
Thank you, Mr. President. I appreciate it. I feel compelled to speak on behalf of Senator Abler's amendment for a couple of reasons. Number one, because I know it's extremely well-intentioned. I know it's thoughtful, and I know the author of the amendment's heart. And I know that many of the things that have been said regarding this amendment and its intentions couldn't be further from the truth. And I think when we talk about a certain group of people and don't acknowledge that a pretty large segment of them do exist that have undergone this sort of treatment and have sought to reverse or change that, is not something that should be ignored. Right now, the conversation, if we're talking about ignoring folks, you are ignoring a portion of folks out there who have decided at some point to undergo a transition and have now later decided they would like to transition back. I'm not judging that. I'm not saying whether that's right or wrong. But what I think Senator Abler is trying to say with his amendment is if you're going to require insurance coverage for someone to transition, why wouldn't you also allow it for somebody that wants to transition back if they choose to do so? And I understand Senator Dibble's understanding of this is that that is allowed under the bill, but I don't think that's necessarily the case, nor do I think it's clearly stated that that's allowed under the bill. So let's just take a minute to talk about the humanity of this and what people experience. Just outside this chamber, a couple of weeks ago, I visited with a group of moms who had children, and this was their specific concern. They said, we're not here to judge. We love our children. We support them. We want them to live and have the best possible life they can. And I think most Minnesotans feel that way about their fellow neighbor. But those moms did say that after many of their children decided to pursue gender-affirming care or transitions, for a whole host of various reasons, they felt compelled to or thought it was in their best interest or desired to seek care that transitioned them back to some degree. And now I don't understand why we wouldn't support or allow that to also be covered if that's what somebody genuinely desires and is best for them not only physically, but from a mental standpoint as well, Mr. President. And so I'm not trying to fan the flames of any hysteria as has been mentioned on the floor. I am not trying to dehumanize any certain group of people, certainly not ignoring them. What Senator Abler in his amendment is trying to do is actually give voice to probably the most ignored segment of the very population that we're talking about. The segment of the population that people don't necessarily always want to hear or talk about because the fact that they would want to reverse a decision might somehow mean you were wrong in what you were arguing on their behalf from the very get-go. I'm almost done, Mr. President. So I think this is a chance for us to come together and admit whether you want to or not, or you want to change something. There's a path forward for everybody here, and this amendment allows that to happen. I think there's more agreement here than meets the eye, Mr. President, and it would be a shame if we left those people out of the conversation and did not include them in this bill. Their concerns are valid, and they should be a part of the decision that we're making as it pertains to this bill here this morning, Mr. President.
Senator Abler, you're the last voice we're going to hear before we vote on the second part of the amendment first. Senator Abler.
Well, thank you, and I wish it were daytime, and I wish it was not 3:30, and I didn't choose the time, but I debated even offering this amendment, Mr. President, and to my colleagues, Senator May Quaid and Senator Dibble and Senator Duckworth, thank you for the thoughtful thoughts. I have an expectation that the vote might not be much different than the votes we've just taken before, but maybe this is a different kind of conversation to start. Sometimes we get stuck in just what we're promoting or what we think, and I think Senator Duckworth said it really well. I just want to point out there is a group of people, and they exist, and it's not 1%. You read any of the literature, there's one study that said 1%, but that data was kind of skewed. But it's in at least 2 digits. And so in the committee, we had testimony from a young person, and Camille said that she felt like she was an outcast. And she was, treated well on the way in, and on the way out, she reported what the literature says people report: the loss of peer support, regret, grief, maybe even some of the very suicides that people were attempting to avoid. And just finally, I just want to comment. In the committee, Senator Dibble expressed the opinion that it was already covered. And so I decided to ask my good friends at Blue Cross, one of my favorite health plans. That was a different discussion earlier. And this is their reply to me about the policy. Our medical policy was developed in accordance with the World Professional Association for Transgender Health, WPATH, standards of care, which considers breast and genital surgical interventions for gender-affirming care irreversible. WPATH advises patients have sufficient time to absorb information fully, utilizing a multidisciplinary approach before providing fully informed consent for these irreversible surgical treatments. Our medical policy considers reversal of breast and genital surgical procedures not medically necessary and therefore not covered. And so the individuals who went through the various procedures far beyond the scope in many cases of hair plugs, and not to minimize the value of those to people as they affirm their whatever. But this is a group that's left out. And if this is the first beginning of a discussion to think how do we help these individuals, and if the amendment fails 30-33, I won't think this was a waste of time. And I think Senator Duckworth said it well, and I think the sincere thoughts that Senators Dibble and May Quaid offered are useful in the discussion as well. The world is full of people, and there are certainly quite a range of individuals. And I think we are at the point of what I heard Senator Wiklund say, and her desires of health care is that all are included. And so, and the last thing, the follow-up time, these aren't requirements, these are opportunities. This is what insurance would cover. As you read the literature, there's not a lot of long-term follow-up. And I think as more does come along, that we'll be enlightened by that. So, members, vote as you wish. I would, at some point, but I appreciate the discussion, and maybe this could even pass. Thank you, Mr. President.
The Secretary will take the roll on the A83 amendment. The second half is what we're voting on. Members, please vote. Members, please vote. Senator Friends, for those voting pursuant to Rule 40.7, sir.
Thank you, Mr. President. Senator Bolden votes no.
Senator Bolden votes no.
Senator Dietzick votes no.
Senator Dietzick votes no.
Senator Fateh votes no.
Senator Fateh votes no.
Senator Kunish votes no.
Senator Kunish votes no.
Senator Mann votes no.
Senator Mann votes no.
Senator Marty votes no.
Senator Marty votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Umu Verbatim votes no.
Senator Umu Verbatim votes no.
Senator Pa votes no.
Senator Pa votes no.
Senator Port votes no.
Senator Port votes no.
Senator Zhang votes no.
Senator Zhang votes no.
And Senator Morrison votes no.
And Senator Morrison votes no. Senator Duckworth, for those voting pursuant to Rule 40.7, when you're ready.
Thank you, Mr. President. Senator Anderson votes no.
Senator Anderson votes no.
Senator Dames votes no.
Senator Dames votes no.
Senator Draheim votes aye.
Senator Draheim votes aye.
Senator Housley votes aye.
Senator Housley votes aye.
Senator Miller votes aye.
Senator Miller votes aye.
Senator Weber votes aye.
Senator Weber votes aye.
Senator Wiesenberg votes aye.
Senator Wiesenberg votes aye.
And Senator Howe votes aye.
And Senator Howe votes aye. Just for clarity, Senator Dames voted no. Is that correct? Okay. All senators having voted who desires to vote, the secretary will close the roll. There being 25 ayes and 39 noes, the A83 amendment is not adopted. Now the second part is not adopted. Now we're going to the first part, which is actually the first part. Excuse me, we're going to the second part, which is actually the first part. You got it? Everybody clear? I want to make sure I didn't confuse you too much. We're on the A83. Remember, it was divided. We did the second part of the amendment first. Now we're on the first part of the amendment as the second part. Senator Abler to the first part.
Mr. President, if there are people watching at home, they're really confused now, so that's good. And I just want to commend the body for, I'm not sure we've ever attracted that many no votes on a topic like this, so there's the function of the whole idea of it and then the mandate piece, and I get it. The second part, which is the first part, Mr. President, has to do with abortion, but not abortion itself. There's a mandate in the bill allowing for people to get reimbursed by that, and this amendment does nothing to touch the desires of the authors to retain that privilege, to have insurance pay for that. But there's also, Mr. President, there's at least two groups left out of that. There are the more traditionally thought of individuals who have some remorse for their abortion, and that's a relatively large group of people. And the second group of people are those who had a child that was developing inside of the mother who was incompatible with life. And the idea of perinatal hospice could be available to them. So we don't need to debate very long, Mr. President, the incidence of people that are challenged after their abortion. But I will relate my own story about this. In college, I was pro-choice. I thought, well, when they can breathe, they can live, and that sounds about right for me, for the college sophomore who pretty much knew everything. And then I had a friend who worked at a place called Love Lines. And she was a counselor there, and so people would call up there in distress, and relatively frequent callers were women who would call up post-abortive and talk to these telephone counselors. And as she related to me some of the calls she got, I was surprised to hear that some of these women actually had nightmares and they were tormented for a good long time after the choice they'd made to terminate their child. And I'd never thought of it. And at the time, that was persuasive to me, and I thought, well, maybe there's something to this, and why would it bother them anyway? Because it's, not anything. But that was how I made my transition into the beginning of my own particular journey to believe that there was something something there. And so the experience that I had learning about love lines and the remorse people had is the very point of this part here. And so if insurance is going to pay for abortion, I reason then it should be able to pay for the mental health care for the people that have suffered emotional trauma as a result of that. And the inconvenient truth is that there are those individuals. And I'm not at all going to revisit the debate, Mr. President, that we did for a good number of hours, which I appreciated, even the integrity of that debate. I thought that was a really good debate. But these women do exist, and I would imagine a number of men exist who would like to be treated through their challenges. The second category of individuals are those for whom the child that they have inside of them is truly incompatible with life. And I've run into some of these individuals, one of whom is us. And so there's a certain, and this is only a matter of what insurance would pay for. You can do it however you like. If you discover that your child has expired or never really had a chance, you can certainly go with the immediate method to, solve it. Or some people have found great sustaining, joy is the wrong word, but completion in allowing the process to go to a more natural birth process, perhaps prematurely. And that was our situation. That was our daughter. And my wife said I could tell this story, but she was offered a DNC. It was like after 5 months, and she said, "No, I'm just going to wait," and had the hardest delivery she could imagine. But at the end, it was kind of good that she was allowed to do that. And so the idea of perinatal hospice, where an individual would be supported in that process, is something I think that is something we should consider, so that this family can have the ability to run the process through as they choose. Again, Mr. President, it's a matter of choice. And Mr. President, I have no idea how this one's going to do. There's a mandate, and then the change of idea about the mental health services and so on. But I hope, if this is nothing else, this is the beginning of a discussion to broaden our thinking about along this line of abortions, that there's other people who have been left out of the discussion. And so, Mr. President, if there's a roll call, I'd appreciate that. And I'd also appreciate a green vote. Thank you.
Roll call requested, roll call granted. And members, just so you know what you're voting on the A83, you're voting on the lines 1.2 to 1.8, just so that we're clear. Senator Wickland, to the A83.
Thank you, Mr. President. I would urge members to vote no. I believe that the care that would be sought for mental health needs is covered, and we don't need to call that out separately. And then same as care for someone who loses a child or loses the fetus at a late stage, that coverage is already provided for. So members, please vote no.
Any other discussions on the A83? If none, I'm just going to make sure the author has nothing else to say. The secretary will take the roll on the A83, lines 1.2 to 1.8. Members, please vote. Senator Friends, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Bolden votes no.
Senator Bolden votes no.
Senator Dietzick votes no.
Senator Dietzick votes no.
Senator Fateh votes no.
Senator Fateh votes no.
Senator Kunish votes no.
Senator Kunish votes no.
Senator Mann votes no.
Senator Mann votes no.
Senator Marty votes no.
Senator Marty votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Umu Verbatim votes no.
Senator Umu Verbatim votes no.
Senator Pa votes no.
Senator Pa votes no.
Senator Port votes no.
Senator Port votes no.
Senator Zhang votes no.
Senator Zhang votes no.
And Senator Morrison votes no.
And Senator Morrison votes no. Senator Duckworth, those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Anderson votes aye.
Senator Anderson votes aye.
Senator Dames votes aye.
Senator Dames votes aye.
Senator Draheim votes aye.
Senator Draheim votes aye.
Senator Housley votes aye.
Senator Housley votes aye.
Senator Miller votes aye.
Senator Miller votes aye.
Senator Weber votes aye.
Senator Weber votes aye.
Senator Wiesenberg votes aye.
Senator Wiesenberg votes aye.
And Senator Howe votes aye.
And Senator Howe votes aye. All senators having voted who desires to vote, the secretary will close the roll. There have been 30 ayes and 34 nays. The A83 Abler Amendment is not adopted. Senator Uckey.
Thank you, Mr. President. I would offer the A84 amendment.
Senator Uckey offers the A84 amendment. The secretary will report the A84 amendment.
Senator Rutke moves to amend Senate File Number 4699 as follows. Page 65, line 5, delete end. This is the A84 amendment.
Senator Uckey, to your A84 amendment.
Thank you, Mr. President. This amendment is what we typically refer to in committee as mostly technical, and the changes are basically technical. They make sure that the prescribing that those, it's getting to where I'm getting the words twisted in my, but anyhow, it makes sure that those prescribing these devices, and it's talking about the prosthetics, that they are licensed for this work and that the devices are medically necessary. This is to avoid fraudulent practices by providers, which in turn will protect our patients. This also makes changes to ensure reimbursement is only for the covered services. And the changes are effective, the changes effective date is moved to 1/1/2026 to ensure the plans have enough time to enact this mandate. That move would be good no matter what for that part of this bill. But Mr. President, as you see, it is mostly technical. It's just ensuring that the providers or the persons making this or prescribing these prosthetics are licensed, which we would just assume in that field that they would be, and then just looking at the new dates. So I would hope that Senator Wiklund would find this a technical amendment and be able to work with us. Thank you, Mr. President.
Senator Wiklund to the A84 amendment.
Mr. President, Senator Utke, we have had contact with people who have been involved with this particular mandate and coming to our office to tell us about language changes or language, and nobody has come and talked to us about this. And so I really am very hesitant to adopt a long amendment like that without having confirmed. And I do not want to change the date of an act or the date for activating it. So if you would like me to do some checking after we're done with this bill, I can do that with the person that we've been working with, and we can see if there are some of these changes that we can make in conference committee. But I do not wish to adopt the amendment at this time. Thank you.
Any other discussion? And I naturally assume, Senator Uckey, you did not request a roll call. Is that correct? Any other discussion before we go to the author of the 884? Seeing none, Senator Uckey.
Thank you, Mr. Chair. And actually, if I could just clarify with Senator Wickland, if she would yield for a question.
Senator Wickland, will you yield? She will yield. Senator Uckey.
Thank you, Mr. President. And Senator Wickland, I think I caught that you'd be willing to take this and try to work on it another step to see if we could make this work and before we finalize the bill. It's a full page, but most of it it gets repeated in a couple different places. So in the end, it's pretty minor. So Senator Wickland, if that is agreeable, then I could withdraw the amendment and we continue to work on it.
Senator Wickland.
Mr. President, if Senator Utke, if you withdraw the amendment, we can take it back and review it and discuss it further and assess all of the language and see if all of it is technical or parts, and then if there are parts that we could amend in conference committee, I can bring those forward.
Senator Uckey.
Thank you, Mr. President. I would withdraw the A84 then, and we'll continue to work through this one.
Senator Uckey withdraws the A84. Senator Uckey, your next amendment.
Thank you, Mr. President. I would offer the A79.
Senator Uckey offers the A79. The Secretary will report the A79.
Senator Etke moves to amend Senate File Number 4699 as follows. Page 89, line 27, delete must and insert may. This is the A79 amendment.
Senator Uckey to your A79 amendment.
Thank you, Mr. President. Members, this one's, if you kind of follow along or if you want to follow along, it starts on page 86. But that section of the bill pertains to the notice of closing or curtailing operations, relocating services, or ceasing to offer certain services in hospitals. And there's various things that we could have done in there. It talks about there was days that were adjusted and such, but we're going to go back to the tail end of that section, which is actually on page 89, and we're going to address the penalties portion, and that's where this amendment comes in. It's just a real simple, short amendment, and we're just changing the word must to may, and what that's talking about is the penalties, and it's the commissioner, we would like that to say may impose on the controlling persons of a hospital or a hospital campus, and then it goes into the fines. And it's talking about fines up to $20,000 for each failure and a cumulative up to a possible $60,000. But we think the must is pretty harsh, and we'd sure like to see may in that spot. And then, of course, you'll notice that there's one more change in it, that the commissioner is not required, is the way it's currently set up, and we'd like that then by removing the word not, so that the commissioner is required to issue a correction order before imposing the fine. So it's just a little more workable, a little softer presentation to that, because it seems those are some pretty large numbers for these penalties. So I would like you to please support this. Thank you.
Senator Wickland, your thoughts on the A79 amendment.
Mr. President, I am going to have to oppose this amendment. This provision came from a bill that Senator Kupek carried, and as introduced, it needed more work, and he worked on it through the course of the session and really negotiated compromises and negotiated the language. And so at this time, I do not want to change those words. So I oppose the amendment. Thank you.
Senator Uckey. Before Senator Uckey, is there anyone else who wants to speak before the author of the A79 speaks? Seeing none, Senator Uckey.
Thank you, Mr. President. And I think on this one, I would like to call for a roll call.
Roll call requested. Roll call granted.
And just backing up, members, this is, from the way I read it and the way I've looked at it all along, is this is a pretty harsh penalty. These are facilities that are already in challenging times, and then we're talking numbers as large as these. We're just trying to soften this blow. They can't help it. They didn't get in this predicament on purpose. I just think this is a little aggressive. So I would ask for your support and a green vote.
The Secretary would take the roll on the A79 amendment. Members, please vote. Senator Duckworth, those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Anderson votes aye.
Senator Anderson votes aye.
Senator Dames votes aye.
Senator Daines votes aye.
Senator Draheim votes aye.
Senator Draheim votes aye.
Senator Housley votes aye.
Senator Housley votes aye.
Senator Miller votes aye.
Senator Miller votes aye.
Senator Weber votes aye.
Senator Weber votes aye.
Senator Wiesenberg votes aye.
Senator Wiesenberg votes aye.
And Senator Howe votes aye.
And Senator Howe votes aye. Senator French, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Bolden votes no.
Senator Bolden votes no.
Senator Dietzick votes no.
Senator Dietzick votes no.
Senator Fateh votes no.
Senator Fateh votes no.
Senator Kunish votes no.
Senator Kunish votes no.
Senator Mann votes no.
Senator Mann votes no.
Senator Marty votes no.
Senator Marty votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Umu Verbatim votes no.
Senator Umu Verbatim votes no.
Senator Pa votes no.
Senator Pa votes no.
Senator Port votes no.
Senator Port votes no.
Senator Zhang votes no.
Senator Zhang votes no.
And Senator Morrison votes no.
And Senator Morrison votes no. Any other votes? All having voted who desires to vote, the Secretary will close the roll. There have been 30 ayes and 33 noes or nays. The A79 Uckey Amendment is not adopted. Senator Grudenhagen.
I think we're on our last amendment, right? I want to offer the A75.
Senator Grudenhagen offers the A75. The Secretary will report the A75.
Senator Gruenhagen moves to amend Senate File number 4699 as follows. Page 62, delete Section 21 and insert. This is the A75 amendment.
Senator Grudenhagen, to your A75 amendment.
Well, thank you. Excuse me. Thank you, Mr. President and members. This is a compromise. What it does, and remember, we've had a strong, heated, and emotional debate on these issues, abortion and gender-affirming care. And I'm not going to spend a lot of time on it. The only thing I'll say is one of my resources is Gays Against Groomers. They're a group of homosexuals that oppose the gender-affirming care, and they put out good information. The other thing, no matter how many times you have surgery, you can't change your XX or your XY. But besides that, what this amendment would do, it would make the health insurance mandate of abortion and gender-affirming care optional. In other words, if someone wanted to add it to their plan, they could. If they chose not to, they wouldn't have to. I think that's a nice compromise. I think we have a lot of division in our state and nation, and even here on the Senate floor on this issue. And I think this would provide a bridge to at least some type of a workable compromise. With that, we've had a lot of discussion. I'm not going to belabor this. I would ask for a roll call.
Roll call requested. Roll call granted. Senator Wickland to the A75.
Mr. President, I would urge members to vote no. I mean, the point of having these in the bill as a mandate that requires the health plans to provide this. I mean, today they could provide, may provide coverage for these items. That's the way it is today. They could do that. And so we don't see them coming forward with plans that do provide that coverage. And hence, we are putting these provisions for the mandates in the bill. So members, please vote no.
Any other discussion before I go to the author if he has any last words? He doesn't have any last words. The secretary would take the roll on the A75 amendment. Senator French, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. I report Senator Bolden votes no.
Senator Bolden votes no.
Senator Dietzick votes no.
Senator Dietzick votes no.
Senator Fateh votes no.
Senator Fateh votes no.
Senator Kunish votes no.
Senator Kunish votes no.
Senator Mann votes no.
Senator Mann votes no.
Senator Marty votes no.
Senator Marty votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Umu Verbaeten votes no.
Senator Umu Verbaeten votes no.
Senator Pa votes no.
Senator Pa votes no.
Senator Port votes no.
Senator Port votes no.
Senator Zhang votes no.
Senator Zhang votes no.
And Senator Morrison votes no.
And Senator Morrison votes no. Senator Duckworth, those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Anderson votes aye.
Senator Anderson votes aye.
Senator Dames votes aye.
Senator Dames votes aye.
Senator Draheim votes aye.
Senator Draheim votes aye.
Senator Housley votes aye.
Senator Housley votes aye.
Senator Miller votes aye.
Senator Miller votes aye.
Senator Weber votes aye.
Senator Weber votes aye.
Senator Wiesenberg votes aye.
Senator Wiesenberg votes aye.
And Senator Howe votes aye.
And Senator Howe votes aye. All members having voted who desires to vote, the secretary will close the roll. There being 30 ayes and 34 nays, the A75 Gruenhagen amendment does not prevail. The secretary will give the bill its third reading.
Senate File Number 4699, a bill for an act relating to state government, modifying provisions governing health care, health insurance, health policy, etc.
Third reading. Any other final discussions on Senate File 4699 before we go to the author of the bill? Senator Abler.
Well, thank you, Mr. President and members. I think it was a nice discussion. I just wanted to offer, and I appreciate all our comments from everybody. I just wanted to offer a thought on where we're going with health care in our state, and my concerns. Just this is the health bill, and it's even though some of the things are coming in the commerce bill, we have the big miracle of the Affordable Care Act was adding pretty much single adults into state and federally funded programs, and some other items as well, which we could have done just with state laws. But that's created an ever-increasing amount of individuals going into state and federally funded programs, particularly Minnesota Care and medical assistance programs, as we've expanded those soon to include undocumented individuals. And that is really having quite an effect on the ability of hospitals to stay intact. As we go down the road, it seems like we're, at least the Senate, the will of the Senate majority is to go down to the road with the public option. I want to caution individuals to be careful what you ask for. Is be paid at Medicare rates, which is well known to be below the cost of many hospitals, and it will tend to exacerbate the challenges we're facing now, as we talked about, the very thing about closing hospitals and the ability of people to get the care they need. Interestingly enough, for the very individuals who are the ones most in need of it, BIPOC, economically challenged individuals, and the like. I also want to caution this body in the direction it's going in by not doing reinsurance, which is a trend that we seem to be on. It will largely very much affect the pricing of insurance. And when the ARPA funds expire, it's thought that the MNsure prices are going to go up by 30% or more for individuals who have been enjoying that coverage. That will become unaffordable to individuals, and as the gap, while that expires, will be maybe 2 years before the public option takes over to pick up these individuals who have lost their coverage. And so I really urge people to think it through about what we're doing. Minnesota could be a leader in helping helping get health care for its individuals. If we're not careful, we're going to continue down the path, which is actually going to cause whatever's going on today to look like the good old days. And we will not like that. So I urge wisdom, and I urge, Mr. President, collaboration with people whose views diverge on how to do it. Out of that will come something we're proud of. Minnesota Care came out of a convergence of, I think, 6 individuals who put their heads together and came up with a better plan in a bipartisan way. I urge the leadership here to do the same thing and make Minnesota healthcare something we can be proud of. Thank you, Mr. President.
Members, any final discussions on Senate File 4699 before I go to the author of the bill? Seeing none, final comments by Senator Wickland.
Well, thank you, Mr. President, and thank you, members. I really appreciate all of the discussion we've had tonight. I think I encourage you to vote green on this bill. I think the lively discussion points out some of the provisions in the bill, but I hope that you will consider all of the great provisions that we've included. I believe this bill will have a substantial positive impact on the well-being and the health of Minnesotans all over the state. Again, I really appreciate the discussion tonight, and I want to, before I close, I just want to make sure that I give a thank you to the huge team that we have that works on such a massive undertaking as the HHS committee and getting this bill to this point. So I just want to thank pages for our committee this year, Kylan Johnson, Will Olson, interns Maggie Mills and Samantha Schaefer, committee members who all contributed a great deal to our committee, Vice Chair Senator Mann, lead Senator Utke, and members Senator Abler, Senator Bolden, Hoffman, Senator Kupek, Senator Liskey, and Senator Morrison. Our Senate Council is fantastic and amazing, and we need 3 of them. Ali Hoffman-Litchie, Nolan Hodala, and Liam Monahan all made very significant contributions and huge amounts of time to get this bill prepared for us tonight. The fiscal analyst, Dennis Albrecht, my great thanks to him and all of the time and effort to get this to this point. And the HHS team, including researchers, thank you to Republican researcher Larissa Fisher and our DFL researcher Emily Spiteri, and then my team, Haley Ryan, my CLA, and Anna Burke, my CA, and I wouldn't be able to get things to this point without them. So thank you all very much, and members, please vote green.
The Secretary will take the roll on final passage as amended of Senate File 4699. Members, please vote. Senator Friends, for those who are voting pursuant to Rule 40.7.
Thank you, Mr. President. I report Senator Bolden votes aye.
Senator Bolden votes aye.
Senator Dietzick votes aye.
Senator Dietzick votes aye.
Senator Fateh votes aye.
Senator Fateh votes aye.
Senator Kunish votes aye.
Senator Kunish votes aye.
Senator Mann votes aye.
Senator Mann votes aye.
Senator Marty votes aye.
Senator Marty votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
Senator Umu Verbatim votes aye.
Senator Umu Verbatim votes aye.
Senator Pa votes aye.
Senator Pa votes aye.
Senator Port votes aye.
Senator Port votes aye.
Senator Zhang votes aye.
Senator Zhang votes aye.
And Senator Morrison votes aye.
And Senator Morrison votes aye. Senator Duckworth, those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Anderson votes no.
Senator Anderson votes no.
Senator Dames votes no.
Senator Daines votes no.
Senator Draheim votes no.
Senator Draheim votes no.
Senator Housley votes no.
Senator Housley votes no.
Senator Miller votes no.
Senator Miller votes no.
Senator Weber votes no.
Senator Weber votes no.
Senator Wiesenberg votes no.
Senator Wiesenberg votes no.
Senator Howe votes no.
Senator Howe votes no.
And Senator Nelson votes no.
And Senator Nelson votes no. All having voted who desires to vote, the Secretary will close the roll. There being 34 ayes and 31 nays, the bill is passed and its title agreed to. Members, I'm calling on Senator Murphy for a motion.
Thank you, Mr. President. I move that House File 3204 be taken from the table.
All in favor say aye.
Aye.
All those opposed say no. No. The motion prevails. Senator Murphy to designate special orders.
Mr. President, pursuant to Rule 26, I designate House File 3204 be made a special order for immediate consideration.
And that is a part of your special orders, members. House File 3204. Senator Westland.
Thank you, Mr. President and members. We will hopefully get through this in a good, orderly way. Mr. President, I would like to make a motion to amend House File number 3204 as follows. Delete everything after the enacting clause and delete the title of House File number 3204 and insert the language after the enacting clause and the title of Senate File number 2759, the first engrossment.
Thank you, Senator. Senator Westland moved to amend. Well, the Secretary will report the motion.
Senator Westland moves to amend House File number 3204 as follows. Delete everything after the enacting clause, etc. This is the A50 amendment.
Thank you. Senator Westland moved to amend House File number 3204 as follows. Delete everything after the enacting clause and delete the title of House File number 3204 and insert the language after the enacting clause and the title of Senate File number 2759, the first engrossment. All in favor say aye. All those opposed say no. The motion prevails. Senator Westland.
Thank you, Mr. President. I will do a brief overview of the bill, and then I do have an A1 amendment that I will offer after walking through the bill. This bill represents a significant amount of work by stakeholders that include the American Academy of Matrimonial Lawyers, the Bar Association. As you will notice, letter in your information today, the National Parents Organization has worked with stakeholder groups on Article 1 dealing specifically with parenting time. One of the provisions, Section 1, specifically adds parenting time and references to parenting time statutes in order to have a consistent parenting time evaluation process for those who are parents that have never been married. We do have a public policy statement in here. We had a discussion about this in the Judiciary Committee. The public policy statement is actually a very important part of this bill in that it does provide a framework for which, through which the court should be addressing custody and parenting time proceedings. The public policy of the state is to ensure that each child has frequent and substantial contact with the child's parents, as long as the child's parents have shown the ability to act in the best interest of the child, to ensure that parents and caregivers provide a safe and nurturing environment for each child, and encourage parents to share the rights and duties of raising their child. This is, in fact, what family law practitioners and family court judicial officers attempt to do on a daily basis, helping families through a process that is complex and that is often difficult. As you work through Article 1, Mr. President and members, I would probably highlight one change in here that will be significant and very helpful for parties who are going through the divorce process. At this time, if parties need to seek temporary relief from the court, they have to get a motion hearing that can take anywhere from 2 to 3 months or longer. Once that hearing has taken place, it can take up to 90 days for a judge to issue an order. This, Section 4, provides that the court must give priority to scheduling and holding an expedited hearing for temporary relief when there is a credible allegation that a party is being denied parenting time and where someone is being unreasonably denied access to financial resources. The court has to give that a priority, and I can tell you from my own personal experience practicing family law that getting these types of cases in early, getting resolution to them early, sets that case on an entirely different trajectory and addresses issues of an urgent need. There are some brief changes to attorney's fees collection. The other big change that I would note is another area of the law that is subject to fairly significant litigation, and that's the area of spousal maintenance. This article is the result of a number of years of negotiation and work between the Bar Association, the American Academy of Matrimonial Lawyers, and a number of other stakeholder groups. This will provide considerable clarity for the court in terms of setting maintenance, determining the amount, but also determining a duration that will be much more clear. That is Article 2. We do have some additional technical changes in Article 3, antenuptial and postnuptial agreements. This actually creates a single standard for antenuptial agreements for both non-marital and marital property. There was case law, and this is codifying that case law. Article 4 is actually incorporated. This is Senator May Quade's bill. It deals with assisted reproduction and orders of parentage. After I do the amendment, I will certainly direct questions regarding that particular article to Senator May Quade, and she can discuss really the significant importance of this. It's called Logan's Law. And at this time, Mr. President, then I would like to offer the A1 amendment.
Senator Westland offers the A1 amendment. The Secretary will report the A1 amendment.
Senator Westland moves to amend House File Number 3204 as amended by the Senate May 3rd, 2024 as follows. Page 12 after line 5, insert. This is the A1 amendment.
Senator Westland to your A1 amendment.
Thank you, Mr. President. I would request a roll call on the amendment.
Roll call requested, roll call granted. Senator Westland.
Thank you, Mr. President. This is primarily technical and grammatical corrections that have been suggested by the Revisor's Office. You will note, however, on line 1.21 through 1.25, this is language specifically that was negotiated between Senator May Quade and two stakeholder groups that is being added by agreement. And I would ask members to vote for the A1 amendment that will put this bill in the order that it should be in as it moves forward.
Senator Kroon.
Thank you, Mr. President. Thank you, Senator Westland, for this amendment, and thank you to Senator May Quade for negotiating this language with the Catholic Conference and the Bar Association, and I would encourage members to vote yes. Thank you.
Senator Westland, would you still like the roll call vote?
I will withdraw my request for roll call.
All in favor of the A1 amendment say aye. All those opposed say no. The motion prevails. The A1 is adopted. Any further amendments, discussion? Senator Lucero.
Thank you, Mr. President. I would like to offer the A53.
Senator Lucero offers the A53 amendment. The Secretary will report the A53 amendment.
Senator Lucero moves to amend House File Number 3204 as amended by the Senate May 3rd, 2024 as follows. Page 6, line 26 after legal, insert and physical. This is the A53 amendment.
Senator Lucero to your amendment.
Thank you, Mr. President. This seeks to change presumptive custody from 25% to 50%. I am not asking for a roll call. I encourage a green vote.
Senator Westland.
Thank you, Mr. President. Thank you, Senator Lucero, for bringing this amendment. I'm asking members to vote no. There are many reasons why our current system works well. We have 12 best interests of the child factors that are detailed, they are child focused, and they ensure that the court makes specific findings as to why a particular arrangement of parenting time is appropriate for the child. This would create a legal presumption that presupposes an outcome of equal parenting time, especially in cases where that simply may not be appropriate. Under the current circumstances, Mr. President, members, it's my understanding that I believe more than 50% of cases at this time already result in an equal parenting time schedule. And again, Mr. President, I would request that members vote no.
Any other discussion on the A53? Seeing none, all in favor? Oh, Senator Friends.
Thank you, Mr. President. I would like to request a roll call.
Roll call requested, roll call granted. The secretary will take the roll on the A53. Members, please vote. Senator French, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. I report Senator Bolden votes no.
Senator Bolden votes no.
Senator Dietzick votes no.
Senator Dietzick votes no.
Senator Fateh votes no.
Senator Fateh votes no.
Senator Kunish votes no.
Senator Kunish votes no.
Senator Mann votes no.
Senator Mann votes no.
Senator Marty votes no.
Senator Marty votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Umu Verbaeten votes no.
Senator Umu Verbaeten votes no.
Senator Pa votes no.
Senator Pa votes no.
Senator Port votes no.
Senator Port votes no.
Senator Zhang votes no.
Senator Zhang votes no.
And Senator Morrison votes no.
And Senator Morrison votes no. Senator Duckworth, those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Anderson votes aye.
Senator Anderson votes aye.
Senator Dames votes aye.
Senator Daines votes aye.
Senator Draheim votes aye.
Senator Draheim votes aye.
Senator Housley votes aye.
Senator Housley votes aye.
Senator Miller votes aye.
Senator Miller votes aye.
Senator Weber votes aye.
Senator Weber votes aye.
Senator Wiesenberg votes aye.
Senator Wiesenberg votes aye.
And Senator Howe votes aye.
And Senator Howe votes aye. All senators having voted who desires to vote, the secretary will close the roll. There being 26 ayes and 37 noes, the A53 amendment is not adopted. Senator Lucero.
Thank you, Mr. President. I would like to offer the A54.
Senator Lucero offers the A54 amendment. The secretary will report the A54 amendment.
Senator Lucero moves to amend House File Number 3204 as amended by the Senate May 3rd, 2024 as follows. Page 6, line 26, after legal, insert and physical. This is the A54 amendment.
Senator Lucero, to your A54 amendment.
Thank you, Mr. President. Whereas the last amendment changed presumptive custody to 50%, this amendment changes it to 40%. And so current law is a presumptive custody of 25%. And then the additional 50% is negotiated. This makes it walking into a negotiation, a presumptive custody of 40% to each parent, with a remaining then of 20% to negotiate. Now, when I was in the other body, I was on the Civil Law Committee, and there was a hearing one day on this issue, presumptive custody. And it was a heartbreaking hearing, listening to the parents and the unfortunate outcomes of these presumptive custodies. And I won't get into all the stories, just being very brief here. It was just heartbreaking. And I think the 25% is too low. And obviously there wasn't agreement on the 50%. But I'm hoping that something higher than 25%, something lower than 50%, which is what we have before us, would be agreeable. And I would encourage a green vote. Thank you, Mr. President.
Are you requesting a roll call vote?
I am not.
Senator Westland.
I request a roll call, Mr. President.
Roll call requested, roll call granted. Senator Westland.
Thank you, Mr. President. We first should clarify our terms here. It is quite common that people come in and interchange custody and parenting time. They are actually two separate concepts. Parenting time is the schedule that a child spends with either parent. Custody is a completely different concept. We do have a presumption in statute that is reaffirmed in this bill that the 25% parenting time is a floor, not a ceiling. And again, when you create a presumption for a particular percentage of parenting time, it is a burden-shifting move. There are many, many reasons why a court may need to order something less than equal parenting time, may order less than 40% parenting time. It can be something as innocuous as the fact that parents live 100 miles away from each other. It could be it's an infant who may be nursing. It may be domestic violence. It could be many other things. But what we know is that when we use the best interest factors, which are child-focused, 12 factors, that those factors result in a child-focused result. Please vote no.
Any other discussion on the A54? The secretary will take the roll on the A54. Roll call was requested and a roll call granted. Senator Duckworth, those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Anderson votes aye.
Senator Anderson votes aye.
Senator Dames votes aye.
Senator Daines votes aye.
Senator Draheim votes aye.
Senator Draheim votes aye.
Senator Housley votes aye.
Say the last one again.
Senator Housley votes aye.
Senator Housley votes aye.
Senator Miller votes aye.
Senator Miller votes aye.
Senator Weber votes aye.
Senator Weber votes aye.
Senator Wiesenberg votes aye.
Senator Wiesenberg votes aye.
And Senator Howe votes aye.
And Senator Howe votes aye. Senator Friends, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Bolden votes no.
Senator Bolden votes no.
Senator Dietzick votes no.
Senator Dietzick votes no.
Senator Fateh votes no.
Senator Fateh votes no.
Senator Kunish votes no.
Senator Kunish votes no.
Senator Mann votes no.
Senator Mann votes no.
Senator Marty votes no.
Senator Marty votes no.
Senator McEwen votes no.
Senator McEwen votes no.
Senator Umu Verbaeten votes no.
Senator Umu Verbaeten votes no.
Senator Pa votes no.
Senator Pop votes no.
Senator Port votes no.
Senator Port votes no.
Senator Zhang votes no.
Senator Zhang votes no.
And Senator Morrison votes no.
And Senator Morrison votes no. All having voted who desires to vote, the secretary will close the roll. There have been 24 ayes and 39 noes. The A54 Lucero Amendment is not adopted. Any other amendments? Seeing none, the secretary will give the bill its third reading.
House File Number 3204, a bill for an act relating to family law modifying parenting time and spousal maintenance provisions.
Any third reading? Any other discussions before we go to final passage? Senator McQuaid.
Thank you, Mr. President. Just given the hour, I just have a tight 30-minute commentary about the bill. No, there's a really important provision in this bill that's important to so many families, including my own in Minnesota, and my constituents actually are Logan's moms, and that's how we got Logan's Law, which is going to allow moms of their kids to not have to adopt their children upon birth, but actually just be named their parents. I'm so, so proud of the work that went into getting this passed, and I want to thank everybody for making sure it got across the finish line, and shout out to Logan's moms, and thank you so much. Vote green.
Any other discussion before we go to the author for final comments before final vote on passage? Senator Westland.
Thank you, Mr. President. I just simply want to thank all of the stakeholders who worked a number of years to bring these provisions forward. It's been my pleasure as a family law attorney to be able to chief author this bill. It is a good bill. Please vote green.
The secretary will take the roll on final passage of of House File 3204 as amended. Members, please vote. Senator French, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. I report Senator Bolden votes aye.
Senator Bolden votes aye.
Senator Dietzick votes aye.
Senator Dietzick votes aye.
Senator Fateh votes aye.
Senator Fateh votes aye.
Senator Kunish votes aye.
Senator Kunish votes aye.
Senator Mann votes aye.
Senator Mann votes aye.
Senator Marty votes aye.
Senator Marty votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
Senator Umu Verbatim votes aye.
Senator Umu Verbatim votes aye.
Senator Pa votes aye.
Senator Pa votes aye.
Senator Port votes aye.
Senator Port votes aye.
Senator Zhang votes aye.
Senator Zhang votes aye.
And Senator Morrison votes aye.
And Senator Morrison votes aye. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Anderson votes aye.
Senator Anderson votes aye.
Senator Dames votes aye.
Senator Dames votes aye.
Senator Draheim votes aye.
Senator Draheim votes aye.
Senator Housley votes aye.
Senator Housley votes aye.
Senator Miller votes aye.
Senator Miller votes aye.
Senator Weber votes aye.
Senator Weber votes aye.
Senator Howe votes aye.
Senator Howe votes aye.
Thank you, Mr. President. Senator Nelson votes aye.
And Senator Nelson votes aye. All having voted who desires to vote, the Secretary will close the roll. There have been 62 ayes and 0 noes. The bill is passed and its title agreed to. Members remaining under motions of resolutions will revert to the third order of business. Messages from the House. The Secretary will read the message.
Mr. President, I have the honor to announce the passage by the House of the following House file herewith transmitted. House file number 5247.
Members, no action is required. The next order of business is the fourth order of business, first reading of House bills. The Secretary will give the House file its first reading.
House file number 5247, a bill for an act relating to taxation.
House file number 5247 will be referred to the Committee on Rules and Administration for comparison with Senate file number 5234. Members, we will now resort to the 13th order of business, announcements of Senate interests. Without objection, the following members will be excused. Senator Abler from 10 to 11:20 a.m., Dames from 10 a.m. to 12:30 p.m., Senator Green from 10:55 a.m. to 11:55 a.m., Senator Johnson from 10:55 a.m. to 11:55 a.m., Eichhorn from 12:45 p.m. to 3 o'clock p.m., Liskey from 12:40 p.m. to 12:50 p.m., Draheim from 4 p.m. to 4:05 and 8:40 to 8:50 p.m., Westrom from 4:15 to 5:25 p.m. and 6 p.m. until the end, Senator Kroon from 4:35 to 4:40 p.m., Senator Farnsworth from 5:10 p.m. to the end, Senator Howell from 5:30 to 9:30 p.m., Cole, Jasinski, and Lang from 7:15 p.m. to 7:35 p.m., Duckworth from 10:10 to 10:20 p.m. and 4:20 to the end, Miller from 10:10 to 10:20 p.m., and Nelson from 3 o'clock to 4 a.m. and 4:15 to 4:20 a.m. Any other announcements of Senate interest? Without any further announcements, I call on Senator Murphy for a motion to adjourn.
Thank you, Mr. President. You are, of course, the president that serves the Senate, but tonight I think you are the president of endurance. Thank you. Mr. President, I move that the Senate do now adjourn until Monday, May 6th at 11 a.m.
On that motion, all in favor say aye. All those opposed say no. The motion prevails. The Senate is now adjourned. Have a great weekend.